India, the rate of mental health practitioners is 0.3 for every 1 lakh people as per the World Health Organization.
There is a great gap that exists between the providers of help and people in need.
With this global pandemic, things have gotten worse, and it is predicted that after this, we will be having a mental health pandemic.
We are a growing population with complex issues but not enough resources for help.
Psychology is seen as an interesting blend of science and art. It is becoming a popular choice for many students.
However, there exists a taboo regarding mental health and the field of psychology. This prevents a large section of society in urban India from seeking help, while rural India suffers from lack of resources.
The mental health scenario in our nation is highly disorganized to pockets which are inaccessible to the most. The regulatory bodies are not structured either.
All these reasons have added a lot of instability and lack of guidance for students who want to come in the field as well as have a rewarding career.
There's a huge scope and demand in psychology despite what people might be telling you. So come join with us and explore the field of psychology as well as latest trends which you might have never heard before.
I'm super excited to talk about Encyclopedia event. It's one of its kind in the world. It is designed by the student for the student. There are eminent speakers coming from the various field of psychology to discuss, to answer all your kind of a question, whether you are a PhD student, you are a UG student or PG student or school student.
A very, very good morning to each and everyone present here this morning. Thank you so much for joining us on a Sunday morning. I am Angela Arikat, your host this fine morning and one of the head organizers for this event. With immense pleasure, I take this opportunity on behalf of my fellow colleagues Gloria D'Souza and Ria Khankar to welcome you to day 3 of 3G School of Applied Psychology's International Psychology Career Summit Encyclopedia 2021. Throughout today, we present to you eminent industry experts from various domains of psychology to help you expand your horizons, get authentic information, and gain valuable insights to help you make the best out of your career in psychology. Also, stay tuned today for our grand finale session today by none other than Dr. Brian R. Little. With that said, over to Sumedha to introduce our very first speaker today.
Good morning, ladies and gentlemen. I take the privilege to invite our very first speaker for the day, who is none other than Dr. Charanteja Koganti. Dr. Charanteja Koganti is a renowned neuropsychiatrist from Hyderabad. He has been working as a consultant with KIMS Hospital, Kondapur, and as an assistant professor at VRKMC, mentoring many junior doctors. His areas of expertise include mental health issues such as stress, depression, anxiety disorders, sleep disturbances, addiction, sexual disorders, behavioral disorders, and other psychological difficulties, including interpersonal relationships and stress management. He is a part of multiple research projects about neurological and psychological brain health and has published many research papers in reputed journals and medical conferences. He is actively involved with international schools for sex education and proactively teaching stress management strategies to many multinational corporations. So, ladies and gentlemen, join me in welcoming Dr. Charanteja Koganti with a huge round of virtual applause. So, as much as we would love to listen to you for as long as we can, we are obliged to follow a few time constraints, and hence we would be hearing a short buzzer 5 minutes prior to the session ending time and a long buzzer exactly at the end time of the session. In saying that, over to you, sir. Thank you.
Thank you for the introduction. So on a Sunday morning, there's a lot of pressure to keep all of you hooked to the talk, because it has to be worth it for you to wake up this early. So as it was mentioned that I'm Dr. Charan. I'm a consultant neuropsychiatrist. I think here today we're talking about something very important and something that is very relevant. A lot of people, especially when you're having a mental health condition for the first time, we all are usually very stumped about, should we see a psychiatrist or should we see a psychologist? There's a lot of questions and doubts about it, and I think people usually Google and check. While she was introducing me, even I tend to Google and see, is it actually a thing? It happens to be, they have like I think 20 or 30 pages on the Google just to giving information out whether you should see a psychiatrist or a psychologist for a mental health condition. Everywhere it's mentioned that both the doctors will help in treating a mental health condition, but both have a very different approach towards mental health treatment. And some said that I'll actually read it out to you. I think that would be better. So it's one of the most I think most common answer is that, should I see a psychiatrist or a psychologist? So this particular website says that if you want to spend time talking about an issue and working through it one-on-one session, a psychologist might be a good fit for you. But if you are interested in pursuing a psychiatric medication for symptom relief for a mental health disorder, you may want to start by talking with the psychiatrist. This is what is given. So I think I'm not very happy with all these 30 pages, the information that they gave. I believe in psychiatrists and psychologists working hand in hand rather than these both being treatment choices. Well, if you ask me about an allopathy or Ayurveda or homeopathy, that's a treatment choice. So you can't work with all the three branches. But when you talk about psychiatry and psychology, you can't choose. You have to, most of the situations, I think you will have to work with both. But I'll tell you in which situations it's purely psychiatry and which situations it's purely psychology. So I'll get a little medical here. I hope it's not very boring. Uh, anyways, so firstly, understand a little bit about mental health. So mental health, a lot of people think that, it is about what we feel and what we think and what we perceive around in our environment. Our thoughts, feelings, emotions, and behaviors is what, and emotions, like I think mentioned. This constitutes for mental health, which is true, but just know that these psychological symptoms doesn't mean they're not, they don't come from your brain. So most of these come from your brain. As I'm talking to you, I'm thinking and talking to you. So the thought is coming from my brain. There's a part of the brain that is dealing with thought. Also my behavior or my emotion, everything is dealt with different areas of the brain, and brain is an intricate organ. It has multiple areas that deals with many functions. If I'm moving my hand like this, a brain is dealing with it. If I'm moving my lips, or if I'm articulating my thoughts, even that is dealt by brain. So no surprise that brain is a master organ that controls every other organ of the body, and all the other organs also control brain back in their own little ways. So if I'm here having anxiety, let's just say I have performance anxiety. I'm doing live with all of you, and I'm seeing number being 110. 110 participants are listening to me right now as I speak. So when I look at it, I saw the number 110, and this is obviously registered by my brain, and my brain will start secreting something called as catecholamines. Catecholamines are anxiety hormones. They're produced naturally. It's God's gift for us as a defense mechanism for flight or fight. In situations of in flight or fight. For example, I saw a snake. I know that it could be a poisonous snake, and it can harm me. So immediately my brain is sending me signals to either fight my threat or flight, as in run away from the threat. The safest thing would be I don't fight the snake, I run away from it. So these are God's gift, or our brain's gift, for us to face a threat. But now, if I have an anxiety disorder, seeing 110 participants could be as scary or more than seeing a snake right next to me, because I have an anxiety disorder where the hormones are produced too much without any regulation or control. So what happens? I'll end up having more number of hormones going to different parts of my brain, telling me it's a threat, it's a threat, it's a threat to my safety. These many people judging me could be a threat to my safety. So I'll start having all the symptoms of anxiety that I probably would have when I see a snake. This is an anxiety disorder. It could be performance anxiety, or it could be social anxiety, or there are many other conditions. Because it's produced by the brain, so a lot of people will think that I'll go to the psychologist and I'll take counseling. But know that I'll give you another example. Let's just say your body is a vehicle. Your body is a car, your favorite car. You need either petrol or diesel or gas or electricity to run your car. Just like that, our body and brain are, they're run by something called as hormones. Your body is definitely run by hormones, and your brain is definitely run by something called as neurotransmitters. And some of the hormones also run the brain. These neurotransmitters, when they go increased or decreased, they're not at the baseline where they're supposed to be, that can cause a lot of neuropsychiatric or psychiatric or psychological conditions. For example, as simple thing as having hypothyroidism, where your thyroid hormone is produced less. That in turn will reduce the secretion of some of the brain chemicals, resulting in anxiety. Now, why would I prefer a setup where both psychiatrists and psychologists are available is that you go to a psychiatrist first, get evaluated, see if there's a reason for the anxiety, or it's purely psychological. Means there is no hypothyroidism, there is no vitamin D deficiency, there's no B12 deficiency, there's no anemia, there's no PCOD. There are many conditions that cause particular disease in psychiatry. So rule out all those diseases, and then the doctor will send you to a psychologist, clinical psychologist we're talking about, because I work with clinical psychologists, where probably the performance anxiety is coming from maybe the person was bullied as a child, or belittled by the own family members. Could be anything. Maybe there is a body image issue, maybe there is a confidence issue about how he or she looks, or he speaks. There could be anything. So now for that, obviously, I'm not going to put somebody on medication, right? I will definitely ask clinical psychologists to help the patient to overcome their own thoughts, because most of the time the anxiety doesn't come from outside. It does come from our own perceptions about ourselves, or how we think the world sees us. So these are misconstrued thoughts. These are not rational thoughts. These are irrational thoughts, irrational beliefs. So what does a clinical psychologist do? They do something called a CBT, that is cognitive behavioral therapy. They try to alter your irrational thoughts and behaviors into rational thoughts and behaviors by therapy. So I think what the example of what I gave with just one disease called anxiety, there are many more diseases in psychiatry, should tell you that, what we read on the Google isn't really what exactly it is. So it's not an option. It's never an option. You'll have to see both the doctors. So I'll give you another example. Let's just say you have fractured bone, for whatever reasons. It's not an option for you to see an orthopedician and a physiotherapist. Both the doctors may be involved in your treatment. So you'll have to see an orthopedician first. They will assess, why did you have a fracture? There are n number of reasons, and get an X-ray and see how much of the fracture, what's the extent of it. Do you require a surgery? Do you need just immobilization, as in you don't have to move the limb and it will heal by itself, along with physiotherapy support. Exactly the same way. This is, I think, one example that should change our perspective towards looking at the treatment choices of a psychiatrist versus psychologist. It's never versus, because I'm always seeing versus. It's psychiatrist and or psychologist. It's always both together. So because I think most of you are psychology enthusiasts. So one advice for most of you would be to tag along with the psychiatrist, because that will work better for your patients. Because what happens is, when you are just doing counseling without any medical help or without any evaluation prior, you don't know, maybe the patient has underlying medical condition that is causing the psychiatric problem. So most of the time, just know that medical conditions, they don't present as physical symptoms. They can present as psychological symptoms also. I'll give you an example where there is this patient, 52-year-old. He's not 50, sorry, 42-year-old patient that I was seeing yesterday. I thought I should present that case in this particular talk that we are having today. So this particular patient, 42-year-old, he was, he's not a diabetic, not a hypertensive. He's perfectly fine. There's no problem. So he suddenly became very quiet and he was looking very low. He is not interacting with too many people. He's just preferring to keep to himself. Immediately the family, they didn't want to take to a psychiatrist because they thought, they'll give a lot of unnecessary medications that have side effects, which again is a myth. So they thought, we'll take to a psychologist. And they also had a psychologist in their own gated community complex. And also it's a pandemic, so they thought it'll be easier to go seek somebody in their vicinity than going to a hospital, probably where they might get infected. There's a potential chance. So they went and saw a psychologist. Psychologist started taking a session. Was trying to find out what is the reason why he is suddenly low. Is there anything that is bothering him? Are there any work stressors? So this was going on. the patient was responding a little bit in replying to her, because psychologists they do have various techniques to deal with different kinds of patients. So he was responding a little bit. So she said that she didn't suggest to go and see a psychiatrist also. She thought like counseling is going to help, and day one he's responded a little bit, so we can continue with it. So she thought come back in, I think, a week or in 5 days for another session. But what happened that night, the patient deteriorated very bad. So what is happening is patient had bleed that is happening inside the brain. So what happens when you have bleed in certain areas of the brain? See, when you have bleed in a particular area called in a frontal area, you tend to not move. So that's the most dramatic change in the patient, where we all tend to immediately run to a emergency room and get them evaluated and see why is the patient not moving. And generally we do a CT or MRI based upon the timeline that they brought the patient, and we see that there's a bleed or there's a clot in this area that helps you move. That is called a stroke. No prize for guessing. So that's called a stroke, or paralysis we call it. So that can occur. Now here, if the bleed is not happening in this area, it is happening in some areas of the brain that deal with your emotion, behavior, and thought process. Mostly your prefrontal cortex, and there are different areas of the brain. What happens is you don't have physical symptoms, you have psychological symptoms. For example, suddenly the activity becomes too low, the speech becomes less. Sometimes speech may become incoherent also. Because of this, the patient, we didn't lose him. He's in ICU right now. I anyways just saw him and came. He's getting better. But if the family members brought the patient yesterday morning, instead of waiting till night, I think we could have saved a lot on the brain, in the brain. So I think as a psychologist, as a budding psychologist, or as a practicing psychologist, or as an enthusiast, just know that don't see it as a business model in terms of, I'm being very honest here. So don't see like, if I send the patient to psychiatrist, what if patient don't come back? Don't do that. Likewise, as a psychiatrist, I shouldn't think like, if I send the patient to psychologist, what if patient doesn't come back to me? It's not like that. So that's why I tag along with the psychiatrist. Form a team. You have to have a core team, just like how other physicians have good team with physiotherapists. Different kinds of physiotherapists are there. Rehabilitation physiotherapists and sports physiotherapists, etc., etc. Just like that, how psychologists, there are different types of psychologists. Tag along, form a team, and actively get involved in understanding patient care and diagnosing psychiatric problems. And treatment you already know, because that's what they teach in psychology. So I think a group and efficient practice will definitely help. However, there are some situations where it's only psychiatrist or a psychologist. For example, let's just say marital discord or marital disharmony, where which is quite increasing. People are couples in the pandemic, especially. I see that a lot of their interpersonal problems are coming to light. They always have probably marital issues, but now because they're stuck in the same house, they're not having other ways of engaging themselves. So they can't escape from each other. They can't escape from their actual marital problem. They're having to deal with it. While some people are sitting and dealing with it efficiently, where most of them, unfortunately, they're not dealing with it. Especially on top of it, there is the COVID stress and the workload and etc., etc. So now, so I think, if the couple come to me, I'm not going to give medicines for both of them. I will send them to a psychologist, where psychologist will help them understand what are the problems between both of them and how to deal with it. So they going to a friend is not going to help, because a friend will like either a husband more or wife more, little more than others. So it's inevitable that you tend to take sides, and there's going to be a lot of bias while talking to the couple. So as a psychologist, you come very unbiased, you come neutral, you come backed with science of psychology, as in how to deal with interpersonal issues, especially with the couple. So definitely some situations like that, Or anger management. Anger management, we usually see if it's medical conditions causing uncontrollable, unprovocable anger. If it's not, usually don't give any medicines. We tend to put them to an anger management course with the psychologist that I work with, so they work with it effectively. And if I talk about anxiety, if I speak about phobia, so specific phobia, for example, I have fear of heights. So definitely you'll need to give both the medicines and therapy also. They do desensitization, systematic desensitization. There are different therapies that are that you do. Or if you talk about alcohol dependence or any other drug dependence, definitely here psychology plays a huge role. But initial part, it's purely psychiatry, where there'll be withdrawal symptoms of the drug the patient is hooked onto. You tend to give medicines to wean them off the drug and not have any withdrawal symptoms, and also look at other organs, like alcohol means liver, smoking is lungs, and different organs, to see if they have already taken a toll and help there as well. And after maybe a week, we usually shift them to a de-addiction center, where psychologists take over, and they do motivational counseling, de-addiction counseling, where they actually understand, is the reason for patient's drug abuse just the craving or peer pressure, or there are actually underlying issues in his life to which he is responding, or to which he is coping inadequately by drinking or smoking or taking any other drugs. So psychologists play a huge role in that as well. There are behavioral psychologists, there are clinical psychologists. I think different people come into play with different kinds of patients. So there's no just one straight line here that you have this problem and you go to a particular doctor or a psychologist. So I think I've given enough examples to understand that both of their doctors have to work hand in hand. And one more important area here is, I see a lot of bad mouthing that can happen in the practice. When you're in practice, what happens is, let's just say that, without mentioning names, obviously, like I used to send my patients to a counselor, and the patients were never coming back to me for the follow-ups, and they would come back like a year later or 6 months later with severe symptoms. When I asked them why did you stop treatment, they said that the counselor told that. I asked counselor if I should stop taking my medicines. A counselor said, yeah, you can stop for a while and we'll see if the counseling works. And then if it's not working, then you can go back to the doctor. So I think that question should have been asked to a psychiatrist. You think I should continue this medicines or stop? So it's always good to talk to your particular specialist of the what question you're asking. For example, if you come and ask me about, you think the counselor started CBT for me, you think CBT will work or DBT will work? I will never tell neither will work or that will work over this. I'll tell, why don't you talk to your counselor and ask, because she or he had assessed you thoroughly and reached a conclusion of catered a therapy for you, that this designed a therapy in terms of CBT will work over DBT in particular patient, because there's no just one way to one shoe doesn't fit all here in therapy. So you have to always scale your therapy according to the needs of the patients, different needs of the patients. So you should never talk out of your expertise. Like, I shouldn't talk out of my expertise. You shouldn't talk out of your expertise. You should always politely ask them to go back and consult with their own therapist or psychiatrist to find out if they have any doubts. Because what happens is patient already comes with some Google knowledge. Just know that, you are not the first person that patient came to, or I'm not, nor am I. Google is the first thing they go to, and you and me are probably secondary sources for them of their information, which you should discourage as well again. So that's one thing. So always work together with the doctor, just like how I work with psychologists. And second thing is what I just told. Always never clear the doubts that are not in the area of expertise. Always ask them to encourage them to go back. Because I always encourage my patients to take therapy. I tell them that, it doesn't harm you. It'll only benefit you, or it might not do much to you, but it will never harm you. So why not just take a couple of sessions and see if it's working for you. I encourage them, I push them towards therapy because like I myself had issues. I won't say issues. I had clinical depression in the adolescence, and I did take both medications and therapy. So personally and professionally, I strongly advocate everybody about mental health, not just because I'm in the business or the profession, but because it has helped me a lot. So I encourage this kind of practice that goes hand in hand. Now, talking about what kind of psychologists we doctors usually work with. There are industrial psychologists or people who do psychology as a distance education, all of that. We usually, I don't know about we, I usually work with clinical psychologists who are trained, just like how I am trained in MBBS and MD, who are trained in clinical psychology. That's what I look for. I don't have too much idea about the substreams. I just know the mainstreams of psychology. I think there are many substreams of psychology because it's an ever evolving branch. Also, I think this is the right time for most of you psychology enthusiasts to take up psychology, because we are in need of good psychologists. We unfortunately don't have too many good psychologists. There are few very good ones, and then there are there are a lot of people who did like some distance course, who didn't have enough clinical practice, who didn't deal with real patients before. So for psychologists like that, I'm always little in fix with should I send or not, because bookish knowledge is definitely important, but clinical experience is the most important thing for both psychiatrists and psychologists. So you can, we always look for the people who have clinical practice, who dealt with patients, who worked with psychiatrists before, who worked in a setup like de-addiction centers or rehabilitation centers or acute psychiatric facilities also, etc. Also, one more thing where psychologists are absolutely not needed are conditions like schizophrenia or any psychotic conditions. They are not needed absolutely in the initial stages. But later, when the psychotic symptoms come down, for the maintenance therapy to reintegrate them back into the society or to reintegrate back into their profession, for that kind of rehabilitation, definitely psychologists are needed. So I think there is not a place where psychologists are not needed. So we need them either in the acute care or in the maintenance care or both. So it's a good time for all of you to take psychology, especially because fortunately, unfortunately, this pandemic it has given everybody a kick in terms of, hey, this is mental health. What you're going through is mental health issue. It took a global pandemic, and not anything else. It's just global pandemic to make us realize the importance of mental health. Now everybody is talking about it. Now it's become one of those hot talks. But the problem is, I don't know how long this is going to last. But just know that the people who are sensitized to understanding that this is a mental health issue, they will always be smart enough to know that if something goes wrong in their life, it doesn't have to be a pandemic. It can be as simple thing as they got fired from a job. Anything, any stressor around them, they will be sensitized and they'll have the memory that how it felt during a pandemic. I feel the same way. Maybe it's a mental health condition. So maybe I should see a doctor. So, definitely there is more demand than the supply. So I think you all enthusiasts can bridge that gap. Even psychiatrists, there is a lot of demand more than supply, because I think we have only 10,000 or a little more than that psychologists for the Indian population. I don't even have to mention what's our population count, So with the mental health issues that we have, we need more doctors and more counselors, more credible doctors and credible counselors to help people. So I think that's my small half-an-hour talk. I would prefer taking questions more than just speaking. So I think we can cater to what people have on their mind. Can we have somebody who is moderating?
Hello, sir. Thank you so much. All that information was so helpful, and even us being in a field of psychology, sometimes we come across this question of, many people in the start of their career do come across this question of when to go to to a psychiatrist and when to go to a psychologist. So it's a very relevant discussion to have, and it's very important to know at which stage you're supposed to consult either of them. So in that case, firstly, I'd like to ask you, as you mentioned about the global pandemic and that it took us a global pandemic to realize the importance of mental health. I'd like to ask you, why is it that compared to most countries, unfortunately, India lacks the importance of mental health. So why do you think is that still happening, even though we are so developed and we are growing so fast in the field of mental health? It actually takes us a mental health emergency. Like if I mentioned last year's Sushant Singh case, people got so, they become attentive towards these things. So only these things make us focus on something like that. So why do you think that happens, and why is it that at the other times we completely ignore it?
I think the lack of education. Education is not if you are educated till 10th class or not. What I mean is, a lot of people don't know what they're going through is mental health issue. For example, if somebody is having palpitations, if they have severe anxiety, they don't come to a psychiatrist. They go to emergency room, or they go to a cardiologist. And unfortunately, what happens is the cardiologist, even in medicine, I'm not talking about psychiatry, psychology, even in medicine, branch of medicine also, other professionals, they don't know about mental health too much, because our medical curriculum didn't have psychiatry as a main subject till about recently. For the last 1 year, 2 years, it has changed with pandemic, and they're including they're giving more weightage to the questions. So when you give more weightage to the questions in the answer in your paper, students also, medical students, tend to read the topic more, and they tend to understand. So let's just say I'm a student. Let's just say I'm a medical student, and I know that mental health questions are not coming too much in my paper. I can pass without reading that topic. I'll skip it. So I'll become a intern. I'll become probably I'll take up general medicine or cardiologist or whatever. I'll become a cardiologist later, and I never had knowledge of mental health. What are the reasons why mental health issues occur, etc., etc. So I think there is no education in the doctors itself. So I don't know. I can't even tell you like the amount of lack of education in the general public also. I think awareness programs need to be done, just like how people are doing awareness programs about smoking. The smoking is injurious to health. I think people should be told about stress is also injurious to health, and how stress affects you. And there are different campaigns that people should do. I think youngsters like you and probably me should come ahead and take. And I think one thing is not just education. Another is there's a lot of stigma around it. I think the media or movies usually portray us in a very negative light, like Pagalunka doctor, or Pagal. This is many detrimental words they use to somebody's ego. So people become very uncomfortable even if they want to share something. For example, it took me like these many years to tell that I had depression. I got treated. I think back in the day I never told anyone, because I had a fear of judgment coming from people. So that I thought like I'll get judged. Because usually people think depression equals weak, weak mind or weak person. So I know that I'm a strong person. So, but when I tell people I had depression, they're like, oh, he must have been weak and now he's strengthened up. So that's the reason I think there's a lot of ifs and buts about mental health. People don't know. I think people just talk whatever they know. This is one side. Another side is overexposure, too much sensitization, where even if let's just say that not all days are Sundays. Some days I wake up and I feel little anxious, or let's just say I have that exam, or I'm worried about calling my relationship off because of I'm not happy in it, or whatever. These are general things that happens in one's life. And people who are oversensitive to mental health also, they tend to say that I have OCD, I have depression, I have anxiety. I think there is no right balance in in our country, especially in our country. Either we are glamorizing it and glorifying it, or dramatizing mental health conditions, or we are all hush hush, like, it's always behind closed doors, and like no one should know, etc. I did a study recently that said that the biggest pain that parents can that anybody have is when you lose a child, not when you lose a parent, not when you lose a friend, not when you lose a lover, not when you lose a spouse or a pet or whatever. The biggest pain is when you lose a child. Bigger pain than that is when you lose a child to suicide. I understand the emotional aspect of it, that in these people, when I took an interview of why is it more painful, is it because like you think you could have saved from suicide, you think you didn't know your child is going through something. 33% of them said that I don't want everybody to know that he's committed suicide. So I'm okay people knowing that he had an accident or whatever other sources of death, not the suicide. I think there is stigma even in the death of secondary to a mental health condition. So I think that's partly I have answered. Otherwise, I can talk for 1 hour about why is it ignored.
So there is a question which asks how to deal with the stigma surrounding mental health as a person suffers from clinical depression.
I think open conversations and educating them again, because when I told people, like I didn't become a psychiatrist to tell that. I told back in medical school only to my friends that, I had depression. I should be very careful. I shouldn't get stressed too much. So I'm going to take everything easy in my life. So I'm going to be okay, because the doctor told me there is a recurrence of depression. There's a chance of recurrence. So I always tend to actually that changed my life, for better. I started feeling very good because now I put myself first in terms of like, okay, this is affecting me. I will go away from it. Because now I know my priorities. I know that, I'm not going to take too much load. I mean, stress is constant. I'm a doctor and I'm constantly working. That I can't avoid. That's my bread and butter. But otherwise, let's just say that, I have a toxic friend who is belittling me and making me feel, I don't have a toxic friend, but I'm just giving an example. I tend to cut them off. A lot of us, we don't do these things. We tend to beat ourselves up and, push ourselves till the last ounce of energy and patience left in us. I don't do that. So when told my friends that, I had this condition, they told me, why are you telling in front of all of them? Why don't you tell me in person? Don't tell to people. They'll think you're a weak person. They'll think that you can't do MBBS. I said, like, strong or weak, you're talking about what? Physical strength, mental strength. There's nothing called as mental strength. They say that people who are sensitive to emotions are very weak. That's not true at all. Everybody has different level of sensitivity of what affects them, what doesn't affect them. So I think, again, how to deal with stigma by openly having a conversation without dramatizing it or getting argumentative. Just know that when you tell people, when they pass some comments as weak, etc., don't get offended. I think they are coming from a place of ignorance. I think they don't know any better. So instead of feeling attacked, first of all, don't feel attacked. I think stigma is not just in the society, it is there within you also. If you also feel like, it's offensive to talk about it, and when someone slightly talks in demeaning way, you get so offended and argumentative. Don't do that. People don't know. Educate them a little bit. So I told people, no, doctor told me that apparently serotonin levels have gone down, and that's why I felt low. And I also had a stressor that pushed it. Probably I had a family history also. Back in the day, who knows about mental health conditions? People just thought, like, get up and move on. So I told them, and they're like, oh, okay. So they also got educated a little bit, being a first or second year MBBS student. So I think that's how you break the stigma.
Yes. Okay. So there is this other question. If anyone is having anxiety, depression, or stress during pregnancy, is there any chance that it will pass on to the kids?
So stress is not a disease, so it won't be passed on at all. So anxiety and depression definitely are genetic. So they're not absolutely genetic conditions in terms of if your parents have it, you definitely get it. So most of the psychiatric conditions, they have strong genetic incidence. So your parents have it, there's a good chance you might get it. Not just psychiatric, medicine generally has a lot of strong genetic occurrence. For example, if your parent is a hypertensive, you can have anxiety. You don't need to have and hypertension itself, because both of them come from the same pool, same gene pool or gene loci, we call it. So yeah, there is genetic, occurrence. So I tell people that, there's a good chance your child can have anxiety or depression. But if the anxiety and depressions are so common, they're 37% common according to the recent studies. This is before pandemic. I think after pandemic, it's just skyrocketed to like more than 65. 37 is quite high. There's a good chance you'll have it anyways if you have a parent with it or without it, especially because you asked about depression. So yes, so I tell people that there's a good chance your child can have depression or anxiety in the genetic counseling that we do. Just teach children about something called as anxiety and depression. Teach that, so they can come and tell you when they're feeling a certain way or when they're experiencing certain symptoms. So that's one way. But these are not absolutely genetic. You need to have also an environmental reason to push it. For example, let's just say I have a father with schizophrenia and I have good chance of developing schizophrenia. Now, on top of it, I'm smoking cannabis or weed or ganja, we call it in our local language. When you smoke that, what happens is the gene that is supposed to cause schizophrenia gets dysregulated. And you'll have schizophrenia. So it's called dual hit hypothesis, where you have genetic vulnerability. On top of it, there is an environmental trigger that is pushing you to have a full-blown disease.
So that is basically a nature-nurture thing. So I have this other question which asks about how can we overcome the stress during this pandemic, and also as a psychiatrist, as a psychologist, how can we help others?
You should answer that as a psychologist, how you help. But as a psychiatrist, what I would ask you to do is simple. Focus on simple things. See, mental health is actually pretty easy to be taken care of. It is about doing your basics right. In fact, health is the most easiest thing. Most of it is in our control only. You should know that. Getting your basics right, getting your lifestyle right, because most of the diseases are lifestyle related. For example, depression, anxiety, diabetes, hypertension, cholesterol issues, stroke. All these are the big conditions that I just mentioned are also lifestyle conditions. So look at your sleep. Sleep is probably by far the biggest culprit of having mental health conditions, because your brain is supposed to get rest. It's supposed to. It's designed. I don't know by God, or I don't know who designed it. Whomsoever designed it, it's designed in a way that it can work 16 hours. That's a lot, and it needs 8-hour rest. I'm talking about an average, like a middle-aged person. For children, it's different. For old people, it's different. Let's just say we all are middle-aged. So we need 8 hours of rest, 8 hours of continuous, uninterrupted sleep. How many of us actually sleep 8 hours of continuous, uninterrupted? I don't sleep. I sleep 6 hours, 6.5 hours, and that too, hospital keeps waking me up. Or sometimes people just wake up by themselves. Sometimes people use a lot of screen. The screen that emits blue light decreases melatonin secretion in your brain that is required to maintain good sleep. So that is affected. People do night shifts, so sleep is affected. So mental health conditions are directly proportional to your sleep also. So maintain your sleep timings. It's okay if you're sleeping late and waking up a little late, but maintain the timings. Don't confuse your brain. Don't be so erratic. Like one day I sleep at 10, one day I sleep at 1, one day I sleep at morning 4 o'clock. Don't do that. Have a fixed routine. And the main thing, see, your brain needs time to adapt and adjust. And most of our brains will adjust and adapt okay, but some brains don't. So try to stick to the same schedule pre-pandemic, your pre-pandemic schedule. For example, if you're working from 9 to 5, even though you're working from home and you have the privilege of working whenever you want and logging off whenever you want, don't do that. Please work at the same time and have a designated work area. And exercise is the most important way to maintain mental health and physical health. A lot of us lead sedentary lifestyle. For example, me, doctor, you, psychologist, we all have sedentary lifestyle. We just sit and talk, or we just sit and order investigations or write medicines. We don't have exercise. Back in the day, diseases are quite less. People who are having active life, they it's like, they grow their own food, vegetables, and they have, look at their bodies, they're so fit. None of them used to hit the gym, nothing. I think the lifestyle should be a little more active. Unfortunately, also the screen time is excessive. Social media, where trust me, social media affects all of us. Let's just say, I have a page on Instagram that have 5,000 followers, which is pretty good, for somebody like me. And I might see somebody having 10,000 followers. Immediately, I be like, I equate it with my self-worth. I don't. I'm giving an example. So immediately you tend to be like, oh, maybe I'm not that good. Maybe I need to buck up my game. So I concentrate entirely on my social media. I tend to ignore little things in my life. Get a hobby. When I ask hobby, most of the Indians say hobby is talking to friends and watching movies and listening to music. These are your classic slam book answers that I used to find back in the school. Hobby is something that is creative, that helps you express yourself. For example, I paint a lot. My mother does gardening. That's a hobby. So, having a hobby will let your emotions out creatively. So sometimes you don't even have to see a psychologist, For example, for me, I have a lot of stress, So what I do, I paint. In fact, right after this, I'm going to paint. From 11, I'm going to paint till 3 o'clock. I put my schedule. That will help me overcome my stress that I had my entire week. So pick a hobby, and eating obviously right. I think doing all these basics will definitely help you not have any anxiety or depression. And mainly your thought process, what you see, how you think, what's in your control, what's not in your control. This will change your life. I tend to take a paper, draw a line between, and I'm going to write to the right side of the paper the things that I can control, and on the left the things that I cannot control. When I see it, it gives me little idea to my brain that okay, most of the things that I've been worrying are the ones that I can't control. They're out of my vicinity of my locus of control. So I'm going to ignore them. Me, dramatically, what I do, I tear off the left side of the page and I I shred them and I throw those papers. So that will give me a little relief that I let go of all that unnecessary baggage. I think doing little maneuvers like this, having a gratitude journal in the morning, writing things that you're grateful for. Dr. Ira, who is a speaker today, I think even she vouches for gratitude journaling. Most of us, we write the gratitude journaling. I'm blessed that I have a job. I'm blessed to have a shelter. I'm blessed to have food. These we take for granted. We're always in hunt for bigger things and better things, and we forget the basic things. All this will take a toll on one's emotional health and cause anxiety and depression. So yeah, I think doing these simple things can definitely help you.
That's very correct, because hobbies and doing something that deviates you from what you actually do is very important. So there is this other question. There are actually a lot of questions on the lines of overthinking, because we have a crowd which is mostly teenagers to 20s and 30s. And in this time, people really do a lot of overthinking about some irrelevant stuff sometimes. So the question basically is how to deal with overthinking. And if I add to it, is overthinking a result of something that when you don't have a goal or something like that, you tend to overthink more about the stuff that are not really even relevant in your life sometimes?
No, I think overthinking, see, first of all, there is nothing called as overthinking. Overthinking is a very subjective word. I can say you have fever because I know the cutoff value that, 101 is a fever. 98.3 is not temperature. But thinking is very subjective. I might be thinking I'm overthinking, but you might think like, oh, you just think 1 hour a day. I think 10 hours a day. So overthinking is a very subjective thing. But yes, like you said, adolescents and teenage, I think it's a phase where we all are forming an identity. We are trying to explore our interests, our sexuality, our passion, our careers, our friends, or things that we like, things we don't like. We're forming a personality. So there will be a lot of self-doubt at every step. Do I like this guy? Do I like this girl? Do I like this course that I picked? Do I like this food? Do I like this music? Also there is a lot of sense of we tend to mock. We tend to let's just say you have a celebrity that you like, or you heard someone speak and you are in absolute awe of them, and you tend to become like them. You tend to speak like them. So you're always it's a period where you're forming your identity and you're exploring yourself. So self-doubt will definitely arise. So I think overthinking will be there. Just know that it's okay, but it's okay to overthink. But if you think the overthinking is causing you anxiety, or it's making you feel very low and upset and not good about yourself, that's when you know that, okay, you know what, this is affecting me. doing something is not wrong, but understanding that just doing this is affecting me, that is when you need to stop it. I think simple tips would be for, like what I did in my teenage was I took a printout of the stop signal that we see, or usually like the stop that says with the red color in my room. So whenever I have anxious thoughts, I go and sit there, I just look at the stop and I just look at it. Because when you look at it, right, it sends a lot of signals to the brain to stop. So that is one thing that helps me. Or I immediately paint. So I divert my mind. You don't have to escape from your thoughts. You have to divert them into something constructive. Simple thing for you would be to write down your thoughts. If you have 10 thoughts, you might have 100 thoughts, but identify the predominant recurring thoughts and write them down and arrange them in the order of priority and see if they have solution or not. It just takes, do it once a week. Like every Sunday morning, you just do it for half an hour. Okay, I'm worried about this. I'm worried about that. I'm worried about this. So what is the solution for this? Again, go back to locus of control. Okay, is this in my control? Can I change this? I can't. So let go of it. Letting go is the biggest gift in teenage. You have to learn to let go, because you all, are very sensitive in terms of, you think that the relationship that you have right now is going to be a permanent one. The marks that you're scoring in your exams is, defines your self-worth and the person that you are. They don't. When you become my age, that is around 30, your teenage will look like, oh, what was it doing? What was it thinking? The person that you are right now may not be the person that, mostly you're not going to be the same person when you grow, when you become 30. And I hope you won't be, because you're supposed to evolve as a person. You're supposed to change for better. Surround yourself with positive people, not unrealistically positive that they only see happiness in everything. No, people who are practical, people who are motivating, people who like you for yourself. Find those people and form friendships that will nourish you through mentally and physically throughout the life. So I think things like that. So it's okay to overthink, but just know that when this overthinking is affecting you, so it's not a bad idea for you to see a psychologist. If you're having too many doubts. Also, don't take yourself too seriously. My age, anyways, you'll take yourself too seriously. Your age is all about exploring and having fun and understanding that, okay, I like this or I don't like this. It's forming an identity. So take it easy.
That's very well said, sir. And I really think it's going to help a lot of people who are in this age group. So the next question is on the lines of substance abuse. So how does doing substance abuse like weed or ganja affect a person's brain or behavior, and how can one get rid of it?
How can one get rid of it? I think you'll have to see a doctor if you think you are addicted to it. There's no other way of doing it. Go through a de-addiction program. It could be just a 21-day program. Don't think like, 21 days, who wants to be with the doctor? If that is life-changing for you, if that's going to save you from many adversities of your life, 21 days is nothing. You won't even remember the 21 days. So just go through a good de-addiction program, because India has a lot of mediocre de-addiction programs. Go through a good one, do some research and find a good counselor, a good psychiatrist that can help you through it. How does it affect? It affects in many ways. So the drug that you take, the drug that you're smoking, it goes through blood and it crosses the blood-brain barrier. It enters your brain. When it goes to your brain, it goes and binds to different parts of the brain. That's why people feel hungry when they smoke, because they don't go to stomach. It goes to brain, and brain has a appetite area. It stimulates appetite or it suppresses the appetite. So cannabis increases the appetite in the initial stages. That's why they call it cannabis munchies. People keep eating so much once they smoke up. But just know that if that is happening, that it can do anything else. But once it has reached the brain, it can go to any areas and it can affect it. So it goes to the areas where you're supposed to maintain your attention and concentration. So it does take a toll on your academic performance or any task that require attention. Literally every task in your life requires attention, active attention or passive attention. So that will happen. Amotivational syndrome occurs because the area of the brain that is supposed to maintain motivation gets suppressed with cannabis. So what happens is you don't find motivation in anything. You just live like, they say that hippies and free souls and all of that, um, that's all not correct. That's a myth. So basically you have no motivation. So you tend to go wherever life takes you. You don't see yourself going anywhere productively. On a severe stage, what it causes hallucinations, it causes psychosis, it causes delusions that might require you to be on medications for a long time. So definitely, but yes, there is a lot of research that is talking about cannabis can help mental health also, but don't support the research till it is proven. Most of us, what we always try to find the things that we want to find. There's a lot when I give an IT talk. I'm a corporate speaker, so I very frequently give IT talks, and they all ask me. Probably most of them are smoking up, so they all ask me question that. But doctor, I read a research article by a famous psychiatrist that said that it helps mental health. I said that's why it's still on the paper. It's not proven. It's not FDA approved. And most of this research is occurring in cancer patients to improve their mood and appetite, because like I said, it does some things. It makes you feel happy, euphoric, and increases your appetite. So don't apply it to general population. So drugs definitely affect you now or later, and we think that we are just doing it once in a while, but you don't know what your genes are. You don't know whether you're coming from a gene pool of addictions. You don't know what's your self-regulation. You don't know if you're going to be addict or not. So find a suitable age, and only then social drinking, social smoking is okay. But I think weed and other hard drugs, I think you should definitely avoid.
That's correct, sir. So on the last question, I'd just like to address you to the people who are here, who are aspiring psychologists and psychiatrists. What is your one advice that you'd like to give them, as they also have to take care of their mental health when they step into this field and meet and treat so many patients who are suffering from many psychological disorders? How can they take care of themselves and go on with this field?
I think you should treat your profession as a profession. Don't draw a line. It's most important thing for anybody in the medical field or paramedical field or allied branches like psychology or all the allied branches of medicine also. The same advice would be to try to maintain a work-life balance, because what happens if you're a passionate psychology student, you tend to come home and you tend to sit with it. You tend to deprive yourself of all the other pleasures. You become the psychologist even at home. Don't do that. Like, for example, if my aunt calls me asking them medical advice, I tell them to call at another time. I know. Always try to pick that, this is my life, this is not my work. I have to draw a balance. I think this simple thing will change a lot of things for you. It puts a lot of things in perspective. And value yourself. Don't be the, if you're a counselor, my psychologist tells me that it gets very annoying that if I go to a party, or if she goes to like anywhere, like any to play a sport, everybody is like, okay, hey, like their friends or acquaintances or people who are living in the same community, they tell that, hey, I need to talk to you. I'm going through something. Don't, because it's not your work timing. I know we are supposed to help people in your work time, because you're supposed to take care of yourself, and too much of all of this also can affect our mental health. It does take a toll. For example, if today somebody asked me to talk about psychiatry, I wouldn't have spoke. I would have said that it's my Sunday, I need break from it. But because it's a topic that is very information based and knowledge based, I think I didn't mind speaking. So draw a line. Maintain work-life balance. Don't take yourself too seriously. Your job is only your job. It's not you. So you're only a psychologist, and that's just a part of you. It's not your entire purpose of life. There are many other things about it. Like I'm a photographer. I'm an artist. I'm a dancer. Like I do hip hop. I am trained in it. So I have many attributes to it. Yes, one of the biggest attributes is that I'm a doctor. But that's not the only thing that defines me. So maintain work-life balance and don't take yourself too seriously, and treat job as job.
That's great, sir. It's great to know that you're so multi-talented. And thank you for addressing all of us here this morning and We wish you all the best for your future endeavors. And over to you, Sumedha.
Thank you so much, sir, for the educational experience. Although you had mentioned that it would be a task for you to keep us hooked on a Sunday morning, it was with great finesse you had us hooked. The experience was absolutely interesting and meaningful. We got the answers to many of our questions, which we wouldn't get the answers to on Google. So thank you so much for taking your time out for us from your busy schedule. And as a token of gratitude, we'd like to present you with an e-certificate, which will be mailed to you later. So I request the technical team to kindly present the certificate.
Thank you so much.
Thank you. Now I request the next MC, Sania, to welcome our next speaker. Sania, over to you.
Good morning, everyone. It is with great privilege I would like to welcome our next speaker, Morel D'souza. She holds a Master's of Science in Psychology of Sports and Exercises from Loughborough University, UK, and a Master's of Applied Psychology from the University of Mumbai. She has been involved in competitive sport for most of her life and has got first-hand experience of everything an athlete goes through. She is a sports and exercise psychologist, a mental health professional, and a therapist. I would like to welcome you, ma'am, with a virtual round of applause. We will be hearing a short buzzer prior to 5 minutes of the session's ending time and a longer buzzer exactly at the very end. Thank you so much for gracing us with your presence, ma'am. The stage is all yours.
Thank you, Sonia, and good morning, everyone. I'm sure you all have already had a long day so far. So I'm going to try and make this as applied as possible. If you could just give me a minute, I'll just share my screen. Can one of the hosts please enable screen sharing if possible? Would that be possible?
Ma'am, you can try now.
Thank you. All right. So before I get into what sports psychology is and what we do as sports psychologists, I just want to have a short discussion on why is it important and where is it most applicable to us as performers, as individuals, or as athletes. Okay, I'm sure a lot of you have some competitive experience, whether that is in sport, whether that is in an exam setting, in a performance setting like dance or any of the other performing arts. And I'm sure you've noticed that there is definitely a difference when you are practicing or when you are in training, when you are studying and revising versus when it is the actual event, right? There are different factors that come into play there. You hear a lot of people saying, I blanked out, I was not mentally there, I was not in the zone, I lost my calm. Okay, and all of these things are to do with the mind, but we still find people going back into their training settings and their preparation settings, and they will work harder on the physical or the technical aspect of their performance, right? Be it sport, academic, or any of the other performing arts. And I find very often people underestimate or overlook the importance of the mind in all of these aspects, right? And why is it so different is because the conditions during performance are completely different from when we are training or preparing ourselves. There's no opponent, there's no result, there's no time crunch. All of these suddenly come into play when you're competing and when you're performing in a real life setting, and our minds are not trained for that. And with that amount of uncertainty, we don't know what we're going to face, what's going to lie ahead. What eventually happens is we let all of these thoughts get into the way and we're unable to perform. And that is why sports psychology is very, very important, almost as important as any of the other aspects that go into training and performance. I'd like to share a few stories with you to help you all understand this better. I'm sure a lot of you are familiar with Michael Phelps, one of the most decorated Olympians of all time. He has a total of around 28 Olympic medals, and he's known across the globe, right? But what a lot of people don't know is during the 2008 Beijing Olympics, he had already won, quite a few gold medals, and he was almost on the verge of making history before one of his final events, which was the 800-meter butterfly stroke. And just before, he was preparing himself, and it was all over the news that it was the one event that was left, and there was a huge debate as to whether he would seal the deal with another gold medal. So imagine the amount of pressure on Phelps that this amount of time at an international stage, where the whole world is watching him, and what happened is, as soon as he jumped into the pool, he noticed that his goggles slipped off slightly. And I think by the 40-meter mark, he couldn't see with his right eye because there was water filled there. And then by 60 or 80-meter mark, he was swimming completely blind. I'm sure anyone in this situation would panic. I'm sure if I was competing back then, I would have panicked as well. Some people would have dropped out. We would have continued, but we would have been all over the place. But what happened to Phelps was that he continued, and not only continued, he went on to win, and he even set a new world record during this event. And after the event, there were a few news reporters that went to Phelps, and they asked Phelps, what was it like swimming blind, because that's what he was doing. And his response to them was, just like I imagined. And why did he say just like I imagined? Because the preparation that went into preparing, or the effort that went into preparing for that Olympic event, included not only his technical and tactical training, his physical conditioning, his nutrition, his technical strokes, etc., but he also spent a considerable amount of time preparing his mind, right? There was visualization, there was stress management. He even, practiced under adverse conditions. He prepared for the worst situation. Right, and that is why he was prepared when he was hit with such an adversity. And this is an example of how training your mind can really have an impact on your performance. Right. Another example, again, I'm sure we're all familiar with this athlete. He's Gerard Piqué, also known as Shakira's husband. In the year 2017, 2018, he made around 56 appearances for Barcelona, and he was valued at 14.7 million that year. So imagine the amount that he was paid per match. And during one of these really important matches against Real Madrid, so the El Clasico, again, very important match, important rivalry. A lot of people rooting for you, rooting against you. Everyone's watching you. It's telecasted live on TV. Again, highly pressurizing situation. And what happened to Piqué during this match was, in an attempt to defend, he ended up scoring an own goal, right? Again, anyone in this situation would have lost their calm, I assume. It is a normal response, right? To be disappointed, to be angry or irritated or annoyed with oneself. But when it becomes problematic is when it interferes with our performance. And if we don't learn to move ahead and leave that in the past, we're going to be in trouble, because not only are we going to be distracted from the game, our team is probably playing with one player down, and that gives the opponents a huge advantage, right? And again, that is why it's important to learn these skills, learn how to fix the problem and move forward, rather than fixing the blame and beating yourself down at that time, saying, how could I be so stupid? And I've messed up the whole game right now, and everyone's going to think I'm stupid. And these are automatic thoughts that do creep into our mind, right? Like the previous speaker mentioned as well. And we need to learn, this is not a skill that comes naturally to us, right? We need to learn, we need to train our minds to be able to move past that and focus on the things that are important for us. Because we all know we have a working memory, right? And the capacity of this working memory is very limited. And so if we are focused on things that are not directly related to our performance, we're not going to be able to have the resources, or the right resources for that performance. And that's when our performance will drop and our performance deteriorates. Another classic or recent example is Naomi Osaka. If any of you are following the French Open that is, taking place right now, I'm sure you'll have heard of. It was all over the news where Naomi Osaka refused to speak to reporters, citing mental health, saying that she wanted to prioritize her mental health, and the committee fined her. They charged her with $15,000 and they threatened to ban her from the event. And in a very surprising move that surprised most of the world's athletes and media, Naomi Osaka chose to withdraw from the event. Even though it was a very, very important event, it was a Grand Slam tournament, but she chose to withdraw because she chose to prioritize her mental health, and that is so important in the long run. And I think it sets a brilliant example, right? Because very often we are concerned with, what are people going to say, or what is at stake right now, and we overlook what it is costing us in the long run. And I think by taking that into consideration, and by prioritizing her mental health, not only in the present but even in the long run, Naomi Osaka has set a very, very big and very, very important example of the importance of mental health and your mind, even in sports, right? Because we're all no one's immune to poor mental health or mental illness, whatever it is. And by taking that stand, I think she did a brilliant job. Right? I'm not sure whether you'll agree with me or not, but yeah. Moving on. So if this is how important the mind is, a lot of people then also are known to over-assume the importance of the mind, right? If I train my mind, then I'm going to do very well, and I don't really need to put in the effort physically or technically. Well, that's not true either. It has to be balanced. So for someone to perform at their best, there are 4 things that are important, right? There is the technical aspect. So you need to know your sport. You need to learn, the ropes. If it is hockey, you need to know how to dribble. If it is football, again, you need to know how to dribble and shoot and pass, whatever other technical skills there might be. There's tactical, which is your strategy. You need to plan. You need to go into the match with a game plan. You need to go into your performance with a game plan. And obviously, there's the physical. You need to be fit. You need to have stamina. You need to nourish your body with the right nutrients, etc. And then there's also the mind. So it's these 4 aspects that come together that enable a performer or an athlete to give their best performance, or to come as close to their best performance as possible. All right. Now, another misconception in the field is that an athlete works with a sports psychologist or with a psychologist only when she or he has a problem. Well, that's not true either, because you don't go to a coach or you don't study because you are weak at the subject. You do it to improve anyway, right? You don't have athletes like Virat Kohli or Sunil Chetri say, I'm not going to go into training today because I'm a good player already. I'm a good athlete already. They still go in. They still continue working hard because there's always room for improvement, and because they want to be able to have the skills to face any situation that they may be faced with on the field. And that's the same with your mind as well. You don't have to experience anxiety to learn how to manage your thoughts and emotions, right? You can learn that and develop that as a skill beforehand, and then use that whenever you're faced with a particular situation that requires that skill. So you're building your scoping skills, right? Another question that I get is, what is the right age to start training my mind? I personally believe it's never too early. It's never too early. Yeah. I have athletes that are 9. I've worked with athletes that are younger. Obviously, the focus of our work would differ. So when the athletes are younger, when they are at the grassroots level, we focus on developing the skills that would help them participate in sport. The focus is not on competition. It's on enjoying. It's on building the right attitude. It's on healthy competition, right? Learning not to let failures or dips in performance affect how you see yourself as an individual, right? And all of these skills would then form the base for when you go into the competitive level. That's where our focus in terms of training is on performance. So we would work on, attention, visual fields, decision making, and all of these complex things, right? So the area of work would differ depending on the age of the athlete, the sport that they play, the competitive level that they're at, and all of these different factors would then help us determine what work or what we need to do with the athlete. All right. So what exactly does a sports psychologist do? I'm not going to go into the definition of what sports psychology is. It's obviously we all know it's the study of the mind in performance and in sports settings. And it is to do with motivation and confidence and goal setting and all of these things. But our primary goal is athlete welfare and athlete performance, right? What does this mean? It means ensuring a safe environment when the athlete is training and when the athlete is competing, right? So their coach-athlete relationships, their relationships with teammates, how they view, how safe their environment is. And when I say safe, I don't only mean safe physically, but even psychologically and mentally, right? Am I safeguarded with my emotions, with my emotional and psychological safety? Is the coach being too harsh on me, breaking me down as an athlete? These are things that we're concerned with, right? In training as well as in competition. Next is well-being, even when they're away from the game, right? So some sports psychologists, if they have that kind of training, can even work on areas that are not directly related to sports, right? So how are they, managing in their personal life, in their social life? Are any of those factors influencing their sport performance? And we may choose sometimes to prioritize those areas before working on areas that are related directly to performance, like motivation and confidence, right? We may choose to work on, body image, or we may choose to work on how they view themselves as individuals before looking at it specifically in a sports context. And finally, very obviously, achieving their performance goals. At the competitive level, performance is important. It's important for them to move forward, to make progress. And obviously, we help them achieve some of these performance goals by improving their performance and tracking their progress for them. Yeah. So that's what we do as sports psychologists. How do we do that? There is a process that we follow, and this can be done on field, this can be done off field. We can work individually with the athlete one-on-one, or we can work in a group setting. If it is a team, we can conduct workshops, we can conduct skills-based workshops, teaching them how to motivate themselves or how to set goals. But the most common is the one-on-one individual consulting, and this is the process that we normally follow. First is an intake assessment. Now this may be a case, understanding the case, understanding the performance history, personal history of that athlete. If they are younger, that is below 18, we involve the parents as well. Involving the coach here is also very, very helpful. We may or may not use pen and paper tools. So tests on anxiety, tests on confidence. Personally, as a practitioner, I don't use them. I rely on an in-depth interview, a discussion, as I call it, with my athletes. After assessing, I profile the athlete. So we try and map or note down all of the skills, technically, tactically, physically, and mentally, and strategically and psychologically. And we see where the athlete sees themselves right now and where they want to be in maybe 3 to 6 months. And we note down exactly what kind of improvement we want to see, right? So it gives us something to track. Psychoeducation is a very important part, right? Helping them understand what is happening, helping them understand, the reason behind it. For example, performance anxiety. A lot of athletes complain about feeling uneasy in their stomach, and they say it's like I have butterflies in my stomach and my heart rate increases. And some of that is normal, right? Because when we warm up, the same thing happens. That's adrenaline moving in our body. That's why we feel the tingling sensation. And with all the changes happening in our body, the tingling sensation in our stomach is normal. The increased heart rate is normal because our heart needs to pump more blood to our muscles to perform. But when this blows out of proportion and interferes with performance, that's when we work on it. So psychoeducating them about the process of why we feel what we feel is, again, very, very important. Then we set goals with them. So let's assume I have an athlete who is, who loses their calm on court, gets very irritated, gets very annoyed. we're going to set a goal saying, okay, when I make a mistake, that's one situation where I get annoyed with myself, where I get irritated with myself. Can my goal be to be disappointed so that the intensity is lower? I am not beating myself up on court mentally, and I'm focused on my performance. That would be the goal, right? It doesn't always have to be overly positive, because disappointment is a natural reaction to making a mistake, right? But can it be a functional negative emotion instead of a dysfunctional or unhelpful negative emotion, right? So our goals are very realistic in that sense. Then we introduce the intervention. So that could be, let's assume, rational emotive behavior therapy, or it could be psychological skills training or counseling, or it could be anything, depending on the needs of that athlete and obviously the practitioner's training. And as we work with the athlete to improve that particular area, we are constantly reviewing and evaluating to make sure that the intervention is working. We continuously check with the athlete to see if it's helping them. In terms of applying any new techniques, we always apply them in training sessions first and then into competitive situations, because learning takes time, right? When it's new, you need a lot of your working memory. You need to concentrate too much on that technique, which would take your focus away from your performance, which is why once we get comfortable using it, once we reach that state of automaticity with using that technique, that's when it's best to apply it in a competitive situation. All right. Performance anxiety, one of the most common areas that I find myself working in. And what happens with athletes during performance anxiety is, I want you to quickly just think about a time when you were anxious, when you were nervous, and think about what was going through your mind at the time, right? And you will find that you were in one of two places, or maybe both. You were either in the past, okay, the last time I was in this situation, this is what I did. I hope I don't do it again. Or you're in the future. What if I mess up? What if I make a mistake? What is ABC person going to say, right? We're either in the past or we're in the future, and we rarely ever are in the present, which is where we need to be able to use maximum of our mental resources to perform, right? And that is why we find ourselves, performing poorly, or our performance deteriorating when we're nervous and anxious. Okay, so helping athletes understand this and then putting in the right intervention to help them become more mindful is what works in most cases. Obviously, it depends on each individual athlete. Okay, so very briefly, this is what working as a sports psychologist would mean. Again, this is what an applied sports psychologist would do, but you can choose to get into research, right? You can get into academics and teaching. Personally, I am an applied psychologist, but I also teach at a postgraduate diploma in sports psychology, and so you have all of these avenues open to you. In terms of qualifications or working as a sports psychologist, you do your undergrad, your bachelor's in psychology, and then you would go on to do a master's in either psychology or sports psychology. But it's helpful in either case, especially if you do a master's in psychology and not specialized in sports psychology. It's helpful to get some kind of specialized training or work under a sports psychologist, because the concepts and the way we apply some of these theories are very different from applied psychology, and it helps to get that experience and that knowledge base of using these principles of psychology in a sport and performance context, right? But in India, at least, you don't need a specialized master's in sports psychology to practice as a sports psychologist, at least not yet. You can very well work as a sports psychologist even with a master's in psychology. At the end of the day, it all comes down to whether you feel competent enough, whether you have enough training and experience to be able to manage the cases you have. Even within sports psychology, you might still have your limitations, right? So if you have only trained in sports psychology and in consulting, you may not have the experience of working with clinical cases, for example, eating disorders in sport or clinical depression in athletes. That's when you would identify and refer to the concerned person, maybe a clinical sports psychologist or a clinical psychologist, right? So that they can take over. Because we're dealing with a person here and we wouldn't want to step out of our area of expertise or competence. Personally, in terms of how I went on with my training, education, and work, I graduated from St. Xavier's in Mumbai with psychology and sociology. So I wasn't a full major, and which is why after my bachelor's, I went on to do a master's in applied psychology from the University of Mumbai. Unfortunately, at the time of my graduation, I also had to drop out of sports because of an injury, and I couldn't continue. But I played hockey and I did track and field. High jump was my main event. And you don't need competitive experience to be a sports psychologist. You don't need to be an athlete to work as a sports psychologist, but the experience definitely helps because you understand then what some of your athletes or your clients are talking about. But I think you can very well use experiences from any performance situation, right? You've all given exams, you've all presented in front of large crowds, and so you know what it feels like to be there, right? While I was doing my master's in applied psychology, I went on to do a few training programs in sports psychology to help me understand what the field is like, because I was very new to it back then. There weren't many sports psychologists in the country, and there weren't any recognized degrees either in the country. And so I trained with sports psychologists. I did internships, I did training programs. I got an opportunity to go on field and see what it is like working with a sports psychologist. And after that, I chose to, I thought I didn't have, the information, I didn't have the training to work as a sports psychologist with just that master's. And so I decided to get a specialized training in sport and exercise psychology, which is why I went to the UK. I studied at Loughborough University in Leicestershire, and I did an MSc there. It was a one-year course, and I chose that deliberately because I already had a 2 years master's degree behind me. But if you're considering going, straight out for a master's in sports psychology, there are other countries you can look at as well. There's Canada, there's the US, there's Australia, and a lot of the European countries as well, right? How do you choose your university? How do you choose the course that you're going to study at? The best thing to do is to do research online. Obviously, you can visit consultants, but it's always helpful to also do your own research. Pull up these university ranking lists, for example, do a quick research on, the best sports psychology schools or sports science schools in the particular country that you're looking at. This is if you're looking at studying outside, right? Open up their websites, look at who's teaching, your faculty, look at, the university standing, whether it's recognized by any institute, for example, in the UK, whether it's recognized by the BPS, which is the British Psychological Society. In America, it would be the American Psychological Association, and so on. Compare the modules, because what you would be studying would be different from one university to the other. So make sure you look at that as well. And then on the basis of what you find interesting, or which faculty's research work you are more interested in, that would help you shortlist your university. And then obviously fees would also be a huge deciding factor, because the fees for each university would differ, right? Some might offer you scholarships, etc. If you choose to study in India, there are a few degrees that have come up over the last few years. There's Guru Nanak Dev in Amritsar that I'm familiar with. And there are a lot of other diplomas and certificate courses. So you can do a master's in psychology and then choose to do, a diploma, a postgraduate diploma in sports psychology. But I think, again, a quick Google search will help you, and then you can call up the colleges and check with them. And in terms of working, another question that I get, what is the scope? Do sports psychologists get employed? Is it easy to find a job? Obviously, the pandemic has made it difficult for a lot of people, not only psychologists, but even other professionals. But organizations and academies are now making space for sports psychologists. Sports Authority of India is the largest recruiter of sports science professionals, including sports psychologists. There's, All India Football Association, All India Football Federation, that recruits sports psychologists, sports science professionals. There's Reliance that recruits sports psychologists. So there is, a lot of scope, and you don't do too badly in terms of getting paid as well. Of course, the climb may be slow for some, but you get there eventually. And you can also choose to freelance, or set up your own consultancy or set up your own individual practice. But that's where you have to go out. You have to go on field, visit people, make contacts, build your network, and get in clients, right? So if there is a tournament happening at a particular club in your neighborhood, go down there, talk to parents, talk to athletes, introduce yourself, explain what you do, offer to do in your initial days, obviously, when you're just starting out, offer to do, free awareness workshops. Of course, when I was starting out, I had to do a lot of free work because not too many people knew what sports psychology is. But people are ready to pay right now. If they don't, then sometimes you can take a call whether you want to offer, free 30-minute workshop to help them understand what it is, or you can charge them a minimal fee, registration, 100 rupees, so that there's some kind of commitment. How you do it is completely up to you, but these are the ways you can go out on field, network, get to know people, introduce yourself, and that's how you build your clients. And of course, then clients talk to other clients, and then people get in touch with you via referrals. Another way is you can network online. There's LinkedIn. You can get in touch with coaches. A lot of people are online right now, and you're not only limited to working within your state. With technology, you can work across the country and even internationally, right? I have a few clients who are all over India. I have clients who are outside India as well. And if you have the skills, if you are competent and you're the expert in that area, then you can really work and do a lot of good work, right? So I hope I was able to explain to you all what sports psychology is, what working as a sports psychologist would look like, and what is the pathway to becoming and training yourself, become a sports psychologist. I think that would be it. Thank you.
Thank you so much, ma'am. It was very insightful, as this is an upcoming field and not many people are completely aware of it. So all the questions that you answered, it was very informative. We'll take up a few questions. So one of the questions is, can the quality of leadership and team building be developed by training?
Definitely. I think, when a lot of athletes come in together, they're all coming from, different places, especially in a country like India that's so diverse. We're coming from different, parts of the country. And with some of our leagues right now, we even have international players. And so training the team to play together as one is very, very important. And you can actually see the difference really, when a team has that good dynamic, and you can definitely train it. There are a lot of, I don't know if, some of the students here are studying social psychology, but a lot of social psychology can be applied there to group dynamics, etc. So yes, you can definitely train it. One way is to, do some group sharing activities, mutual disclosure, letting people connect not only, superficially, but at an emotional level. And when you have players that really connect, it really shows on field. So yes, my answer would be yes.
All right, thank you, ma'am. Another question is, if you do not have a sports background necessarily, and if you want to come into the sports psychology field, and say you're interested in more of the research work, what would that involve?
Right. So unfortunately, there isn't much sports psychology research that is based in India. Each university that you're affiliated to would have a different process. So for example, if you are, a student who is studying, you may not always have, you may be studying at your, master's level for an applied psychology degree. You have a lot of conferences here. You can do research there. Then you can choose to publish that data. For example, you can write to international journals, and a lot of them accept these papers if you follow the right guidelines. So get your ethics approval from the right board. I know in India, there's Monk Prayogshala that has a ethics review board. So if you just write your research and send it to them, they will review it, and then you can write to a journal, whether it's Indian or international, to publish that work. You don't necessarily have to have sport, be an athlete to be able to do this, but you need to have access to athletes, because that would be, your sample. So yeah, you don't need the experience, but this is how you would go about doing it. A PhD is another option if you want to get into the research work after your master's. you do an MPhil or you directly do a PhD, and that's the way to research in sports psychology or any field really.
Right. So you were mentioning, explaining us earlier about Naomi's case that recently happened. Now, since social media has come into the picture, athletes are, constantly scrutinized for their performances, be it good or bad. They get extreme ends for both.
Right.
So when it comes to, small failures, because as an athlete, you're bound to face failures at some point. So how do these athletes, cope with such stresses? And how does a sports psychologist come into the picture and help them through the process?
Right. The approach would really differ from psychologist to psychologist, and it would rely heavily on their approach. Professionally, I am trained in REBT, so I use that primarily, but then of course it depends on the needs of my athlete as well. So to give you an example, if, and people have opinions all the time, right? Even when I came on today, I think before I spoke, a lot of you seen my face and have some opinion about that, and that's uncontrollable. And so some people verbalize this as well, and that's what we see with the media and on social media with people's comments and the things that they say. And I think athletes and individuals in general can be taught to realize or to notice the difference between facts and opinions. Right? Opinions aren't necessarily true. It's how we see things. It's our perspective. It can differ, and even if it is true, because failures are inevitable, right? The world's greatest athletes have failed at some point in their life. No one was born, a great athlete, and no one stayed up there for very, very long either. And so, just understanding the inevitability of it, again, working on thoughts and beliefs, because ultimately our thoughts and beliefs affect how we feel and how we behave in situations, right? So if we can identify the unhelpful patterns and then work on making them more helpful, they don't always have to be overly positive, right? So if I have, a terrible performance, I'm not going to say, yeah, I'm happy about it. That's not possible. I can feel disappointed. I can feel regret. I can feel, anger towards myself, as long as it's healthy anger. It's qualitatively different from unhealthy anger where I act out and lash out, etc. If I can learn to do that, to learn to identify the thoughts that are responsible for those unhealthy emotions and behaviors and change them to thoughts that are helpful, more rational, that's how we can help athletes cope with these situations.
Right. So there's a question by Devyanshi. If a person is addicted to drugs, is it possible that they will get a clean chit in sports?
So doping in sport is a major area. Unfortunately, that's not an area that I specialize in, but with the knowledge that I have, if I was working with a team and I found an athlete, who was using some kind of substance, I would work with the athlete to obviously understand the nature of the history of use and the severity. And then depending on my assessment, I would choose to refer the athlete, or depending on whether it's an individual athlete or whether I'm working with a team, a lot of other things come into play, whether I, report them to the management or whether I can work with the athlete, because there's always a chance of getting tested. They have these random drug tests, and if, you're found using any of these, then you're going to be banned. You're going to lose all the reputation you have. So, the different protocols for different situations. Unfortunately, that's not an area that I'm formally trained in, and so I would refer to someone who's trained to handle such situations. I'm sorry, I couldn't be of more help with that question.
Okay, no issues. So another question is, athletes might not have best days every time, and they might feel emotionally drained at times as well. But during performances, they are, expected to give their best. So how do you train them to sort of have that, when they feel emotionally drained, to give their best performance?
I think that's where Naomi Osaka's example also comes in. I would personally never force my athlete to perform when they're not mentally there, or when they're emotionally drained, because I've had athletes who had to retire from matches because they couldn't continue, because when you're drained, it's going to show. What we can do is train the athletes to identify when they're overworking themselves, when they're approaching burnout, so that they don't reach that stage, right? However, if they do reach it, I think the best thing to do is to think about, what is best for them then. Is the performance really important, or is their mental health or physical health, whatever the case be, is that more important at that time? And then helping them, I would never decide for the athlete personally, just sort of helping the athlete see it for what it is and then help them make a decision about it is what my approach would be. Personally, if I was competing and I got to a point like that, I would take a step back and take some time off. Performance is important for a lot of people, but not at the cost of health, physical or mental health.
Right. So when it comes to physical injuries as well, during their recovery period, where do you step in and help them with the recovery process?
Right. So sports psychologists can work in injury prevention as well as recovery. When it comes to prevention, stress is a huge contributor to injuries. Attention is also one of the factors that could lead to injuries. So really training this aspect can help with the prevention. Of course, you can't guarantee that they would never be injured, but you can always help with reducing the chances. When it comes to rehabilitation right at the start, because as soon as an athlete is injured, and in most cases if it is a bad injury, they have to take a step back, take some time off. Sometimes there are some rapid and drastic changes as well. Just helping them cope with that, come to terms with it, because acceptance, it's similar to the stages of grief. Like first you need to accept what has happened, and then there's denial in most cases. In some cases, there's also, it hasn't sunk in yet that, I can never play sport. I have to step out for, a year or a few months. And so just helping them through that process. Sometimes they can feel isolated because they were part of a team and now they're not. There's fear of, say, losing their place on the team. What if I am replaced? Because people will now view me as weaker. Coping with not being able to be up there when they eventually get back to performing. So I'm going to perform now, but there's a possibility that I'm not going to be as good as I was, and it's going to take me time to climb back there. So just dealing with all of these different situations is where a sports psychologist comes into the rehabilitation process. And from personal experience, it's very, very, very important. I did not have it back then, but it's very, very important for to be able to really overcome, because if you don't work through the psychological rehabilitation process, there could be a high fear of re-injury. So you could be physically fit, but you are holding back because of the fear of re-injury or new injury in most cases.
Right.
Yeah.
So there's another question. So if you want to pursue sports psychology but not necessarily work in India, and you're looking at abroad as your options, so what are the things to be considered when you want to pursue your career abroad?
Right. So I've already spoken about the application process. So you do research about the duration of your degree. What are your visa requirements in that country? So I can talk about very few countries because of the research that I did. So the UK, for example, because that's where I've studied, you do the 1-year master's from a BPS recognized university. And then that's considered stage 1. Okay, stage 2 would be supervised training. So you need to complete a few hours under the supervision of trained professionals. But back then when I studied, we only had 4 months after our degree ended. So my degree ended in September. I had until the end of Jan to stay in the country and look for a job. Getting a job as a psychologist without a license is not very high. And so a lot of people then opt to pursue a PhD, and they do their PhD part-time, and they do their stage 2, that is supervised training part-time. Once you have that status, once you are chartered by the BPS, that's when you can work as a sports psychologist in the country. In terms of visas, I think your employer would have to support you. I'm not sure what the other options are. The other pathway, the British Association of Sport and Exercise Sciences, they have another pathway similar. So you do your master's and then you do a training from a basis qualified professional. That's how you get a job. There were talks about extending the 4 months in UK after your degree completion to 2 years. I don't know if that's still the case, but I'm sure a consultant will help you out with that. And it's almost similar in most countries, including Canada, Australia, and America. You do your master's, you need to do your supervised training, specific amount of hours to give an exam, and then you can get your license to practice there. Canada gives you 2 years after your degree. Australia also gives you 2 years after your degree. And the US gave you, I'm not sure what the rules are right now. And with the pandemic, I don't know if any of that has changed, but that's usually the process. Your master's, supervised training, and an exam to get your license abroad.
Right. So Nandita asks, what inspired you to take up sports psychology?
I think for me, it was having that experience in sport. I was always drawn to psychology. I knew I always wanted to do psychology, and I thought it was clinical, like most people think it is when they are young. And I worked with children as well through most of my education years. And when I actually found out what goes into working as a clinical psychologist, I realized I wasn't really interested in it. And it was about the same time I was, introduced to sports psychology. And I said, why not? Let me just, get in touch with a sports psychologist and see what it is. Because I knew how important it was, but I didn't know whether I would like working in the field. And I loved it. It was as though I was back into sport, competing and training. And a lot of my work is on field, of course, not right now, but I work on field as well with athletes, applying some of what we discuss in sessions to their performance. I do a lot of observations and match analysis. So, just sitting down in an office or in a clinic was not something that I enjoyed, because I spent most of my life on the track and on the field. And that's how I decided that I want to explore the field. Obviously, I didn't know whether I would make it as a sports psychology, and my applied psychology degree was always my backup. But I never needed the backup really. It's been a great field to work with.
Right. So another thing is, since this pandemic has started, everybody is, using online spaces. How has that affected the sports psychology area?
Personally, for me, not a lot. I know a lot of sports psychologists who've just graduated are struggling a little bit in finding work, because like I said, how we find work is go out there, network, get people to know us. But you can also network online, to be honest. There's LinkedIn and there's Facebook groups with different sport academies, etc. You can call them up and introduce yourself, send across a profile, a CV. So you just have to network online right now. It really hasn't affected work, because athletes are still training. They may not be training with the same intensity, but competitive athletes are still training because they don't want to lose form. So work really hasn't stopped. It's just not on field anymore as I would want it to be. It's like this, which for me is not as enjoyable, but I like the work that I do, so I get by. It really hasn't affected the field much though.
So is there any advice you would like to give to the budding sports psychologists?
I think I would say, if sport is your passion, then definitely look into the area, see what opportunities are out there, and don't be disheartened if you don't get a lot of work initially, because that's just the process of working. As a sports psychologist, you might call 10 people and 9 people might say no. Sometimes all 10 might say no. You just need to call the next 10 people and get in touch with them, right? So just like in sport, you have to keep at it. You can't be, if you are, thrown down by, a lot of the experiences you have, just keep going and you'll get there at some point. So the same principle that applies to sport, working in the field of sport.
Right. So, as any student from psychology usually faces a lot of problems when it comes to internships or training. So when it comes to sports psychology, how do you take that first step into this field after your, theory part of it is done?
Right. So I don't think you have to really wait for the theory part to be done. You can always get in touch with sports psychologists, ask if they're looking for interns, but read up about the work that they're doing, because it needs to be interesting to you as well, and need to get something out of it. Call them up or write to them and introduce yourself, introduce why you want to do, why you're looking for an internship in the area. Ask whether they have internship opportunities, ask what kind of opportunities. From experience, I know that you won't be able to sit into individual sessions, of course, because of confidentiality and maintaining anonymity. But there's a lot of content development, so you can actually be introduced to a lot of theory even through an internship, right? And it would be theory and then application of that theory. So I use a lot of we do have training programs as well. A lot of psychologists conduct training programs. They can be paid or unpaid, where they teach you the theory and then they teach you to apply it. So maybe look some of those up. You have case discussions with your the psychologist who's letting you intern with them, and that's how you learn really, by applying it and all of that.
All right. So in India, since sports psychology is only coming up, and a lot of people might not take it seriously as much as the traditional ones, clinical and counseling. So what do you think we could possibly do to make people more aware, and even the athletes and people in sports, that sports psychology is very necessary for them to grow in this field? Yeah.
Right. I think sports psychology has definitely grown. A lot of people know about it right now, but the knowledge is more curative, right?
Mhm.
So the response you'll get is, I don't have a problem yet. When I do, I will come see you. So I think awareness about sports psychology is there. Awareness about how it can help you even in the preventive stages is what needs to be focused on right now. Help them see that you don't have to have a problem. You don't need to be faced with a problem to work with a sports psychologist, or even a psychologist really in today's day and age, right? Mental health is not the same as mental illness. My mental health could be good, it could be poor, depending on my everyday experiences. And if I work with a psychologist, sport or otherwise, I just have the skill set to deal with that and make sure that I'm taking care of my mental health. Same thing with performance. I may not have a problem, but I can learn the skills to make sure I can cope with the situations that I would ever face. So that kind of awareness is what needs to be, that needs to go out there right now.
Right. Okay, thank you so much, ma'am. It was really amazing. Like, I personally didn't know much about sports psychology as such. So this session has really helped me to, understand this field more. And now I would like to hand it over to Sonia to thank you and give you the floor.
Thank you.
Thank you, ma'am. And let me tell you, it's not my opinion. It is a fact that this was a supremely interesting and informative session. And through your immense knowledge and experience, we definitely, like how Gloria told, we definitely got to know a lot about what goes into the world of sports psychology. So, as a token of our love and appreciation, I would request our tech team to present to you with an e-certificate.
Thank you.
Ma'am, this will be mailed shortly to you.
No problem. Yeah.
And thank you so much for being here with us today. And it was great to listen and hear everything that you had to share with us about sports psychology and psychology in general. So thank you so much for your time. And I would like to pass on the mic to our next MC to introduce our speaker.
Thank you.
Good morning, everyone. Here is MC Srivarshni, and I'm glad to invite our next guest speaker to this dais, Dr. Lakshmi T. Rajan. She is a practicing psychologist, psychotherapist, counselor, educationalist, and a yogic scholar. For over 15 years, Dr. Lakshmi Rajan has devoted her life and work to the research of human behavior. Through her intensive research, she has developed mind management and delta state meditation, a breakthrough in psychological research, which has brought a remarkable results in the treatment of psychological disorders and has given a new lease to life of many people. Her advanced and effective therapies have brought transformation in the lives of many special children and psychiatric patients and made them lead a normal and independent life. Her simplicity, her humbleness, and service transformed many lives across this nation. She is a mentor and guided many leaders, professionals, and doctors. Her values and knowledge made others learn for their life and work. She leads by an example and is a role model. I'm glad to welcome you, ma'am. Welcome. Now, I'd like to hand over this session forward to Will Moppy.
Thank you so much, Sri. Good afternoon, ma'am. We will be having some questions for you, and let me kick this off with a very easy question. What inspired a psychologist?
Pardon me, can you please repeat the question? Because I was into unmuting my mic.
Yes, no problem, ma'am. What inspired you to become a psychologist?
So I think you are going to ask me many nostalgic questions, and I'm going to go back to my before 3 decades where I started off. Professionally, I started my profession as a teacher, and being done my B.Ed and got interested in child psychology more, student psychology, and then I did my MBA in HR, where I started having more interest, developed more interest towards learning more human behavior and mind. So that was the interest.
Yes, ma'am. Thank you so much, ma'am. Like you have mentioned, you have been shifting your field from education to psychology and then to business management. And can you just tell us how this has helped you so far in your journey?
Yeah, it helped me to understand more about personal. See, everything, even though they are different fields, I tried to connect everything, whatever I have studied in each fields. Being a teacher, I try to understand the psychology of the students, adolescents, and their behavior, and peer relationship, and the stress in the work, and how the work-life balance is there throughout. Whether it is a teaching profession or it is in business management or stuffs, and they all are interconnected in everything. So I think like finally it shaped me in finding out what I need to do in psychology.
Yes, thank you so much, ma'am. And can you just tell us more about your job profile? You have just mentioned that you have been working for more than 3 decades. So can you just tell us what exactly you've been doing all those years?
Will it be okay if I take a longer time and my answer be lengthy? Am I audible?
Yes, ma'am. Yes, you are audible.
Yeah. So basically, like when I started off, as I said, I started my profession as a teacher, and yeah, being basically a physics student. Graduation, I did my graduation in my physics, and while I was doing physics itself, I actually liked quantum physics and atomic physics more. So, but somehow I couldn't do my master's because of circumstances and situations. I could not do my master's in physics. So in those days, like, for girls, I'm talking about in 90s, okay, early 90s. So in those days, like people were thinking, being a teacher, teaching profession is one of the best profession for a girl. So I ended up finishing B.Ed, and that was actually helped me a lot in understanding the psychology and the human behavior. But somehow instead of understanding others, I started understanding me more. What is happening within me and what is happening with people outside. That was the tool which I took when I studied psychology. And every time when I meet people, I try to be non-judgmental and just observe them as they are, what they are doing. This has been a habit right from a very early stage for me. So probably that is the reason I have ended up as a psychologist and doing yoga also. So I would request all the young psychologists here also to, rather than trying to understand what your client thinks and behave, it would be better as a psychologist, first we understand what is in my mind and what am I, how I am behaving in various situations. So that should be the analysis point for every psychologist. So if I can analyze that way, then in every way that I can say that I have tried to fine tune my abilities, skills, capacities, and what are the criticisms that we have faced in life, and are they really true with my personality? And if they are true, how can I change it? See, it's not that every individual is always positive and always negative. No, you have both positivity as well as negativity. So when I inquired about those things, it was very hard for me to accept that, yeah, I have certain problems. So that courage was developed when I started my research in yoga. So I could fine tune my abilities, capacities, and skills as a psychologist further in that way. So that is one of the connection that I find everywhere. So as a psychologist, also for young psychologists, they have to analyze what are their, rather than analyzing what are their strengths and strengthening them, it would be wiser to analyze what are your weakness and take out that weakness or convert those challenges to opportunities. Only those things will help you to sustain yourself as a successful psychologist in the field.
Yes, ma'am, that is so true. Sometimes we tend to not understand our own feelings, and I guess you have tell us very. And can you just tell us, what is the qualification to become a psychologist in India?
In India, the qualification is basically, I would say, rather than having a master's or MPhil, it would be better if you can develop unconditional positive regard and empathetic feeling. Yeah, of course, the certificates are very much essential about, you have to have a master's, at least a master's degree in any field, psychology, like clinical or applied or general or any field you can take up a master's, minimum master's. And then, you have to develop those micro skills. What is that? That is what is very important. Micro skills are more than the micro skill, the core conditions. The core conditions one has to develop. That is the main qualification one has to develop to become a psychologist, especially in India. Not only in India, in everywhere for that matter. In India more because people are expecting, because in India, it's a very diverse culture. So, and unconditional positive regard and empathy is the root of this culture, this country's culture. So without having that root as a core condition, it will be very difficult for a person to be a successful psychologist in India. We are not analytical. We are not practical oriented in India. We are logical. We are intuitive based. So that feel good factor, that is what is expected from a psychologist here in India. Not how much they know about CBT, how much they know about catharsis, how much they know about what is the research, what is the behind it, DBT or anything. What they are expecting is, do they have the experience to talk to me? Do they have the life experience to talk to me? That is what in Indian setting people are expecting. Therefore, unconditional positive regard and empathy has to be developed here to become a successful psychologist and in India. Other than that, yeah, basically a master's in psychology is a must.
Okay, thank you so much for that, ma'am. And can you just tell us what is the importance of research in the field of psychology?
Very important. Very, very important. Especially young psychologists have to put in their research on developing more indigenous based techniques. In Indian Western setting. Whatever we are using now is based on the Western culture. So I don't think they are culture fair. So youngsters have to develop more. Youngsters have to develop more indigenous-based techniques which can be used in this country. Because in India, if you take every 100 kilometers, there is a diversity in culture. The belief system change, entire belief system change, and right from the food they eat to clothing they wear, it changes. So even the physiological base itself changes, means accordingly the higher hierarchy of needs and how much value they give to each: love, belonging, safety and security and esteem, how much they change. Within every 100 kilometers, you can feel that change. Of course, the core is one. Whether they belong to south or north or east or west, the core is the same. But the way they go to the core changes within every 100 kilometers. So the research is very, very important in India, especially to develop more indigenous-based techniques. Another important point for research-based is that nowadays we say that in all the places we say that psychology is a science, and we are trying to find out the base in the neuroscience also. There are neuropsychology is a new field itself that is coming up, where they are trying to find out what is the neural connections and what is the changes in the neural connections when there is an emotion or the feeling changes. That is what they are trying to find out. Then why do we still have a doubt whether it is an arts or a science? Why can't we call it as only a science? Even now there are places where it is called as MA Psychology or BA Psychology, Bachelor of Arts Psychology, Masters of Arts Psychology. Why can't we have it as MSc and BSc? So people have to do more research on these two aspects. Research is very, very important in this field.
Ma'am, I agree with you with the research and especially with the diversity, because coming from different places, as you have mentioned, different dresses, different food, and research is very important in today's world. And my next question would be, what are the, we know you have, accomplished so much, but can you just tell us some of your major accomplishments?
I don't agree with the word that you say that I have accomplished so much. To be frank with you, I haven't done anything. That would be my underlying view, because there is whatever we learn, we have learned everything and there is nothing to learn, and then the progress stops, the growth stops there. And every client is unique to me. Every session is new to me. With every client, I learn. With every sessions, I learn, whether it is a group or individual session. When I take internship classes, I learn a lot from the youngsters. Like in today's psychology students, they are teaching me more things, especially in coming to 1 year before, I was not in a position to use Zoom meetings or Google Meet platforms to take psychology classes or yoga classes. But nowadays I'm taking it. It is because we learn from these youngsters only. Now, today's youngsters are highly analytical. They know many things. They are very brilliant. They are very intelligent. Only thing is they are not able to channelize their energy in a positive direction. If they can utilize the experiences of elders like us and channelize their energy in the correct direction, they will shine up like anything, because they are highly analytical and they are very, very brilliant. I'm so happy to see the youngsters here, because when we learned how we were thinking and what today's youngsters are thinking, there is a large gap. There is a large gap that I see. Three decades before, how are the adolescent students behaved, and now after 3 decades, how these adolescent kids are behaving. It's entirely a different thing. There is a lot of change that has taken place in their thinking abilities, cognitive abilities itself. It has changed a lot. So today's field, they are looking more into practical oriented approaches. They want results, and if they want results, they are even ready to wait for the time, give their time and energy on it and work on it. So if those guys can be channelized with the elders' experiences, and they can, if they are ready to take, that is also one point with the youngsters. They should be ready to take the advices and guidances from the elders. Of course, we don't talk like you, right? So you should be ready to take our advices, at least 10 words. If we say, if you can take 2 words, at least then it would be of great use to you. So if you can use the advices of the elders and experiences of the elders and channelize your energy in the right way and right direction, the youngsters will come up really very well, and because they are going to be the future of the society. And I'm very happy for that. They are more analytical. And yes, coming to accomplishments and stuffs, I would like to share one incident where somehow Mind Care, which is my clinic, the Mind Care Center for Mental Health, we attract more of psychotic clients. I don't know why, but it happens. Most of the time we get psychotic clients. Psychotic clients, minimum of delusional and maximum of hallucinations and stuffs. So one client I would like to refer here, of course, being understanding the counselor's confidentiality and stuffs. A young guy who came, he was having substance abuse, bipolar and schizoaffective behavior. He was drinking, he was alcoholic, not having any kind of substances, but alcoholic. Increased his this maniac, and in the low phase he used to have even tactile and auditory hallucinations. So we worked with that guy without medicines. 1.5 years we worked with yoga and psychotherapy, and that guy came out of all his problems. He came out of his addiction. His addiction behavior stopped within 3-4 months. And then slowly his hallucinations and high elated moods have been changed. Within say 7-8 months, he was totally all right, but he was under observation with us for another 7-8 months, so that he was put on a maintenance therapy exercises. And that is why I said around 1.5 years we worked with this guy. So 7-8 months we had treated him purely. But after 7-8 months, he was on maintenance therapy for 7-8 months, so that his behavior is stabilized and cognitive restructuring is stabilized. And after that, now he is married, and he is working in a company, and he is leading his life in a very happy manner. So I would like to quote this. So there are various indigenous techniques which youngsters, I have taken only a few. With my research, I have found out only certain things, and there are so many techniques that is available in this culture. You just have to dig deep into that Indian philosophy and find out how you can utilize it to cure any kind of abnormal behavior. And in our clinic, most of the auditory hallucination and visual hallucinations, if they are coming in the initial stages without medicines, we treat with the yoga-based psychotherapy. So within 3-4 months, we have seen good results. One lady, 34 years, she came, and she was literally explaining to us, she sees some black thing, and that black thing is, piercing her stomach with a very sharp knife, and she could feel the blood that is oozing out of her stomach. It's all literally hallucinations that she was explaining to us. When she was explaining itself, we can feel that anxiety symptoms throughout her body. The body itself was shivering when she was explaining to her about that blood, and she could feel, she could smell the blood and all these things she was saying. So we started off with but she was not taking any medicines. So, so she was treated, and within 4 months, all her hallucinations and everything had stopped. So menopausal psychosis, postpartum psychosis, all these things, if it is intervened early and identified early and intervened early, can be cured with the yoga-based psychotherapy. From yoga, I have taken only a spoonful of what is there. So you guys can do more research on that yoga darshanas and the various darshanas. Lot of stuff is there in Indian philosophy. So you have to read through it. It took for me around 10 years of research to take, to formalize, to structure one particular kind of therapy to treat certain behaviors. So like that, you can work on various darshanas and take out certain indigenous techniques which can help because in the coming up millennium, in the coming up years, abnormal behavior is something which you guys are going to have a tough time, when treating with abnormal behaviors. Even a newborn is born with more anxiety because the mother was suffering with anxiety during the pregnancy. So the child, when it is coming to the world itself, is born with anxiety, ADHD. I worked with one pediatric OCD client, pediatric OCD with psychotic symptoms. He was 9 years old. And 4 sittings, the OCD was stopped. So within 2 sittings, the auditory hallucinations were stopped. Such techniques we have in Indian philosophy, one has to do. That is why I said research is very, very important in this area. It has to be documented. It has to be documented and done as a research and get published. I am ready to help you guys if you want to do any research on that.
Thank you so much. I believe that is truly amazing, whatever you have done. And so can you just tell us more about like some of the interesting aspects of your job, of your profession?
Interesting aspects of the profession. Yeah, sometimes it's so humorous that you don't feel like be very serious talking to the client, but you cannot smile, you cannot even laugh in front of the client. Many times we have come across such places, especially when we are sitting with the marital clients and things. And just a day before yesterday, I was having an online counseling session with one of my old clients. So I don't know how many of you will understand Tamil. She said, because I advised her, like, you have to listen to your mother, parents are so important in life. Like that, we were counseling during it's a part of counseling that I was telling her. So she was telling me, in the young days itself, I didn't listen to my mother. Do you think that I will listen to my mother now? And there were 4 of my other trainee students who were sitting, they started laughing. But it was like, I couldn't laugh because I was in the screen with her. Okay, the other students were off the screen, behind the camera they were. So like this, there are so many incidences which happens, especially in the marital settings inside the counseling room. My trainee counselors will go out and laugh and drink some water and come. I cannot even go out and laugh because I'm giving them counseling. So I cannot even go out and laugh. So I'm very strict in that way because I have told my trainee counselors, if you are sitting inside, you should never open your mouth, giggle, that you should not giggle. So because for them, for the client, the problem is very, very important. The problem is very, very big for you as a psychologist because you are viewing the problem from outside. For you, it looks so simple. But for them, the problem is very, very big. So it is very important that you don't giggle, you don't smile when you are in the counseling sessions. But many times it happens like it happens. Another way how it happens is some youngsters, see now it is, I'm 50, I'm in my 50s, okay. So when young adults come, when they talk something continuously, I'm having back-to-back sessions, means sometimes I get angry. Okay, but due to the professional ethics that is inbuilt, I cannot shout at them. At the same time, I have to be empathetically say that they are wrong. That is a very interesting and situation which I take a long time for that, because it is, I myself take 2-3 deep breaths to control my anger at that particular time, or drink some water. And then I talk to them very politely, very positively, I have to say, controlling all my anger. So these all are certain things which I come across in daily life. Is your internet unstable or
Having
mine?
worked for so long and being in this working professional, can you just tell us some of the challenges that you have faced so far?
Lots of challenges, I could say. Being a lady, standing in the front in the society, I run my own suicide prevention 24/7 cell also. So many people misuse the counseling sessions. Many people misuse the numbers. They call late night and they misbehave with you. Do your clinic drunk. No, that also happens. Many times it happens. The client walks into your clinic at 7. You should be very careful on that. And being a lady, you have certain ethical considerations to work with clients. So is there a lag? Am I audible? Is there a lag?
Yes, ma'am, you're audible.
Yes, ma'am, you're audible.
Yeah. So these challenges, yeah, you instead of getting afraid of those challenges, face those challenges and come up. For that, you should have courage. You should be strengthened from inside. You should have passion towards the subject. You should consider all kinds of ethical implications, being a lady, being a female into this profession. For male also the same thing. It is not that male or female. For female, the ethical considerations are more than a male. But for both of them, we have ethical considerations which has to be taken into consideration, and you should know where to draw your lines when you are in the counseling session or the therapy session, which I always tell my internship students, like, you should know where you are, you should know where you stand. If you are looking for certain non-verbal cues in your client, always remember that your client is also looking for those non-verbal cues in you. If you are taking the MSc of the client, if you are taking as a psychologist the MSc of the client, observing his appearance, his mood, his behavior, all these things, the client is also looking at you in the same way. At least your appearance, he is looking at you. So dressed professional. Your dress, your sense of sitting, your sense of talking to him should be in such a way, him or her, it should be in such a way that he should respect you. That much consideration you should give for your profession. That much professional your profession should be. That I am very particular, and it was very difficult during the early days. Now I am getting used to it.
And areas do psychologists in India mostly work under?
I'm not hearing.
Yes. What areas do psychologists in India mostly work under?
What areas you are asking?
Yes, ma'am.
Areas means broadly means they are everyone want to take up counseling. They want to come for counseling, but they study clinical. So that itself is a problem. Another thing, they work for hospital setting, they go and work. School settings, they go and work. Youngsters do not have the courage to set up their own clinic. I don't know why. Why are you not confident enough of your own theory base? I don't know why. But youngsters today, they are not confident enough. When I asked, I came across one MPhil student. He is a psychology MPhil student. He was doing his research on de-addiction, smoking. So I asked him, like, why don't you try opening a clinic, dear? He was a male, he was a man. So he said, ma'am, you are right, ma'am, but I need to have some stable income, no, for running my family, he's saying. But if you are like confident of your techniques and therapies, you can generate a stable income in clinic. So you have to get yourself trained in one form of therapy and be confident of that therapy. You can do wonders, because as I said, you all are very brilliant. So you can do wonders in curing the mental disorder and the mental illness. Just 5 minutes before I joined, she was talking about there is a difference between mental disorders and mental illness. Schizophrenia is a mental illness. Mental disorders can be easily cured. Stress, depression, anxiety, all these things can be easily cured if you take training of certain kind of indigenous techniques.
And ma'am, what kind of organizations or agencies mostly hire psychologists?
See, that is a very sad truth that I have to say here, because psychologists are not given that respect as they should be. They consider counselors as a marketing counselor, which is a very, very sad truth. We have to accept that. And that is why the youngsters have to change those thought modalities. Youngsters have to change. The agencies, as I said, hospitals hire counselors to use in their setting. And schools, colleges, it has become mandatory in schools and colleges to have one counselor. Again, I feel like for 1,000 students, there is only one counselor, which is being hired by the school. Then how will the counselor be able to do justice for the job? The counselor will not be able to do justice. For 1,000 students, at least 500 adolescents are there in that. After 8th, you are considered as an adolescent. 8th, 9th, 10th, 11th, and 12th, higher secondary school. Almost 500 students are there for 1,000 students. How will the counselor be able to do justice? So those things are to be considered when it is coming of hiring as a psychologist. Psychologist first has to be treated for, given respect for their profession, which is not there in the social setting. And they think that counselors means, oh, you are giving only advice. No, that is what they are thinking. That advice also we are giving in a professional way that they are not understanding. Based on their problem only, we are going to give them any kind of suggestions. We are not going to advise them. We are going to give suggestions only as counselors. No? So that they are not understanding. Hospitals and schools and colleges, they hire counselors. Some NGOs also sometimes hire counselors, psychologists.
Okay, and ma'am, as a graduate or postgraduate just coming out of psychology, what should one approach, to entering the field of psychology?
What?
As a graduate or postgraduate, how should one approach to pursue into getting into the field?
You have done your postgraduate, then why are you fearing how to approach it as a field? You have done your post-graduation, you have done your master's. That is the fear that the youngsters are having. You have done your master's means then why are you afraid? See, if an engineer has done his BTech in ECE means he is clear of his concepts, right? Anything you ask in electronics, he is ready to answer you. He is confident of his concepts. Why are you not as a PG holder? The base, you are not everything from the base. As a psychologist, you should approach the subject as if you are learning everything from the base. For example, I tell you, when you are learning the learning theories are there, no? Learning, I'm not going to take the theory, don't worry, it's not a lecture. Okay. So when you are learning the learning theories, especially the Pavlov's or the Skinner's, okay, and the observational learning, these things are main learning theories, no? Other than that, it's all small things. Classical conditioning, parent conditioning, and observational learning are the basic three major learning theories. Okay, now you have learned it. Have you ever analyzed how I learned? When I learned to write the slanting line and the horizontal line and the vertical line, what theory I used? Was it a classical conditioning? Was it an apparent conditioning? Or was it observational learning? Can I differentiate? The moment I made tea, it was an observational learning, right? I observed my mother making tea and I am making tea. So that learning comes from observation. Will I be able to differentiate all the learning that I have within me based on the theories that I have learned? When I am learning the motivation and the emotion theories, will I be able to understand my emotions, my motivations, my frustration, my anger, frustration theory? So if that is the way one has to approach, that is the way one has to approach the subject. Try to understand what is good, because mind is a metaphysical concept. Mind is entirely a metaphysical concept. You don't know where it is, but you know that it is controlling your brain. See, as a psychologist, you all very well know that mind is not brain. Yeah, as a psychologist, at least you all know that mind is not brain. If it is a heterogeneous group, if there is no psychologist, then we can consider that mind is equal to brain and then pursue further. But as psychologists, first itself, we are very clear mind is not equal to brain. That is the first chapter we study in Introduction to Psychology. Mind is not brain. Mind is a metaphysical concept and brain is the physical quantity of it. We study that. So first itself, we differentiated that. Now that metaphysical concept, what is there in me? What is my mind telling me? How my mind is controlling this object called brain? Because this brain is very important for controlling my behavior, my way of speech, my actions, my deliberations in the language. Everything in the output behavior, this brain plays a very important role. So this is controlled by a metaphysical concept which is called as mind, about which we do not know where does it lie, what are the building blocks, we do not know. There are theories, structuralism, functionalism is all there. Have we able to decode it? Can we make an model of it, working model of a mind? Can we make it? Why? Because I don't know my mind itself. That is the approach one has to have as a youngster, that let me see what is in my mind before I take up any client. Because the moment you study psychology, there will be some friends of you who are not studying psychology. They will come and ask you, oh, you are studying psychology. Tell me, what am I thinking? Many friends of you will ask, you know, you are studying psychology. Tell me, what am I thinking? I am not studying psychology to tell what people think. I am studying psychology to understand how I think. That should be the approach. I study psychology to understand why and how I behave in a certain way in certain situations. Why I feel in a certain way in certain situations. What are the theories behind it? Will I be able to apply that same desensitization theory to me? Or token economy to me? Cognitive restructuring, rational emotive behavior therapy, will I be able to apply it on me? Can I take me as my subject and work on me before I work on any client? That will give you more confidence in the subject. That will give you more courage to face the clients. Come what may, I will face. All of a sudden, I was giving a therapy session and the client was lying down and I was doing Yoga Nidra. So the client was in a very relaxed position. Halfway through, you know, Yoga Nidra means it is dim light and it's completely sober, light. Halfway through means we are almost in a very trance state. That is what Yoga Nidra is about. And all of a sudden, the client gets up and screams. And the client says, no, that is not me, that is not me, that is not me. If there is a therapist who do not have experience in the field, who do not have the basic concepts clear, will get afraid of. Here, what is to be taken under consideration is the client getting up, scream, and started saying, that is not me, that is not me. That itself shows the client had gone into some REM sleep and had come across some unresolved fears, which she does not want to recollect and work. So she started screaming, because in theta state, what happens? Your senses are not functioning to its full, getting withdrawn. So she wanted to say something, and that is why she was not able to say, and she screamed. And when she got up and said, I'm not me, that means that she herself is feeling now guilt of screaming. So as a therapist, what I should say is, it's okay, Kanna, it's okay, relax, it's okay. Drink some water, it's okay, relax. That is not you. I understand that. After saying that, she started crying like anything. Then went on catharsis. All the bottled up emotions she felt, she left. And then another half an hour of counseling or so, she felt relaxed, and I gave her some dark chocolate and she went out. Dark chocolates are something which gives you instant energy, no? So those things, I don't know why I came this, why I asked you. Yeah, approaches, yeah. So only if you understand your own mind, what is happening in your mind, you will be able to take control over any kind of situations.
Thank you so much for that, ma'am. And earlier you've mentioned about how psychologists are not, hired properly and stuff. So can you just tell us how we can create more awareness about psychology as a field?
I think it is gaining awareness. Psychology is gaining awareness. The stigma and taboo is reducing a lot, and people are coming up to psychologists. Thanks to WHO for the mental health theme and the depression theme that they have done. Again, what I would like to say here is more of awareness has been already created. Because people said that it is stigma, no awareness on mental health and all those things. Now there is more awareness. See, for example, you take Instagram, social media. Okay. Now you as a psychologist and me as a psychologist know the depth of the word existential crisis and existential vacuum. But a layman who has not studied psychology, he will also read that same post on existential crisis. Why I'm saying this is, I get calls, and the client says that, ma'am, I have existential crisis. Okay, will you do therapy for it? I said, first tell me what are the symptoms. Then I will decode whether you are having existential crisis or you are having general anxiety disorder. And they study a lot in Google. And because of that, what happens? Whatever symptoms are given in Google for schizophrenia, I and you will also be having it. If suppose I'm having a situational pressure and I'm not unable to sleep, in schizophrenia, unable to sleep is also a symptom prescribed there. Unable to sleep. 2 days I was not able to sleep. Am I having schizophrenia? There are many conditions in the life circumstances where we get irritated. A lot. My daughter comes inside the room when I am giving the interview. Will I not get irritated? I will. Getting irritated is mania. Am I mania? So all the symptoms that is given under everything in the disorder category, every normal person will be having. It is said that 9 out of 10 so-called normal persons behave abnormally. 9 out of 10. We are normal. You and me are normal. Aren't we getting irritated? Aren't we getting angry? Aren't we not going out of sleep for some days together? Examination, let us take. Masters, end semester examination you are taking. Will you be able to sleep? 10 days your examinations are going. Means that 2 weeks you didn't sleep. As per DSM-5 criteria, 2 weeks if you are not able to sleep, you are clinically depressed. Then are you clinically depressed, client? After the examination, you are enthusiastic, you are excited, you are going out of it, you are coming out of it. But these, because you study psychology, even the psychology students also thinking the same way because they overthink. Do I have this? Do I have this? Do I have this? I'm treating one psychology student now, PG psychology. She's having auditory hallucinations. Studied more about abnormal psychology and studied more about psychosis and started thinking that she is having auditory hallucinations and she is able to hear now things. Now I'm treating one psychology student herself. In psychology, what you should do is condition your body and uncondition your mind. Mind functions very well when it is open. Don't keep it rigid. I know this, I know that, I have studied this, I have studied this. So I have this symptom, I'm not able to sleep. Am I getting anxious? Am I going into general anxiety disorder? Am I going into health anxiety? Don't overthink. Everyone will have general anxiety disorder. Everyone are worried. See, I'm having stomachache for 3 days means it is human tendency. I have to go and check a specialist to check whether I have any kind of problem in my abdomen or not. Then I will keep thinking, oh, I have stomachache. So will my liver dysfunction? Will I have cancer in the abdomen? Bhad mein jane do sabko. Live in this moment. Present moment is very important, and that is what yoga says. Condition your body and uncondition your mind. And that is why I took up yoga as a therapeutic technique.
Ma'am, can you just tell us your thoughts about suicide prevention in India?
What answer I can give in this? No? Suicide prevention in India, first suicide itself is wrong. After that only we have to talk about how to prevent it. The thought suicide itself is wrong. Why are we committing? Why is one person committing suicide? Because he is having fear of facing the problem. Fear of failure. So if that can be cured, then why another person is going to think of failure, suicide, taking his life? One has to think that life is very precious. Every moment is precious. Life is very, very precious. You are able to walk, you are able to think clearly, that itself is very precious moment. If you start appreciating your life, then you will never have the thought of suicide.
Yes, that is so true. And ma'am, due to the pandemic, students are not able to go to school and they have to study from home, and they do not have any practical classes. So can you just tell us how students will be able to gain practical knowledge?
No comments on this because one has to learn on their own. It has been like that. I just 2 months before when the clinic was open, I got 2 clinical psychology students. They came to my clinic with my resume, with their resume. They have completed their second year, but they haven't done any practicals. None can we have any practical sessions. However, the college is teaching, we cannot teach. We are not going to teach theory to you. So you have to try your hands and learn from senior psychologists, and that's how you can learn. Otherwise, it is. But nowadays, people are teaching even projective techniques online. That even we are teaching. Our clinical psychologist also teaches projective techniques online, how to score, how to evaluate, and how to administer. These all is done. So I think the professors are also doing a wonderful job. So if they are not learning, then the problem is with the students, because in most of the online classes, sad truth is that you just keep the session online and you do your own work in your mobile, which is wrong. Instead of blaming the online session, it would be better what betterment I can do to do work on this.
Yes, and ma'am, due to the pandemic, do you think there will be more mental health issues coming up? And if so, what can we do to overcome that mental problem?
Yeah, from the first wave to second wave itself, in the first wave, we fought against the virus. In the second wave, we are fighting against the fear. So I don't know what would happen, and God shows His grace upon us that we are not entering into the third wave and the fourth wave. So this itself is causing a lot of fear. So what can be done to overcome that? Appreciate every moment of your life. Start living in the present. Humanistic existential therapists are going to come into picture. Trying to utilize the time that you have got, more than thinking of that I am isolated, think that you are in solitude. And try to analyze and be aware of yourself more.
And ma'am, can you just tell us more about your foundation, Mastermind Foundation? And can you also tell us what was your idea behind this foundation?
Mastermind Foundation started in the year 2005, having an idea of spreading mental health, because at those days it was like going to a psychologist was a taboo. Stigma was associated with the subject and the profession. So the idea of Mastermind Foundation is to spread awareness about mental health only. So for that, we worked at various places, especially in the frontline workers, army, police, doctors, schools, colleges, universities, community-based. Everywhere we have conducted various workshops to create awareness about stress and well-being, how to manage stress, and how there is no zero stress. No one can create a zero stress environment. That is waste. Okay. So that is like once that was done, stress management and well-being was talked more. Then slowly and slowly we spread our wings into the social service activities. Now we are into plantation drives and then feeding the hunger after settling down at Chennai. In the 2015 floods, we worked for feeding the hunger and distributing of materials to the people, to the plantation drives. Viriksham is working towards it. And now for COVID, we are providing pan-India free counseling to people across in 13 different regional languages. All are done as volunteering services. Any problems related to COVID and COVID related, And for that, any kind of counseling you need, you can just log into our website, www.mastermindfoundation.com. It opens in the page of free COVID counseling. We have around 175 plus counselors on board with us. All are experienced counselors. Their numbers are given against their names, and the languages they are expert in, that is also given against their names. So you can choose your language and the counselor and call them. And that is why I said this is also a challenge. Please call them during days rather than during midnights and stuffs. If it is very urgent, really very urgent, you can call them at any time. But if you think that, yeah, you can talk to them in the morning, because they are also human beings. We all are human beings only, right? We need some rest. So that if you can consider, and you can give us a call at any time. So now, as for now, just last week we completed a webinar on how to fight against this three different webinars in 3 different languages to Puducherry police. And we are also providing free counseling to people of Tamil Nadu in all the 32 districts. The request had come from the health department, Tamil Nadu health department itself. So we are providing that. So as much as we are giving back to the society, and let us join hands, and together we can create a society in which we can make a better place for the future generation to live. We should remember that we have hired the society from the future generation. So what are we going to leave to them is what matters. So let us create a beautiful world full of positivity, full of confidence, full of happiness, peace, and joy that only psychologists can create. So together we can. That is the credo of Mastermind Foundation. Together we can.
Ma'am, that is very wonderful. And we have a few questions on the chat as well as on YouTube, but due to time restraint, I won't be able to take up all. So I'll just ask a few questions. One question is, you are very passionate about yoga. Can you stress more on how yoga and the mentions of relieving stress and mental health in Indian philosophy?
Means they want some reference book?
Yes, ma'am. They would like to know
want what they want.
They would like to have like book recommendations.
Yoga cannot be learned through books. Yoga can be learned from trainers only. So you have to go to a trainer who is trained in yoga, who is a good instructor and trained in yoga, and get yourself trained. For that matter, Mindcare is a Ministry of Ayush authorized center for conducting yoga teacher training courses. So you can log into our website, mindcareindia.com, and from there you can take yourself to Ayush Yoga Training Center and get yourself trained. And regarding the books, all the basic scriptures that we have right from Vedas and Upanishads, try to read and try to assimilate some part of it. Take one particular thing, like I took yoga. You can take other darshana, Sankhya. I took Sankhya and yoga. You can take other darshana and or if you want, you can take Sankhya and yoga also. So in yoga also, I took only the pranayama. You can take asanas or other things and how to do that. So that way you can work on it. And other than that, yeah, any old books you can read. All Upanishads, Bhagavad Gita, I wanted to say that. If you are so much interested in indigenous philosophy, start reading Bhagavad Gita. Because the Bhagavad Gita, Lord Krishna is our forerunner of psychologists. He is an all-time best psychologist. So you can read Bhagavad Gita apart from ism. Don't read the book as a religion-based book. Read the book as a psychology book, as you will read Sigmund Freud. Like that, you have to read this Bhagavad Gita, because the first chapter itself, it starts with Arjuna Vishada Yoga. Vishada means it is just lamenting, right? So the entire Bhagavad Gita, his first chapter, he had lamented all his problems, and in the entire 17 chapters, Lord Krishna is counseling him. So you can read that. It's the best book for anxiety and depression, Bhagavad Gita. Yeah, it is all whole psychology.
And ma'am, I'll just take this as my final question for today. Do you think the Indian education system should give more importance to Indian philosophy, as well as should they start teaching subjects like psychology since school level?
To give stress to Indian philosophy, yes. Psychology in the school level, yes, in the higher secondary. So I think the way of teaching techniques in Indian setting itself is right from age of 5. We are taught certain rules. Yamas and niyamas are taught in age and 5. Do not lie. That itself is a yama only. Jhoot nahi bolna. Shuddha rehna, be clean, take bath, get up early in the morning, do some rituals, puja karna, that is all niyamas only. Or personal and social disciplines. The disciplines can be inculcated right from LKG itself. Instead of saying the words, it is from yoga, it is from philosophy, that discipline can be maintained. No? And at the class 10 and 11, yeah, psychology as a subject can be taught.
Thank you so much, ma'am, for your wonderful time. And now I would like to hand over to Sri.
Thank you so much, 3G School of Psychology, for giving this opportunity to share the little knowledge that I have with you all. Very little I have shared with you. And whatever I have given, please, I would request you to use it as a food for thought and think more on it and work on it and analyze. You all are very brilliant. You all are very intelligent, filled with more of positive energies. Thank you so much for this opportunity.
Thank you so much, ma'am. Actually, that was an insightful session where you have motivated so many people and you have shared your experience through your career and life experience. And I hope your mantras about how to become a successful psychologist will help someone who aspires to become a good person and success in their psychologist career. And I hope it's really an eye-opening session for some people, and many would have benefited out from this session, ma'am. And as a token of gratitude, we would like to provide you an e-certificate, and I request our technical team to present. And this will be mailed to you shortly. Thank you, ma'am. And now I would like to welcome the next MC to take forward this session.
Hello. Hi, good afternoon. Thank you for being an amazing audience. Since it's a Sunday, I know all must be tired since y'all are up since morning. We've got special guests today for y'all. Since it's a nice, happy Sunday, so we thought we'll make your mood happy as well, and my Sunday. So introducing Sushmita and Rahul. Sushmita has won So This Is Shine Tak in 2019 and also starred with Palak Muchal. I'm sorry if I'm getting the name correct or wrong. Yes, calling upon Sushmita and Rahul. Sushmita, are you here?
Hello. Hi. Can you hear me?
Sorry.
Yes, yes, you're audible.
Yeah.
Is Rahul gonna be joining us?
Yeah, Rahul is joining.
Okay.
Just shifting the camera angle.
It's fine. It's absolutely fine. There we go.
Hello, everyone.
Hello, hi. Good afternoon. Y'all can start. The platform is all yours.
Okay. We'll start with some songs and eventually you guys can request songs and we'll try to sing those as well.
So, hello everyone. I'm Sushmita. He's Rahul. He's gonna accompany me. He's great vocalist and guitarist as well. So since it's a psychology event, so I've heard that music heals, right? So here we are to give you some musical therapy. So let's begin. Well, starting with a old song, but yet very popular. So we started off with this. You all can request as well. I can see your request if you have any.
Could I request, please?
Yeah, sure.
Could you sing Zara Zara?
Yes, sure. This is everyone's favorite song. Okay. Just a second. We are just setting up something. And guys, if you like the song and if you are enjoying it, just raise your hand or comment below. I can see all your comments. So that will motivate both of us. And you all can follow me on Instagram as well, Sush Official, and on YouTube channel as well.
Okay, let's go.
Okay. So Zara, all of you. पाए मुझे तेरी सभी बातें एक बार दीवानी झूठा ही सही प्यार तो कर मैं भूली नहीं ऐसी मुलाकातें बेचैन करके मुझको मुझसे होना मेरी नजर रूठे जा ना मुझसे मेरे साथ ना ये वादा करते पिया मुश्किल है जीना मेरा मेरे दिल पर जरा महकता है आज तो मेरा दिल मैं प्यासी मुझे भर ले अपनी बाहों में मेरी कसम मुझको सदा दूर कहीं ना जाए दूर रहती है
One second.
Yeah, so that was Zara for you. Jessica.
Thank you so much. Made my Sunday at least.
Thank you.
Yeah, the next song is Agar Tum Saath Ho.
Oh, nice.
Great. Run each other. Okay. कैसे तुम्हें रोका करूं मेरी तरफ हर गम फिसल जाए आँखों में तुमको भरूं बिन बोले बातें तुमसे करूं अगर तुम साथ हो
అది దాంట్లో ఇన్స్ట్రక్షన్స్ ఏది లేదా రాజా ఆ కవర్ లేదా నా ఇన్స్ట్రక్షన్
साथ हो अगर तुम साथ हो yeah.
Thank you. There's something I would love to dedicate to my friends, like since they are all here. Can I do that? Can you sing it for me?
Sure, I know.
Tera yaar hu main.
Yeah, surely. That's also one of my
Guys, for
favorites.
y'all.
तेरा याद नहीं है, right? Okay, that's it.
तुझे छूटा तो कौन बसेगा तुझे छूटा तो कौन रहेगा तू चुप है तो ये डर लगता है अपना मुझको अब कौन कहेगा तू ही वजह तेरे बिना बेवजह बेकार हूँ मैं बेकार हूँ बेकार हूँ मैं आजा तेरे दिल में शरारत तू भागे मीठी सी वो गाली तेरी सुनने को तैयार हूँ तैयार हूँ
Thank you.
Thank you so much. Thank you.
Next song.
I'll just check if there are any suggestions from our audience.
Okay, till then we'll sing our list of songs.
Till the time we get
Sure,
going,
sure.
we'll sing some other
Go
song.
ahead.
One song.
So then this rocking song कमली सबने सुना होगा तो थोड़ा मूड बनाने के लिए
मेरी माही सनम जानम कि बकरे रमेदानम शब गुज़रे जब सोया कि मुझे रमेदानम मेरी माही सनम जानम कि बकरे रमेदानम शब गुज़रे जब सोया कि मुझे रमेदानम नीला कमली कमली नीला कमली कमली नीला कमली कमली मेरे यार नीला कमली कमली नीला कमली कमली नीला कमली कमली मेरे यार छेड़ दिल का कर गया तू दरिया दरिया मेरे यारा अज्ञात मोहल्ले में हर शाम तेरे वालों जब गुजरते जब सोया कि मैं दरिया रमीदाना मेरे मिलाऊं नी मैं कमली कमली नी मैं कमली कमली मैं तो शहर की ठंडी शबनम हाँ गुलशन का इत्र चुराऊं रुख पलूं तो सैलाबूं पर्वत की चीर दिखाऊं नी मैं कमली कमली नी मैं कमली कमली नी मैं कमली कमली मेरे यार की नी मैं कमली कमली नी मैं कमली कमली नी मैं कमली कमली मेरे यार की नी मैं बेखुदी में तो खुदी का जरिया जरिया मेरे यार शायद मैं सितारों का चल वर्गा तो यार शब गुजरे बिलग सोया नी मैं जरिया की तारा मेरे सनम जानम गिर कर यार मीदाम शब गुजरे बिलग सोया नी मैं जरिया मीदाम नी मैं कमली कमली नी मैं कमली कमली नी मैं कमली कमली मेरे यार की नी मैं कमली कमली नी मैं कमली कमली नी मैं कमली कमली मेरे यार की नी मैं कमली कमली नी मैं कमली कमली नी मैं कमली कमली मेरे यार की कमली कमली नी मैं कमली कमली नी मैं कमली कमली मेरे यार की कमली. So yeah. Any requests?
We have a suggestion.
Yeah.
पहली नजर में.
सब रोमांटिक्स सुनने आए. पहली नजर कैसा जादू कर दिया तेरा बन बैठा है मेरा जिया जाने क्या होगा क्या पता इस पल को मिलके आज ये जरा मैं हूँ यहाँ तू है यहाँ तेरी बाहों में आ भी जा ओ जाने जा दोनों जहां तेरी बाहों में आ जा ओ जाने जा दोनों जहां तेरी बाहों में आ जा तेरी अल्लाह तेरी अल्लाह हर दुआ में शामिल तेरा प्यार है तेरे लम्हा भी दुश्वार है तो तुझसे ही दरकार तुझसे राहते तुझसे चाहते तू जो मिले एक दिन से मैं कहीं हो गया लापता ओ जाने जा दोनों जा मेरी बाहों में आ भूल जा ओ जाने जा दोनों जा मेरी बाहों में आ भी जा
Okay. Since a lot.
Yes.
I hope आप लोगों को मजा आ रहा होगा.
I don't know about others, but I am definitely vibing.
Yeah.
We have a next suggestion. It's Boldo Nazara.
इतनी मोहब्बत करूं मैं डूब न जाऊं कहीं वापस किनारे पे आना मैं भूल न जाऊं कहीं देखा जब से चेहरा तेरा मैं तो हफ्तों से सोया नहीं बोल दो ना जरा दिल में जो छुपा मैं किसी से कहूँगा नहीं बोल दो ना जरा दिल में जो छुपा मैं किसी से कहूँगा नहीं मैं किसी से कहूँगा नहीं मुझे नींद आती नहीं है अकेले ख्वाबों में आया करो नहीं चल सकूंगा तुम्हारे बिना मैं मेरा सहारा बनो एक तुम्हें चाहने के अलावा और कुछ हमसे होगा नहीं बोल दो ना जरा दिल में जो छिपा मैं किसी से कहूँगा नहीं मैं किसी से कहूँगा नहीं मैं किसी से कहूँगा नहीं
Yay! The next song is Rabta.
Rabta. मेहरबानी जाते जाते कुछ कर गया गुजरता सा लम्हा तेरा नजारा मिला रोशन सितारा मिला तकदीर की कश्तियों को किनारा मिला सर्दियों से तरसे है जैसी जिंदगी तेरी साबत में दुआएं है उसी के तेरा मिलना है उससे रब का इशारा मारा मुझको बनाया तेरे जैसी किसी के लिए कटे है
Any other song?
Yes, Pani Da.
Okay.
Hope you all are enjoying it.
Yes, definitely. So there's a request for any Darshan Rawal songs.
Darshan.
Songs, it's been so long I've seen any
Can you sing Pehli Mohabbat?
Pehli Mohabbat. इसका मुझे वो वाला था.
Yeah.
If that's fine, I can sing that one. जो सीरियल में गाया था.
That's right.
मेरे इशारे.
Yes.
मत कर कि कर मेरे अम्मा यार तू तुझको इस कदर जाए मेरे निशान 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 मिल जाऊं मैं जैसे कि एक लम्हा मार दे सीने से मेरे रम्मा देखता हूँ सपने तेरे सुन ले मेरी जाने जा अब ये सच हो जाए और खुदा हो मेहरबान मेरे निशान मेरे निशान मेरे निशान मेरे निशान मेरे निशान तो बहुत टाइम बाद गा रहा हूँ तो इसमें मैंने बहुत मिस्टेक्स किए होंगे आई डोंट इवन रिमेंबर दिस सॉन्ग
Yeah, it's been too long. अभी तो विशाल मिश्रा का दौर.
any other request?
We have a last request.
Yeah.
It's Lagja Kaliye.
Yeah. Any event is incomplete without lecture.
Only you can do justice to that song. It's a really difficult song.
हमको मिली है आज घड़ियां नसीब से हमको मिली है आज घड़ियां नसीब से जी भर के देख ले जाए हमको करीब से आपके नसीब में ये बात हो न हो शायद फिर से जन्म मुलाकात हो न हो जितने दूर है चांद सितारे सच पूछो तो मन को झूठे लगते हैं सारे पास जितने दूर है चांद सितारे सच पूछो तो मन को झूठे
Thank you everyone. Thank you so
I
much.
hope you guys enjoyed.
Thank you. We had an amazing session. Thank you so much.
Thank you for inviting us. Actually, it was a really great audience. लोग comments देख रहे थे. इसमें काफी
Yeah, you're getting a good comment, like it's good and everything. So yeah.
You should check YouTube also. It's just overflowing with love for y'all. It's amazing.
Because this is sometimes very new experience. Like अभी digital live show बहुत common हो गया है. But it's like वो जो touch होता है ना, that comes from the comments only. People are commenting and they are showering their love in this manner only. नहीं तो पता ही नहीं चलता if people are listening or not. So yeah.
Yes.
Means a lot.
Thank you. I would like the technical team to present you with any certificate.
Okay, thank you. Thank you so much. Hope you enjoyed
The certificate.
Yes.
The certificate will be mailed to you shortly. So we go for a short break, that is a lunch break from 1:30 to 2. But before that, before getting on with the lunch break, we have another singer for you all, a special one. He's Shivam Baswani. He has started from the 6th grade. I mean, wow, isn't that great? So calling on Shivam. Shivam, are you here?
Hi.
Yes, Shivam.
How's you guys? मैं काफी देर से देख रहा हूँ सिर्फ सेलेक्टेड बंदों के कैमरास ऑफ मतलब ऑन है सॉरी बाकी सबके ऑफ है इज देयर मतलब कोई रीजन है या ऐसे ही am I audible?
Yes, you're audible. And we have a few panelists, and the attendees do not have the feature of turning on the camera. So you can continue.
Okay. Actually, मैं अभी आउट ऑफ स्टेट हूँ काफी टाइम से फ्रॉम 15 to 16 days एंड मेरे पास मेरा गिटार बिल्कुल भी नहीं है बट या मेरे पास मेरा स्पीकर और मेरा दूसरा फोन है तो मैं म्यूजिक के थ्रू आप सबको सुनाऊंगा फॉर श्योर आप प्लीज मेरे को बताना इट्स ऑडिबल और नॉट सो कैन आई स्टार्ट राइट नाउ
Yes, sure.
Okay, I'll sing बोल दो ना जरा it's one of my favorite yeah it's audible इतनी मोहब्बत करो ना मैं डूब न जाऊं कहीं वापस किनारे पे आना मैं भूल न जाऊं कहीं देखा जब से चेहरा तेरा मैं तो अफ्सोस से सोया नहीं बोल दो ना जरा दिल में जो है छुपा मैं किसी से कहूँगा नहीं बोल दो ना जरा दिल में जो है छुपा मैं किसी से कहूँगा नहीं मैं किसी से कहूँगा नहीं मुझे नींद आती नहीं है अकेले मैं आया करूं नहीं चल सकूंगा तुम्हारे बिना मैं मेरा तुम सारा बना एक तुम्हें चाहने के अलावा और कुछ हमसे होगा नहीं। बोल दो ना जरा दिल में जो है छुपा, मैं किसी से कहूँगा नहीं। बोल दो ना जरा दिल में जो है छुपा, मैं किसी से कहूँगा नहीं। मैं किसी से कहूँगा नहीं। This is one of my favorite line of this song. हमारी कमी तुमको महसूस होगी, भिगा देंगी जब बारिशें। मैं भर करके लाया हूँ आँखों में अपनी अधूरी से कुछ ख्वाहिशें। रूह से चाहने वाले आशिक बात जिस्मों की कहते नहीं। बोल दो जरा दिल में जो है छिपा, मैं किसी से कहूँगा नहीं। बोल दो ना जरा दिल में जो है छिपा, मैं किसी से कहूँगा नहीं। मैं किसी से कहूँगा नहीं। That's it.
I have a suggestion.
Yeah.
तुझे बुला दिया.
काली 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 रातों ने, इसकी लिरिक्स में एक सेकंड निकालता हूँ. Just a sec. तुझे बुला दिया, एक सेकंड. Lyrics. थोड़ा सा सुनाता हूँ, just 1 2 3 lines. काली काली खाली रातों से होने लगी है दोस्ती, खोया खोया इन राहों में अब मेरा कुछ भी नहीं. हर पल हर लम्हा मैं कैसे सहता हूँ, हर पल हर लम्हा मैं खुद से ये कहता रहता हूँ. तुझे बुला दिया तुझे बुला दिया तुझे बुला दिया. फिर क्यों तेरी यादों ने मुझे रुला दिया, मुझे रुला दिया. एक्चुअली पता है, विदाउट एनी इंस्ट्रूमेंट थोड़ा सा वो पड़ता है. मतलब इन द सेंस एक जान आ जाती है ना इंस्ट्रूमेंट के साथ, वो वाली बात हो जाती है. तो मेरे पास अभी, मैं सच बताऊं, मेरे पास बस एक स्पीकर है मेरे साथ और मेरे पास फोन है और कुछ नहीं है. सच बता रहा हूँ, मैं बहुत परेशान हूँ काफी टाइम से. तारिणी ने मेरे को बुलाया यहाँ पे, एंड थैंक यू सो मच तारिणी फॉर कॉलिंग मी. या
We have a suggestion.
Mm-hmm.
It's Hosanna.
इसकी भी एक सेकेंड. रोजाना मैंने बहुत कम सुना है. एक सेकेंड. रोजाना लिरिक्स. तेरे हाथों की तरफ मेरे हाथों का सफर रोजाना रोजाना तेरी आंखों से कहे कुछ तो मेरी नजर रोजाना 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 मैं सोचू यही तरारारा तरारा लिरिक्स मुझे नहीं आती आगे मैं क्या कंटिन्यू करूं रोजाना. मुझे समझ में नहीं आ रहा, सच बता रहा हूँ. लिरिक्स प्रॉब्लम, सच बता रहा हूँ. Yeah.
Is there anything you would like to sing for our audience?
Yeah, for sure. There's
Okay.
One of my favorite songs. Yeah. म्यूजिक ज्यादा तो तेज नहीं आ रहा ना, मेरी आवाज क्लियर आ रही है? तेज है? Now it's started. Yeah.
Can you just look at the text I sent you?
Just a sec. Okay. Oh my god. अच्छा. Copyright issue. एक सेकेंड. दिल ये मेरा मुझे हरदम ये पूछता क्यों है मुझे तुझसे इतनी वफा क्यों तेरी हसरत है हर ख्वाहिश से बढ़कर मुझे क्यों नाम तेरा ही लेती जुबान. तारिणी मेरे पास सच बताऊं मेरे पास गिटार नहीं है, मैं गा नहीं पा रहा ऐसे क्योंकि मजा नहीं आ रहा. साफ सीधी बात है ना. That's the main reason. Non-copyright music.
Could you sing Gulabi Aankhein?
गुलाबी आंखें जो तेरी देखी शराबी ये दिल हो गया संभालो मुझको ओ मेरे यारों संभलना मुश्किल हो गया तन्ना दिल में मेरे ख्वाब तेरे तस्वीर जैसे हो दीवार पे तुझ पे फिदा मैं क्यों हुआ आता है गुस्सा मुझे प्यार पे मैं लुट गया मान के दिल का कहा मैं कहीं का ना रहा क्या करूं मैं दूरबा बुरा ये जादू तेरी आंखों का के मेरा कातिल हो गया. That's it.
Thank you so much, Shivam. That was a delight. Your voice is amazing.
Thank you, ma'am.
It's really good to have you here. And
Thank you.
with the last song, we'll end this session. So whatever is your favorite, please sing for us.
Can I sing on music? Like copyright issue? क्या बताऊँ यार मैं? You have to
Uh,
upload on YouTube, right?
yeah, so you can use it. You can connect it through your earphones and listen to it, but we shouldn't be hearing
No,
it.
ऐसे कोई issue नहीं है, but थोड़ा सा अच्छा लगता है. That's why.
Yeah, but sorry, we can't help it. We are so sorry for the inconvenience caused.
It's okay, no issue. Okay, I'm singing last song. কেন কাছে তুই এলি যদি আবার চলে যাবে বল কেন তাহলে স্বপ্ন দেখালি আমি জানি কোনো একদিন কোনো এক নতুন ভোরে দেখা হবে আমাদের আবার এক স্বপ্নের শহরে मुझे खोने के बाद एक दिन तुम मुझे याद करोगे फिर देखना मिले कि मुझसे तुम फरियाद करोगे नारा हे हो yeah, that's it.
Thank you so much, Shivam. It was amazing, really. I mean, I know we would have loved to hear you with the guitar also, and I know you also miss your
Yeah,
guitar right now, and you would have made it made it much better if you had it. But nevertheless, it was just amazing. Your voice is really melodious. We'd like to hear you again in the future. Thank you
thank you
so
so
much
much.
for being with us. And the tech team, I'd like you all to present a certificate to Shivam for his cooperation and for him to be here. This is your
Thank you so
certificate
much.
mailed to you, and thank you so much for being here. Have a great day.
Thank you so much.
I
Over
request
to the tech team.
to play the video.
In India, the rate of mental health practitioners is 0.3 for every 1 lakh people as per the World Health Organization.
There is a great gap that exists between the providers of health and people in need.
With this global pandemic, things have gotten worse, and it is predicted that after this, we will be having a mental health pandemic.
We are a growing population with complex issues but not enough resources for help.
Psychology is seen as an interesting blend of science and art. It is becoming a popular choice for many students.
However, there exists a taboo regarding mental health and the field of psychology. This prevents a large section of society in urban India from seeking help, while rural India suffers from lack of resources.
The mental health scenario in our nation is highly disorganized to pockets which are inaccessible to the most. The regulatory bodies are not structured either.
All these reasons have added a lot of instability and lack of guidance for students who want to come in the field as well as have a rewarding career.
There's a huge scope and demand in psychology despite what people might be telling you. So come join with us and explore the field of psychology as well as latest trends which you might have never heard before.
I'm super excited to talk about Encyclopedia event. It's one of its kind in the world. It is designed by the student for the student. There are eminent speakers coming from the various field of psychology to discuss, to answer all your kind of a question, whether you are a PhD student, you are a UG student or PG student or school students.
Hi, guys. It is my privilege to welcome our next speaker, Dr. Maya Libin. Dr. Maya Libin is an associate professor of psychology and director of psychopathology, lifespan, and neuropsychology laboratory at the University of British Columbia, Okanagan, Canada. She completed her PhD in clinical psychology at McGill University and a postdoctoral fellowship at Harvard Medical School. Dr. Libin teaches at both the undergraduate and graduate levels, and her research focuses on the use of cutting-edge methodological platforms to advance psychological treatment and rehabilitation protocols. Dr. Libin's research has been supported by grants from the Natural Sciences and Engineering Research Council of Canada, the Canadian Foundation for Innovation, and the Brain and Behavior Research Foundation. In addition to her research, Dr. Libin is a practicing clinical psychologist, providing psychotherapeutic and neuropsychological assessment services to members of the community. Dr. Maya really wanted to be here, but because of the time differences, she couldn't. She was kind enough to record as a session, and any questions that you may have will be noted and forwarded to her. Over to the tech team to play the video.
Hello, everyone, and thank you for having me here. My name is Dr. Maya Libin, and I'm a registered psychologist in British Columbia, Canada. And so, first of all, I wanted to extend my appreciation to the organizers for letting me pre-record this talk. The time difference made it a little bit difficult, so I do appreciate that, although I would have loved to see you all in person. But I hope you find this informative. Basically, today I'm just going to be talking about some of the steps towards becoming a psychologist. Now, because I'm in Canada, of course, most of what I'll be talking about today applies to North America and Canada specifically. But generally, these concepts do translate across different countries. And so I thought maybe today I would start a little bit with some background on myself. So like I said, I'm a registered psychologist, and basically what my job is right now is I'm a university professor. And so at the University of British Columbia, Okanagan, and I do that full time. And so there I am the director of the psychopathology, lifespan, and neuropsychology laboratory. So in my lab on campus, we study neuropsychological aspects of functioning. So that's things like stroke, traumatic brain injuries. We develop rehabilitation programs for these types of disorders. And I also study clinical aspects of functioning with a focus on cognitive function. And so what that means is we look at things like depression, anxiety, and eating disorders, and kind of look at the cognitive things that are associated with that. So things like attention, things like memory. And so I've been at UBCO for probably going on 9 years now. So it's been a while. I love my job there. And I kind of balance out that job with my own private practice. So I do private practice about a day to a day and a half a week. And it's a general practice. So I see all different kinds of people for therapy. So these are people with anxiety, with depression, with eating disorders. And I also have a primary focus in neuropsychology. And so there I do therapy with people with brain injuries. So these might be people who have suffered a concussion and have post-concussion syndrome, or other neuropsychological insults. And most of my practice is psychotherapy. I do some neuropsychological assessments as well. And so a neuropsychological assessment just looks at cognitive function, again, usually after something like a traumatic brain injury, like a stroke, things like that. Generally, the people that I see are people who have been in car accidents and are kind of trying to recover from the injuries sustained in the accident. And so that's kind of an overview, I think, of what I do. Of course, I also teach. at the university. And so I teach Introduction to Psychology, which I love. I get to reach out to, so many interesting students. My classes tend to be quite big. I think this year, because it was online, it was over 500 students. And at the graduate level, I teach intervention, so psychological interventions. And there we talk about things like cognitive behavior therapy, as well as acceptance and commitment therapy. And so that's some background on me. I'll also talk a little bit, I guess, about my training background. So I am Canadian, and I was born in Montreal, Canada. For those of you who haven't been, it's a very beautiful place. And I did my undergraduate degree in psychology, and that was at the University of Alberta. So that's kind of in the middle of Canada. Originally, I was going to go into medical school. Then I decided I didn't love biology and physics that much. Actually, no, I like biology. I just didn't like physics. Didn't like chemistry either. And so moved away from that, but wasn't really sure what to study. And so I took some, archaeology courses, which I really liked, but figured it would probably be hard to get a job in archaeology. And then found psychology is kind of this middle ground between the arts and the sciences. I just absolutely fell in love with it. It's so interesting. And as an aside, it makes it such a pleasure to teach it now because it is. I mean, psychology is just inherently interesting. So I did my undergraduate degree. That was about 4 years. And then I took a little time between my undergraduate degree and my graduate degree to get some research experience. And so I worked in a laboratory in Ontario, and that was just under a year, probably. At that time, I applied to different graduate schools, and I got accepted to McGill University, which is back in Montreal, where I'm from, which I was quite excited about. And there I studied clinical psychology. And if you do a full degree, you'll notice that some programs, they do a separate master's and a PhD. Some degrees, especially in clinical psychology, they'll kind of lump that together. So they'll put the master's and the PhD together, and then it's usually about a 6-year program. So in a clinical psychology PhD, you take a lot of courses on assessment, on therapy, on psychopathology. And then you also do rotations at different clinical locations. So I worked at all sorts of hospitals across Montreal under supervision. And this way you actually learn the theoretical aspects in the classroom, and then you actually get to go out and apply those while working with clients. So that was extremely rewarding. And then at the end of the PhD, and this is pretty much, I think, for all doctoral programs in clinical psychology, you do an internship, which is very, very much like a medical residency in medical school. So you apply to different locations, you get matched, and then you spend 1 year under supervision working full-time clinically. And so you get to accumulate quite a bit of clinical hours that way. And so finished my PhD. And then after that, some people go on to get registered as a psychologist to do private practice. I was a little interested in staying in academia, so I did a postdoctoral degree. And mine was more research focused. You can also do clinical postdoctoral degrees or fellowships. And it really depends on, the country in which you're practicing. It depends on the locations. I know in the US, doing clinical postdocs is much, much more common. It's less common in Canada. Here we do more research focused postdoctoral degrees. But I'm not quite sure what it's like in other countries. But I did mine at Harvard Medical School in Boston, which again, very lovely place if you get a chance to visit. And that was about, probably about 2.5 years, maybe 3 that I was there. And then at one point I decided probably time to, start making money, get a job. So I went onto the job market and applied to a couple of different locations and got an interview at the University of British Columbia. Came for the interview, loved it, and stayed. And so that's where I've been ever since. So I guess that gives you a little bit of the trajectory, at least here in North America, of clinical psychology. What you might have gathered in my description of that is that it is a lot of school. There is absolutely no question about it. So if you think about, other very sought after professions, like, I don't know, being a doctor, right, a lawyer, those actually tend to require less schooling than becoming a clinical psychologist. That's not true of if you're specializing as a medical doctor, right, then it's probably about the same. But if we add up all the school that I did after high school, it would be probably about 13 years. So quite a while. And that is something to consider for all sorts of different reasons, right? Financial reasons, interest reasons. And now, of course, that's not the only trajectory to become a psychologist or a clinical psychologist, but it's probably one of the more common ones. And so kind of recognizing that, there is a lot of school. And if you love it, that's okay, right? Okay, so that's the background on me. I wrote down a couple of notes here, so I remember things that I wanted to talk about. So maybe I'll move to kind of the field of psychology today and what that looks like, because psychology is actually a very broad topic. And so you can specialize in a lot of different things. As I was mentioning, I'm a clinical psychologist, and I also have specialties in neuropsychology, but there's all sorts of other topics that you can study. So I actually have a couple of slides here that I'm going to share with you. These are actually from my introduction to psychology class. And so I'll just do that really quickly. Okay. So what you see here is just kind of a breakdown of the subdisciplines of psychology, right? This is not completely exhaustive. There are other ones, but, it gives you a lot of them, as well as, how many people do different things. And so what you'll notice is within psychology, definitely the majority go into clinical psychology, okay? As a clinical psychologist, you might work in private practice, you might work at a hospital, you might work at a university like I do, okay? So most of them are kind of broad clinical psychology. And then if we look at this other half here, you can see that there's really a lot. So there's clinical neuropsychology, so I do this as well. And like I was mentioning previously, this is working much more with the brain, with cognitive function, and looking at different aspects of functional outcome. We've also got counseling. And so you might ask kind of what the difference is between clinical psychology and counseling. Here, it probably comes down to how high of a degree you have. So often if you're doing counseling, you have a master's. If you're termed a clinical psychologist, you have a PhD. And I'll talk about that a little bit more in a second here too. Health psychology, right, actually pertains usually a little bit more to physical illnesses. We've got school and educational psychology. So these are psychologists who often work with in schools and with children. Cognitive psychologists are often researchers, and they look at cognitive functions. So things like memory, things like attention, executive function are all different aspects of cognition. Developmental psychologists typically look at development over the lifespan. So they'll look at, sometimes exclusively children, but not always. They might look completely across the lifespan. They might focus on older adults, younger adults, but the key word there is development. Experimental psychologist is a broad term for anybody who does research, typically within a university organization. Industrial or organizational psychologists, this is it's a newer field, probably the newest of the ones listed there. It's exceptionally interesting. And so these are psychologists who tend to work in larger companies, and they might be working with HR, for example, in terms of hiring practices. They might provide leadership consultations, for higher individuals in the company, right, to help them lead more effectively. It really is quite broad, but, recently very lucrative, if financial considerations are something, as they are for most people, right? And it's getting more and more popular, absolutely. Neuroscience, physiological, biological, again, is a little bit more focused on the biology aspects of psychology, right? Social and personality. So that's more looking at interactions between people, right? As well as individual personalities. And then we just have other here. Okay, so it gives you a bit of an idea of the array. And as you can tell, there really is quite a bit. And so this next slide I have here just breaks down typically what psychologists do, right? So the big domains tend to be research, teaching, and clinical practice. And so for psychologists who only work in research, right, this could be related to industry, right? You can get hired as a psychology to just do research within industry or government. If you're a psychologist within a medical school, often your activities are limited to research. You're not doing much of the other two. Teaching, of course, you can be an instructor, a sessional, as a part-time teacher, right? Even, a motivational speaker, something like that. And clinical practice is, of course, private practice, working in hospitals, working as a counselor. Now, some of the interesting things are where these overlap. So within universities, a lot of our faculty are what are known as experimental psychology university professors. And so these are professors who aren't trained in clinical psychology, but rather are more trained on the research side. And they do both research, so having a lab, and will teach. Clinical consultants will often do research and have a clinical practice. Clinical counseling, sorry, that word is split there. So they may teach perhaps, part-time at a college and also have their own practice. And then of course, right in the middle here is you have clinical university professors. So that's quite similar to what I do. And these are people who have a clinical practice, who do research, and who also teach. Okay. So often people are very interested in what they can do with different degrees. Like I said, this is very specific to kind of Canada and North America. I'm not sure in other countries what types of credentials are necessary. But to give you a little bit of an example, with a bachelor's degree, so this is an undergraduate degree, these are the things that you might be able to consider, right? I wouldn't pay attention to social work there. I think these days that usually requires actually a master's degree. This is a little bit of an older figure, but you can see, case manager, copywriter, art therapist, things related to media, right? Public relations. If we go up to a master's degree, which in psychology is usually about 2 years. So these together, you were looking at about 6 years here. That's where you can start doing counseling. So you can't call yourself a psychologist, at least again in North America, but you can call yourself a counselor. And that can be pretty much any kind of counseling, right? So it might be marriage, it might be addictions, it might be rehab. And then finally, the doctoral degree gives you a whole host of other options here, right? This is when you get to put the doctor in front of your name and basically call yourself a psychologist. And so here is the list of what we saw in the previous slide. Okay. And now finally, employment by setting, just kind of where psychologists work. So you can see it's pretty evenly right over here. So majority work in private practice. And so this is where you're a business owner, you own your own business, or you work within a business. You see clients and you bill accordingly. Hospitals and clinics, colleges and universities. And here we have things like business and government and elementary schools and schools in general. Okay. So that gives you a little bit of an idea of kind of where the psychologists are and what they are doing. Okay. So we've talked about my background. We've talked about some of the steps in becoming a psychologist, right? So we've talked about the undergraduate degree, which is usually 4 years. Master's is usually 2 years. And the PhD is usually another 4 years. And then afterwards, you can think about whether or not you want to do a postdoc. And again, in terms of whether the postdoc helps you out or not, it's very dependent on what kind of job you want to apply to. But by no means necessary. Okay. So what does a typical day look like for a psychologist? I guess mine's a little different again, because I do a lot of different things, but I'll tell you about my private practice days. I go to my office and I usually see about 7 clients a day. That's quite a high caseload. And I think I'm able to do that probably because I'm not doing it every day of the week. I think if you're doing the or if you're seeing clients 5 days a week, 7 would be a pretty high number, because you do need to manage the risk of burnout as a psychologist. So I do see 7, but like I said, I only do it a day to a day and a half a week. And my clients, like I was saying before, kind of a broad spectrum, both male, female, every ethnicity that you can think of. And they come in with various types of problems, right? Some of them more severe, some of them, looking for just a change in lifestyle, right? Some added direction. And so usually on the first session, we'll do a bit of an assessment, see what their needs are, and hopefully work with them to help them accomplish what it is that they're looking for. In terms of payments, it really varies. And so in Canada, a lot of people do have benefits through their employment, but psychology is not covered under our public health care. So some people have a certain amount that they could use for psychologists. Other people pay out of pocket. If they're doing that, it is quite expensive. And so you kind of want to tailor your therapy accordingly. So if they're paying out of pocket and maybe don't have huge financial resources, giving them more to work on at home, right? And spacing the sessions out a little bit more. In terms of the university, my days are very, very variable there. I sit on lots of committees. Like I said, I teach, I do research. And so I could be doing all sorts of different things, which I love. It adds some variety in my days. And like I said, it's kind of offset by the clinical work in terms of one being able to inform the other. Excuse me. So yeah, so that's kind of what the day looks like. Overall, psychologists are usually rated with pretty high job satisfaction. It's much like other fields of healthcare. You never ask the question of whether you're helping people. You obviously are, and that definitely translates. A big problem, like I mentioned before, is burnout, especially if you're doing full-time private practice, and perhaps maybe you're specializing in something like trauma. That can be very, very difficult. And so it's extremely important for psychologists to manage burnout, to engage in self-care. It's something that we really highlight in our graduate training. For our new psychologists, is you really have to make sure to maintain that balance. Otherwise, you're not going to be able to help your clients. I always use the metaphor of, when you're on an airplane, they always say, if something happens, put on your own air mask before you put on someone else's. I feel like the same applies to psychology. You got to make sure that you're doing okay before you can really devote your life, right, and your time to helping other people. And that can take all sorts of forms, right? Many psychologists see a psychologist.
Hello everyone, just a minute. There is a technical issue and we are sorting it. Just stay tuned.
Till then, any questions that you might have, you can put it on the chat box and the Q&A section or on the comments. Those questions will be noted and we will forward it to Maya ma'am. And she will answer them, and accordingly, we'll forward it to you guys on the participants group.
Many psychologists see a psychologist just to kind of help balance things out. And, you know, it's balancing with family life, other jobs, things like that. Okay, so I guess the last thing that I'll talk about is, okay, so I've been talking and you're like, yep, that sounds amazing. I want to be a psychologist. What do I do? Well, first you do a bachelor's in psychology, and usually bachelor's programs in psychology are quite large. Like I said at the beginning, psychology is inherently interesting, so we tend to have a lot of undergraduate students. Getting into graduate school, at least in North America, is really quite competitive in psychology. And often more so than, again, other degrees like medical school or law school. And the reason for that is that the classes in graduate school tend to be extremely small. So while a medical school class might be, 50 students, the average class of clinical psychologists, at least at my university, is usually around 6. And so that does make it very competitive. And the reason why they're so small is because there is a big focus on research. And so you need a supervisor, and it's kind of this one-to-one matching. And so to make yourself competitive when you're applying to graduate school, research is very, very important. I always highlight that, showing a broad range of accomplishments, right? Engagement in clinical work, right? If you can volunteer, extracurricular activities, but by far the most important tends to be research. If you can get maybe a poster presentation at a conference or even a manuscript publication under your belt before you apply to graduate school, amazing, right? That really does make you stand out from everyone else. So that's something to consider. That being said, there is a new route to become a psychologist for those who are not interested in research. And so many people, right, they get their PhDs, which is very research heavy, and then they never do research again, right? They go into private practice. And so to kind of facilitate that route, we have now in North America what's called a PsyD. And so this is a shorter program as opposed to 6 years. It's usually about 4. And it's just course-based and clinical experience-based. So there's no research component. And so you might be thinking, wow, that sounds great, amazing. The only caveat is, that these are all private schools. So they are not publicly funded universities. And so they do tend to be quite expensive. So that is something to consider. And so again, it's called a PsyD. Canada doesn't have very many of them. I think maybe we have 3 or 4, but there's really a lot of them in the US. Less competitive to get into because they can allow larger class sizes, shorter amount of time. You do finish with a doctorate and you can call yourself a doctor. Again, the big difference it is that it's a paid program. And so it's through a private type of school. Okay, well, I can see I am running out of time here. So the last thing I'll just kind of mention is kind of I guess, where psychology is going in the future. We all know that many jobs are being automatized going forward. There's a scarcity of jobs. Psychology really is quite wonderful because people want to talk to other people, right? We're social animals. And so, a computer can't provide the kind of empathy that a psychologist probably can, hopefully. And so my belief is, and other people might believe different things, but my belief is that there will always be jobs for psychologists because, we're having a larger and larger focus on mental health, mental well-being. And that typically comes from talking to other humans, right? So on that note, I will end because I see my 30 minutes is now up. I hope this was informative. And if anybody does have any questions, I'm happy to answer any. I think the organizers have my contact information. And I hope you enjoy the rest of the conference. Thanks, everyone. Bye. Hello, everyone. And thank
So now that the questions, whatever you guys have asked, has been noted, and we'll forward it to her. Now we have a bit of a time here, so we thought of playing a game with you all. Ria, would you like to tell them?
Yes, so just like yesterday, we killed our time with some fun games, and as we told you, we will find you whoever wins, and we will be giving you a small token of gift. So in that way, today also we have something for y'all. So it's just a basic psychology quiz, but it's not that easy also, but I think y'all will have fun. So we are going to ask questions, Gloria and I are going to ask questions alternatively, and y'all can use the chat box in YouTube. The people who are viewing from YouTube can comment the answers, and we have moderators everywhere who will track who answers it first. And here we go. Gloria, you can start with the first question.
Yeah. So I'm going to start with a very simple one. I'm sure most of you guys would know this. So tell me, who is the father of psychology? Who do we consider the father of psychology? Okay, I can already see the answers very well. Okay, since you guys are typing, we'll keep the spellings in mind as well. So if there are any spelling errors, it won't be counted. All right. I see Sigmund Freud. I see Adam Smith. I see William Wooden. Okay, that's amazing. Let's see on YouTube. Right. Okay, I see William Wooden. I see Sigmund Freud, William Wooden. So people are confused between William Wooden and Sigmund Freud. Who is it, Ria? What do you think?
I think it has to be William Wundt because, Sigmund Freud was the starter of everything, but everything was carried ahead by him, and he has the biggest contribution according to me. Even though many people do not like Sigmund Freud, I am not one of them. I think he is the one who initiated everything. So we should respect that. Okay, so we find out the first person who wrote William Wundt and we'll save it.
The correct answer, by the way, is William Wooden and not Sigmund Freud. So kudos to everybody who answered it as William Wooden. You get 1 point for that. Let's see who gets the maximum one. Over to you, Ria.
The second question is, the Greek philosopher Dash, which Greek philosopher believed that knowledge is acquired through experience and learning. So if you are already a person who is familiar with psychology and its connection to Greek philosophies, you must know. I'm giving you options: Archimedes, Rousseau, Plato, or Aristotle. Think about it.
Mixed answers again.
Yes.
Okay.
Taking a great guess there. Okay, so there are a lot of people writing Aristotle. We will find the one who wrote it first, and that's going to be the winner because Aristotle is the correct answer. Okay, you can ask the next question.
All right. So this is a bit theoretical. Let's see. Darwin's theory of Dash argued that physiological characteristics evolve because they are useful to the organism. I'll repeat it again. Darwin's theory of Dash argued that physiological characteristics evolve because they are useful to the organism. I'll give you, okay, I see answers, some of them.
Evolution is very
Evolution, survival of the fittest, natural selection. Okay, okay.
So I think evolution and natural selection is both the correct terms.
Both of them are correct answers, yes.
That's Darwin's theory. So amazing job. We're going to the next question. It's a sort of a correlate question. So just think about it, listen to me carefully. Wundt was to structuralism as Dash was to functionalism. So get your schools of thought clear here and answer the question. Amazing, without options.
We have really smart people over here who really know their psychology.
Really, we need to learn something.
Okay, there's Watson, William James, Thorndike. Okay.
Amazing. So we will find the one who wrote William James first, and that is the correct answer. Okay, you can go ahead with the next question.
Right. Okay. So listen to this carefully. I'll give you options for this as well so that you guys are not confused. Dash is the belief that the mind is fundamentally different from the body. I'll repeat it again. Dash is the belief that the mind is fundamentally different from the body. Now, I don't need the person's name, but okay. I'll the term. So is it mindism, dualism, centralism, or specialism? I'll repeat the question again. Dash is the belief that the mind is fundamentally different from the body. Mindism, dualism, centralism, and specialism. Okay. Dualism is the majority here. Are you all sure this is the right answer?
Majority.
Very confident. Dualism. Okay. So dualism is the correct answer.
So the next question is Sigmund Freud championed Dash psychology. Simplest as ever. So yeah, amazing. Yes, psychodynamic. Psychodynamic is correct, and it was very.
This feels like KBC fastest fingers first.
Yes, really. I was going to say just hands on the keyboard.
Okay, so psychodynamic is the answer. You guys are right. All right. The next question. This is a really simple one. Freud emphasized the role of Dash in shaping people's personality. I'm not even giving the answer for this, like options for this. So yeah. Okay. Okay, I see. Mixed answers. There's unconscious, there's child experiences, subconscious mind. Okay, I'll repeat it again. Freud emphasized the role of dash in shaping people's personality. Right. So the answer is unconscious mind or unconscious desires. That too.
So the answer is unconscious. And the next question, as we are already so stuck up on Freud, we will take another Freudian question. According to Freud, the mind's three components are, again, a very simple. I think that was Isha. Yes, ego, super ego. Interesting answer.
Right. So that is the answer. ID, ego, and superego. Correct. All right. On to the next one. This is also pretty simple. Classical conditioning theory was proposed by whom?
We are letting them lose. So simple.
Rishika, you'll have to be careful with the what you type. I do realize that was the right answer, but the spelling wasn't. Right. So the answer is Ivan Pavlov.
Okay, so a factual question. I'm hoping that you all know it. You probably will. The word psychology was first used by who used it? We will wait
This
before.
is a little tough, yeah.
No Google, please do not Google.
What's the fun in that then?
Check spelling.
Can you repeat the question, Riya?
The word psychology was first used by someone has already answered.
So, Riya, what is the answer for this?
It's correct, like most of them have already written. Rudolf Jekyll, Geockle. I'm not sure how it is pronounced, but it's Jekyll, I guess.
Okay, on to the next one. So this is also very simple. Just a second, where did it go? All right. The term IQ, that is intelligent quotient, was introduced by whom? You guys are getting confused. I like this. Yeah. Okay, there are two answers that I can see, Alfred Binet and William Stone. Let's see who wins, William Stone or Alfred Binet. Okay, so the answer is actually William Stone and not Alfred Binet. It can be confusing, I do realize. Yeah, they're both associated with IQ, but William Stone was the first who termed IQ. All right. Riya, next.
The next one is again a bit tricky. Habits are acquired or inborn. Habits are acquired or inborn. It's not both. Yes, so most of them have correctly answered acquired, and it is acquired. Habits are always acquired from your environment.
Okay, on to the next ones. Are you guys good with years? Because I always struggled with remembering the years whenever I studied psychology. Let's see how good you guys are.
More than psychology history, man.
Yes, that too. So, when was American Psychology Association established? In which year was it established? APA.
You will have to Google again.
I see the tech team has also joined in. Okay, so the answer is actually 1892. So whoever answered as 1892, you guys are correct. If you're correct, give yourself a point.
The next question is the Barnum effect helps to explain people's beliefs in dash. The Barnum effect helps to explain people's beliefs in dash. Barnum effect. Anyone? I'll explain. I'll repeat. I'll tell you all the options. Fortune telling, astrology, horoscopes, or all of the above. Litish, you will have to come ahead and you will have to be responsible for this because this is your question.
Yeah. Am I audible?
Yes, yes, you are.
Yeah.
Yes.
The question is the Barnum effect helps to explain the people brief in a dash. This is a question. Option A, fortune telling. Option B, astrology. Option C, horoscopes. Option D, all the above.
So what is it, Litish? Even
Option
I'm
D,
curious now.
all of the above. All of the above.
Okay.
It's one of the MCQ in whenever I attended one of the exams, like NPTEL exams. It's a one type of MCQ related to psychology.
It's important to know, guys. So remember the Barnum effect.
Okay, on to the next question that I have for you guys. Watson and Skinner both contributed to which school of psychology? I'll repeat it again. Watson and Skinner both contributed to which school of psychology? Okay, I don't have to give you all the options also because you guys are already correct. Right, it is behaviorism.
Great. So, yes, behaviorism is correct. The next question goes, everyone. I hope you all have it.
Wait. Before that, how many did you all score up till now? We've asked quite a few. Okay,
Everyone
6.
For themselves. Everyone will think of their own scores.
Let's see. Who's the highest scorer up till now? Tell me your scores and be honest, please.
No one has kept a track. No one wants any rewards.
All right, Ria. The next question.
Yeah. So OCD, which is something where we are very interested in these days. So what is always found in the cases of OCD? So I'll give you options and you have to tell me what is always found in the cases of OCD, obsessive compulsive disorder. Hallucinations, B, excessive concern with cleanliness, C, phobias, D, irrational impulses. Listen again. Which, okay, I lost the question. Yes, okay. Which are the following which are associated with OCD? Hallucinations, excessive concern with cleanliness, irrational impulses, and I've lost the question again. Yes, and phobias. Type the question, not ABCD. That won't work.
You guys are being clever now. Just don't type A, B, and C. Give us the whole thing.
Meanwhile, Litish, can you check up on the speaker, the next speaker? Good one, very smart. All the people who said excessive concern with cleanliness, you all are not quite wrong. But that's not the only thing associated with OCD. So the answer is irrational impulse. Something that is more that you do more than you should is irrational impulses, and that is associated with OCD. So moving ahead, Gloria.
Yes. Listen to this carefully, all right? The scientific approach is more useful at answering questions about facts than questions about dash. So I'll give you the options. I'll repeat it again though. The scientific approach is more useful at answering questions about facts than questions about dash. Is it emotions, values, facts, or behavior? The options are emotions, facts, values, or behavior. Okay. All right, I see mixed answers over here. Some say emotion, some say behavior. Okay, this is the one question that you guys are most of y'all are getting it wrong. It's actually values. It's not behavior or emotions, it's values.
If you think about it, you will get to the point that it's values. So
okay, I'll just repeat it again for Arshi so that you get it clear. The scientific approach is more useful at answering questions about facts than questions about dash. So the answer was values. Yeah, go ahead, Riga.
So a neuroscience or neuropsychology question. Which part of the brain plays important role in maintaining the state of homeostasis? Perfect, correct answer. And we are going ahead with the last question now, because we are ready for the next speaker. So, yeah.
This is a very simple one. So, what is another term for reinforcement? Is it stimulus, response, reward, or condition? What is it? It's very simple.
Answers were here before you even finished your options.
I know, right? Okay, but still, there's quite a bit confusion here. Some say reward, some say condition, response, conditioning. Okay. Okay. So the answer is actually reward. And with that, we end our Q&A session, quiz session. I hope you guys enjoyed it, and we have kept a track of all your answers. Whoever has scored the maximum, we will be giving you a prize shortly, and we will get in touch with you as soon as possible. Thank you, guys. Over to the next MC.
Hello, everyone. Hope you're having a great Sunday and an informative one, too. It is with great privilege that I get to introduce our next speaker, Ms. Hiba Bilfahi. She is a storyteller, an entrepreneur, a psychologist, and a whole bunch of other cool things. She's the founder and CEO of the Startup Factory. She's experienced rock bottoms and sky highs in the business world. She's garnered so much knowledge about business and taking risks that the whole process made her want to help more people and startup businesses to find their own vibe and just live a life creating their dream business. A little side note for our dear speaker. You'll be hearing a short buzzer 5 minutes prior to the session's ending time and a long buzzer right at the end of the session. Thank you and welcome, Ms. Hiba. The stage is all yours.
Thank you, Elena, for that beautiful introduction. Good afternoon, everybody. What is up? What is down? What is all around? You know what? It's always a beautiful day to have a beautiful day. I always love it in events like this. People ask me to introduce myself or to tell them a little bit about my life. And I actually struggle with that the most. And the reason I do is because I cannot put everything that I am in a one-liner, right? I feel it's very limited. So I usually like by going and saying, I'm just a soul having a human experience. And these human experiences can be whatever, right? It could be my entrepreneurship journey. It could be my psychology journey. It could be just me as a TikToker. It could be any human experience that I've gone through. But as a soul, and I think that is the most important part of it all, as a soul, we are all the same. Me, you, everybody around us, this oneness of our soul, this beingness of our soul is the most important essence of us today. So when I received this invite, and by the way, I have 0 slides, I don't have anything prepared, I'm just gonna go on the whim. When I received this invite to come and speak, and I know that all of you are curious or ready to understand a little bit more about the psychology world and trying to find your footing, I said, okay, if I was 18 to 21 years old again. It's been a long time, okay? It's been a while since I was 18, but if I was 18 to 21 years old, what would I actually want to give myself advice? And that's what I based this on. So I go by the saying, or what I'm called in the industry these days is called the mind hacker. What that means is I can access your subconscious mind and hack it. It's a cool name for psychologist. I don't like to be called a psychologist. I call myself a mind hacker because I hack the system. I like to break the system. I like to go outside the rules a little bit. So I said, okay, how can I give these budding psychologists some advice as if I needed that advice when I was 18 to 21, when I was making the decision. So I came up with a few of these advices that I would give myself, and I'm going to share with them with you today to help you make better decisions in your life. My first and most important advice that I would give myself is that I am limitless. You are limitless. You are all now in the phase of trying to make this decision. Should I be a spiritual psychologist? Should I be a neuroscientist? Should I learn CBT? Should I do this? What field of psychology do I need to be in? Should I become an organizational psychologist? And you feel like making this question and answering this question is the most important thing you need to do. But in truth, it's not. Because the reason why you're having these questions, or the reason why you want to understand which way you want to go, is because you were told that you need to be one thing. And that is insane. Why is it insane? Because we are multifaceted beings. All of you are multi-talented, omni-talented. Your presence and what you have within you from talent is invincible. And to just limit it to one thing is sad for us as humanity. So think of it this way. You've been told to stay in this box. You wake up in the morning, you're in a box. You get into a car to go to school, you're in a box. You get out of the box, you go into school, it's a box. You're learning through a box. You finish that box, you go back home in a box. And you watch TV in a box. And maybe you have a meal in a box, and then you put it in a microwave, which is a box. And the whole day you've been put in a box. And it makes you believe you have to stay in the box in order for you to survive. And that is not the truth. When you start getting out of the box and seeing that you are circles and stars and diamonds, that is actually how you start to find your talent. That's how you start to believe that you are limitless. You are not limited, but you are limitless. So if I would go back to my 18-year-old self, I'll be like, do not worry about ticking the box and picking one thing that you must do, because you are limitless. You can do it all. And I do that right now. I'm an entrepreneur. I run businesses that are in the startup world and technology and marketing. I'm also a psychologist and a spiritual psychologist. I also lead meditations. I am a TikToker, and I make some stuff on TikTok. I do poetry and all this kind of stuff, because we all have it within us. And I looked into the psychology of this, because obviously that's my true nature. I'm a psychologist. I wanted to understand why we're conditioned to be in a box. And I saw that actually this started after the World War II, when people started to become more productive and efficient in factories. So they would give each person one thing to do in the factory line in order to produce more. And after that, it went on to life. So people started to be specialized in one single thing in order for them to be specialized in life. And that is actually one of the major issues that we have today, is our soul. Remember I said we're a soul having our human experience? That soul wants to be more than just a doctor or a psychologist. It just wants to be more. It wants to have the human experience. So if I would give you the first rule, is to have the human experience, which is you are limitless. You can be everything. This idea of you have one life purpose is not the truth. You have multiple life purposes. It is not a life purpose, it's a life purposes. And what you need to do is find that life purpose. And how do you find your life purpose? Everybody asks me this question. Hiba, how does somebody find their life purpose? Your life purpose is like a jacket. You know, when you go to the store, when you try the first shirt on, you're not like, okay, that's it. I'm just gonna try the shirt and keep it and it's mine forever. You try it on, you feel it. Do I like it? Do I not like it? And I take it off. And that's life purposes. So when you're about to explore things, don't think just because you made the decision to enter one field or do anything, you decide to say, okay, that's it. No, try multiple things all the time. Try it on, go into that path, see if you like it. If you like it, cool. If you don't, take off the jacket. The idea that you have to be one thing is outdated. And I hope the new generation knows that they are multifaceted and that they can do whatever they really want to do. Just so funny story. When I was your age, I didn't really know what I wanted to do. I was good at multiple things. I was an athlete. I was very smart academically, but I came from a very conservative upbringing where, you either were a doctor or an accountant or an engineer, right? And I was pushed to study accounting, and I actually did my bachelor's degree in accounting. And it never was what I wanted. And there was a little voice within me.
Hello?
Yes. There was a little voice within me that said, you know what, Hiba, you are not an accountant. But I followed that voice. And today, when I run my businesses, I need that accounting background. So it did benefit me, but it wasn't who I was. So I'm going to give you one question to really help you figure out who you are. If I gave you $100 million right now, $100 million right now, each of you opens your bank account, you got $100 million over there. And you've done everything you wanted to do. You traveled, you paid your parents' mortgage, you paid the charities, you bought the yachts, the cars, the home, you did everything, and you still have $100 million in your bank account. What are you going to do then? What is it that you're going to do then? And that's how you know one of your life purposes. And believe me, if you answer that question, you will have an insight of what your heart calls for and not what your survival mind calls for. Once you know what your heart, where your heart wants you to go, the path becomes easier. So that's the first life hack I would give you, that you are limitless and you are able to achieve whatever it is that you want to go through just by understanding that your purposes are limitless. Okay, just that, and give it some thought. Top of mind, you could be like, I have absolutely no clue. Give it some thought. This is not a question you have to answer. This is a question you ponder on. And you really go, okay, I did the charities, I did what society told me to do, I traveled, I did all this conditioning that I was supposed to do. Now what? What am I going to do? For me, I realized that after I did all this, my joy was helping people, irrespective. That's why when somebody comes and asks me, would you speak to some students? I'm like, for sure, because my life purpose is actually to help people. How I help people can be anything. I help them through my businesses, my therapy, whatever it is, that's the vehicle to get to your goal. It's always changing. I can have multiple vehicles that serves me to serve other people. So that's my first life hack, I would say. You are limitless. You can be anything you want. It's unlimited ability. So and then I was like, okay, what else can I tell my 18 to 21-year-old self that would have changed her? Have fun. And if you meet me today, fun is one of my major, most important virtues in life. And that's something I lacked throughout my 10 years from the age of 20 to 30. I really lacked having fun. I was so goal-oriented that I forgot to enjoy the moment. So if I would go back to that 18, 21-year-old self, I would say to her, enjoy the moment and have fun. It's not about the goal. You will hit the goal, but if you reach the goal and you are still feeling unfulfilled, or that there's a next goal that you have to go to, you are going to be super miserable in life. And I know, because I went there. At 25, I was the head of HR for a huge multinational company. In society's terms, I was super successful. I was earning a whole lot of money, and I was the top of where I could be at 25, the youngest leader that there was available at that time. And even at that achievement, tick on the box, I had it, but I felt miserable inside. I didn't feel like I was home or I was connected. And it's because I was working so hard to get to the goal. I was only focused on the goal that I forgot to enjoy the journey and have fun during the journey. And I can't now go back and change the last 10 years of my life and be like, okay, it's gone. But what I can do is live every moment today having fun, and that's what I do. So it's no longer about taking the goal, it's about having fun during the journey. And when you're having fun and enjoying the journey, you can actually get to the goal way easier. So that's the kind of advice I wanted to tell that 18 to 21-year-old, because she was working super hard, super focused. There's something, when we're kids, very joyous and we're all children and smiling and fun, and something happens, they call it growing up. And somebody said something like, when you grow up, you have to be serious, because all these grown-ups are serious. And it's a belief structure that we have, that as we grow older, we have to be serious. But who said? As we grow older, we can still have fun, we can still be joy, we can still enjoy our time. It doesn't mean because you grow older, fun goes out the door and only serious happens. So if you would really take this advice and see how you can create fun in your life, enjoyment, and I don't mean partying, clubbing, blah, blah, blah. I mean actually enjoying what you do, creating the friendships, creating that atmosphere that helps you build and nourish yourself in it. It's a feeling more than a thing to do. It's this fun feeling that you're enjoying everything you do. Life hack. If you're not enjoying it, that's a sign from the universe that you shouldn't be doing it. As simple as that. I don't believe on, knocking on the door that's not opening. I believe in the path of least resistance. If it's for you, then the path will be very clear and easy. If it's not for you, there's going to be a million obstacles on the way. Now, I like to believe that the universe has everything planned for me. The creator of all that has everything planned for me in ease. in ease. So when something is not going my way, I'm like, then this door is not for me. I'm gonna leave this door closed and I'm gonna look if there's another door for me. So that's the second one. Life hack number 2, have fun. Life hack number 3 is be authentically yourself. We live in a society where from the minute you are born, everybody is telling you exactly who you have to be. Who are you? Where are you from? Where are you going? You know, everybody's planning every part of life with you. You should like this, you shouldn't like this, this is right, this is wrong. And we're like this onion that is covered up with all these layers of others people's opinions or beliefs that we should be. And we start to lose ourselves. So if anybody here is feeling lost or like they don't know where they're going, that's because other people have been telling you who you should be. And the only way you can be authentically yourself is to start to peel this onion and really figure out who you are. I'll tell you a funny story. When I started psychology and being a therapist, a lot of people said to me, yo, Hiba, no one's gonna come see you. And I said, why? They said, you don't look like a psychologist. And I said, go ahead, tell me, how does a psychologist look like? They're like, well, she wears a suit, she has a full head of hair. She doesn't have pink hair. She doesn't have tattoos, and she wears glasses, and she's pretty serious. So people are not going to come to you because people will not take you seriously. I said, cool, that's your opinion. I am here to serve, and I can only serve people by being authentically myself. I cannot change who I am to fit in that box. Remember the box we talked about? I am not a box. I'm a star, I'm a diamond, I am not a square. Right? And that belief in myself that I am limitless, I said, no matter what happens, I'm going to still be me. I'm going to speak. I usually tell my clients, I'm half Namaste, half Tupac, you know, it's whatever you get with me. And that's my style. And when I started, people started coming and they're going, I know what, she's different. Go to that therapist, she's different. And today I have a whole school where I teach people mind hacking. And it's only took me 2 years to build, because of this, about being authentically myself. And when you're authentically yourself, and guess what? You're not gonna figure out who you are easily. It's not like one day you're gonna wake up and you're like, oh, hallelujah, like this is who I am. It's a journey. And as every part I was unlearning all this conditioning, all these belief structures, all these rules that people put on me and the culture and the society put on me, I started to understand who I am. But I did this beautiful exercise that I want to share with you today. And this exercise is called describing your future self. So I want you all to just visualize or think of the 3 people who you believe are your role models. The 3 people who you believe have things that you aspire to become. And write down their virtues. For me, it was Tony Robbins. I don't know if all of you know Tony Robbins. He is a big guru in the USA. And Tony Robbins, for me, he was my guru. And I was like, damn, I want to be like Tony Robbins. What do I like about Tony Robbins? I like that he's honest and authentic. And I like that he's like tough love, but he's also like a cuddly teddy bear. I also like that he's fun. And I also like that he's very passionate. And I wrote passion, fun, authentic. And I put it on a vision board. And every day I woke up, I said, today I'm going to be passionate, love, and authentic. And I put that on my vision board every single day, because you become what you say you'll become. You all know, you're in the beginning of being psychologist, your words are the most important things that you say. So every day I woke up and I said, I am fun, I am passionate, I am authentic. And slowly, as time progressed, people started to give me that feedback. I love hanging out with you. You are fun. I love hanging out with you. You're so authentic. I love how way you speak. You're so passionate. And I understood. I became the version of myself I aspired to do. So think of your guru, your role model, whoever you aspire to be. Think of the qualities they have in their life. Write down those qualities, because they're in you somewhere. They are in you, just hidden right now underneath the layers of conditioning. They are in you, they are there. So all you have to do is a little bit of unwrapping, and that just comes out. So number 3, life hack number 3, be authentically yourself. Let's just repeat them so we all kind of understand. The first one was to be the first one was that you're limitless, your purpose is limitless. The second one was to authentically be yourself. I think I added one, but I forgot it now. All right. Next one, next life hack that you would say, for me, is your posture and how you walk into a room. That for me is one of the most important things. If you walk into the room, your physiology, we're going to call it physiology. Your physiology actually affects everything in life. And we're going to do a quick experiment. I want all of you, I can't see all of you, but I'm a spiritual psychologist. That means I can tap into your energy, right? So I want you all to smile. And I want you to think of a negative thought while you were smiling. I'm going to wait for you. All of you smile. Come on, big smile. Okay. And now I want you to think of a negative thought, like, I don't know, a puppy dying, something. And I want you to try to do that. It is impossible to think of a negative thought while you are smiling. Your brain is not wired that way. So your psychology is so important because your mindset controls everything. It is not possible at all. It is psychologically impossible to think of a negative thought while your physiology is smiling. So this is why I say it's important. Your physiology is important. I'll give you another tip. When I tell you somebody's depressed, their body language is very like low, shoulders down. But if I tell you, show me somebody who's confident, all of you are going to sit up straight. Somebody's depressed, you're going to go back down. If they're happy, their body. So if I already know, just by moving my shoulders backward and putting a smile in my face, my psychology changes, my mindset changes, then I know how to influence every situation I get into. When I walk into an interview, all I got to do is put my shoulders back and put a smile on my face. Every time I'm doing a speech, my shoulders are back and I'm smiling at you. My psychology is switched on to win. There is no losing in this game. My psychology is switched on to win. And that's how you do it, with two simple tricks. Your physiology, the way you enter the room, the way you start to talk is all affected by your posture and your physiology of a smile. You put the posture up and you smile, your speech improves by 80%. And that's psychology, that's facts. You can go Google that. Your body posture. If I will go back to that 18-year-old self, I would tell her, girl, when you walk in a room, head high, smile, shoulders back, because automatically your psychology turns positive and people can receive your messages a lot better. So physiology. And the last one, the last tip I'm going to share with you guys is healing. I have hit rock bottom, and I always speak about rock bottom because I feel it's more relatable than success. I've been down there and I've been up there, and I know both. And my major learning in life was when I hit rock bottom. I was clinically depressed. I was miserable in my life. At some point, I was like a broken robot. I did the day-to-day just like a broken robot, a sad broken robot, actually. And during that time, my father passed away, was diagnosed with cancer. I lost the 1.5 million of all my life savings by somebody stealing it from me. I got diagnosed with diabetes from all the stress. So much happened to me. I was really rock bottom. And I understood that the only way I was going to get myself out of my depression was that I had to heal myself. So I know all of you are in this world where you actually want to be of service. Before you are of service to anybody, please heal yourself. We can only give the world as much as we are able to give ourselves. I'm big on self-love. I'm big on self-healing because I understand that when Hiba is a complete, full human being, she can serve as a full, complete human being. But if I am Hiba and I am leaking, I'm a hole that has buckets, and the bucket is just leaking my energy, leaking with all of this, then I know that I cannot serve people because I'm leaking. How could I? So the first and the last most important thing is to heal yourself. And as you heal yourself, people will heal just by you healing. I don't know if you guys know this. This is a little bit of spiritual psychology that I'll go into, that our skin carries about 600 years of DNA, 600 years of DNA. So I don't just have my belief structures in my body. I have my ancestors' belief structures from 600 years ago. So this is why some things don't actually change. And to do that, to heal my ancestors and to heal my bloodline, it's even bigger. It's your legacy. I need to heal. I need to unlearn all these belief structures. I need to react differently. A lot of people see me today and they're like, oh, you're pretty chill. As a teenager, I was a troubled child. I had anger management issues. I was kicked out of every class. I was getting into fights all the time. And when I got into my career, I just focused on education, and I was super focused on just, hitting the goals. And then I achieved the goals, and I was still miserable because I wasn't healed inside. And when I started to heal inside, that's how I began to understand life, and I became to see the soul instead of the human experiences. And I would like that would be my fourth and fifth advice. So just to wrap up, I know I got like 5-10 minutes left. Just to wrap up, I want to open up the questions, because I really always love interacting with people, and we'll ask you guys to put your questions in the chat box if you've got any. Yeah. I already see somebody. Okay. So for me, life is really so simple. We all get opportunities all the time to make decisions, to actually understand what is important to us, but we're always in a rush to make these decisions. And life is not about rushing. We are human beings, not human doings. And what people understand today is that we are human doings, and we're not human doings. We're human beings, which means we have to be in the moment. We have to understand, we have to check in with our bodies, scan ourselves. How do we react to things? So if somebody tells you some news and you feel bad and you want to say no, but you say yes, that's when you're not connected to yourself. You say yes, but you should have said no. And that's part of our beingness. And I think as psychologists, you all need to master the human being part instead of the human doing. We're conditioned to be human doings, but we are human beings. And this body you're in is a supercomputer. You don't even know what it's able to do. It's able to do magic. So look into your body, see what your body will tell you. And a lot about spiritual psychology actually tells you to take care of your body. But if I knew those 5 things when I was 18 to 21, to have fun, that I am limitless, to be authentically myself, to heal myself, if I knew all that, I'd be where I'm at today then. But it's all a journey. It is not a race. It is not a race. So if I end it with one line, is life for you is not a race. It's not a sprint. It's a very slow marathon. So just enjoy the process. Thank you. And I'm going to now leave it open for Q&A, and we'll go from there. So I already see some questions with Q&A. I'm going to answer live. If I have access, I can just do it myself.
Thank you so much, ma'am. First of all, I'd like to tell you the vibe that you've brought into this meeting. Like, you can even check the comments and the chat. It's all, everyone is just super impressed, and everyone is talking about how nicely you quoted what you just said. So really, I cannot just even imagine how the vibe would be in a room to be with you. So first of all, I'd like to start with a question that someone has asked: how to maintain a personal and work-life balance?
Well, I think this is a very simple question for me. Work-life balance. I think this is another collective belief. I don't think it's true, right? For me, I work a lot, but my work is play. I feel like my work is play. So I don't actually feel like I need a balance. But let me tell you something, what balance in people's mind is. Balance in people's mind is 50-50. That's not true. Balance is whatever you understand balance to be. If balance for you feels 80% play, 20% work, that's your balance. If balance for you is 80% work, 20% play, that's your balance. If balance for you means your work and your personal life are integrated, that's balance for you. We need to stop subscribing to what others give us definitions of and make our own definitions. I'm a rebel. I like to think things on my own. If you tell me from A to B, that's how you get there, I'll find you a C and a D, because I like to be a free thinker. And I think this is one of the best virtues we were born with. We are born free thinkers, and then society makes us think a certain way. So if you just go back to your essence and go, what does it mean for me? And you make your own rule, that's it. Life is easy.
That's so correct. Like you also mentioned about authenticity, and being authentic is so important. So, how do you suggest one should develop that authenticity or find that one special thing that is self to themselves? Like they are the one who own it. That is their own quality. How do you suggest one should find out that?
You know, we all have unique fingerprints, right? And for some reason, then everybody just from this herd mentality wants to become like everybody else. So the best way is to always look at your fingerprint and be like, okay, I am unique. And to remind yourself, I am unique. And your uniqueness doesn't have to be something extraordinary, right? It does not have to be something, it has to be something that you value about yourself. Is you value about yourself. Again, we look for, I'll tell you a quick thing about self-love. We're born full of love. We're born on a vibration of love. The creator birthed us with love. And then we start to learn that love comes from outside. When mom says this, I get love. When dad says this, I get love. So your programming becomes as people on the outside have to give me validation in order for me to get love. And when you hack that and you know that's complete BS, your life changes. When you start filling yourself up with love and going, my birthright is love, I am a vibration of love, and you no longer need external validation to validate everything that you do and say, you are whole and you will find your authenticity. So cut the cords.
That's perfect. So the next question is on the same lines, but how do you suggest a person who fears change but wants to improve and be free go about the process?
If you fear change, let's talk about fear. We're born with fear. It's just our innate nature of survival. What is fear? False evidence appearing real. Let me repeat that. Fear is false evidence appearing real. So it's false. We already know it's false and it appears real. So the best way to get rid of something that is a fear is do it. You know, do the thing that scares you the most, because you will quickly realize it's not scary. It is not scary at all, because it's a false reality. It's a false evidence. It's not true, actually. Most of our fears are created in this beautiful chihuahua, drunk monkey, subconscious mind. They're all created there. They're not real. You know, how many of you have sit there and worried and worried and worried and worried and worried and worried and created this beautiful movie plot that could win an award, and then nothing actually happens? It's false evidence appearing real. So just do it.
That's perfect. So the next thing is dealing with setbacks. You know, when we are on a journey, we are trying to do something in life. Sometimes we fail. Sometimes there is a big pause that comes up in our journey. And then we feel like we cannot complete this path. We cannot just reach that destination. So how is that period that we cannot do anything? We just become so stable and we cannot just do anything in life. How do you suggest we should spend that time, or how can we deal with that, just when we are so stuck at one position?
I'm going to tell you something. There's a difference between stuck and a setback. So we're gonna talk about both, okay? What is a setback? For me, if we look at life, I look at life like a bow and arrow. We need to sometimes go backwards and go backwards hard in order for us to fly forward. You know, when you have a bow and arrow and you pull it back and you let it go, and then you scale. So sometimes your setback is the step before your success. It's just that launch. But a lot of people quit at that step and they never reach the success because they quit at that step. If they just waited a little bit longer, held on a little bit, that leap would have happened. So for me, a setback is just an inch away of your success. You just got to hold on a little bit longer. One thing you all have to remember, that you've survived 100% of your worst days. You've done it already. So you're already a survivor. Any setback, any setback that happens for you is actually just part of your learning experience. I don't look at failure. I have failed multiple of times, right? I have done the craziest shit because I'm a risk taker. So my failures are big. And the way I look at them, I don't look at them as failures. I look at them as learning experiences, because I learned from each one of them. If you were a child and you started walking and you fell, do your parents tell you, That's it. You failed. Don't try to stand up and walk again. You just have to sit there and that's it. Give up on life. Because no. When the child falls, you tell the child, get back up. That's what you got to do. So in your life, you just got to get back up and tell yourself that was a learning experience. Good job. Let's go on.
That's like the perfect answer. So as you mentioned, we should always keep trying new things, exploring new things. That's when we actually come to know what we actually love. So in that case, some people believe that, being jack of all and master of none is not really something that always helps. So how do you suggest that, how can you completely contradict that point and say that, trying things is always going to help you find and explore your own interests?
Yeah, I'm that's my dog. Come on, be cool. I'm really against this, and I always challenge it, right? How are you going to know that you're good at that one thing? What if there was another thing and you were better at it? How would you know? If I, for example, today, if I just sat there and said, I'm just good at accounting, look at what we all be missing. I'm good at accounting. You cannot find out what you like without trying things. If you imagine it as food, right? You go and every time you're only having that chicken breast. Every time you're going and you're having the chicken breast and you're like, well, chicken breast, delicious. But all you have is the chicken breast. Don't try the steak. You don't know what the steak is. You don't know if you're going to like steak, so don't try the steak. The argument means absolutely nothing. My brain does not understand that. If I wanted the steak, I need to try the steak. And then I need to make my own decision that I like the steak or not. I can try the seafood or not. But if I'm only eating one dish, none of us are surviving. We're not human beings cut out to do that.
Okay, great. So there is this next question coming from Marin Verghese. Is there any connection between being an empath, I think she means empathy, and spiritual psychology?
Empath. You're talking about an empath and a spiritual psychologist. An empath is just, the way I like to call it, is social media's way of saying that a person cares too much, right? But it's also a personality trait. Spiritual psychology, and let me just explain spiritual psychology because I also saw questions about that. When you study clinical psychology, which I have also studied, you study really about the brain, CBT, behaviors, healing methodologies. It is very mind-driven. That it's a very, American, West mindset. And then there's the East, Chinese medicine, energies. India, for example, has the chakras and all of that. That's called the energy body. So when I study the energy body and I also study the science and I put science and energy together, they overlap beautifully. There's some things that get fixed with energy, when you go to acupuncture and when you go to Reiki healers, and there's some that require science like CBD, neuro-linguistic programming, whatever. Whenever you bring both together, there's this beautiful marriage. And that's why I love them both. I've done both and I like them both together. So that's what spiritual psychology is. A little bit of that, a little bit of this. You put it together, beautiful.
Perfect. So there is this question coming from YouTube. Sometimes the path that we enjoy is full of hurdles. In that case, should we give up because the universe isn't giving it easy to us, or should we keep trying?
Well, are you 100% sure you enjoy it? If you're 100% sure you enjoy it, I would look at your belief structures. The way I look at the brain is like a computer. It has millions and millions and millions of codes of programming, right? Like belief structures, codes. I call them codes, okay? You probably have a code in there that says, I need to work hard in order for me to get the goal. If you're able to reprogram that code, that belief structure, that you are worthy of receiving stuff with ease, you don't have to work hard with them. And the way I would look at it, I would ask myself this question. If I received it with ease, what's the worst thing about that? What's the worst thing about that? And then you will come up with all these beliefs. Fix that, and your path will be clear if you're sure that's your path.
Okay. So Abhishtha asks this question: how do we convert our abilities and interests into our growing opportunities?
Oh, easy. Right now, you guys are super lucky. You got like social media, you got freelance work, you got all social media is amazing. Like most of my business goes organically on Instagram and TikTok easily. Just I don't do any ads. It's all word of mouth and it's social media. If you have a skill set, the way I started with one of my stuff is I do it for free for a month and I see people's feedback on it. I improve it. And then I do it again, now for half the price, just to see how people react to that. And I adjust. So you do something and you learn from it, you do something else, and then you launch hard on social media. You have to walk, breathe the brand. When you meet me today out of here, you'll see the same person. I'm saying the same thing. I'm consistent. It's my life. It's me. Stay consistent. Know your messaging, know who you're approaching, and do it like on social media. Social media is the only platform right now. I don't believe in old school stuff. I think if you're not online, you don't have an opportunity. I get 100% of my business from online.
That's actually true. Like if we in this generation cannot make the best use of social media, we are definitely lacking somewhere.
100%. Social media is the key. I mean, I get so much opportunities from different places, but from social media is the main key. It's easy.
Perfect place to make yourself into a brand. So the next question that goes is how to identify your biggest fear, which you are not aware of, but it still hinders you. How to overcome a fear you aren't consciously aware, but still exists.
Okay, I can tell you a hack. Most people are afraid of two things: being alone and fearing that people think they're not good enough. Fix those two. Start there. Most people, I have like right now, I've been doing this for 3 years approximately. I've done more than 1,200 sessions with different clients. And I'm telling you, the common denominator between all of them is I'm afraid to be alone and I'm afraid I'm not good enough. You fix these two beliefs. These are our two major fears. You fix these two beliefs, you will just skyrocket to the ceiling. Fix those two beliefs. We all have them. No one in this group doesn't have them. You have them. I'm afraid to be alone. I'm not good enough.
That's great. So the next question goes, as you spoke about vision boards and all, like the things that you make and believe in keeping yourself going, I could tell that you are a law of attraction believer. There are a lot of people here who aren't aware of law of attraction. So how would you explain the law of attraction to someone who doesn't know anything about it?
I love the law of attraction. I'm also a big believer in the whole idea of manifesting, and I'll talk a little bit about that. But the law of attraction is pretty much you speak into existence what you want. We're all, by the way, all of us are master manifestors. What does manifestation mean? Maybe this is a new word for you. Manifesting means bringing something into reality or making something happen, manifesting, making something happen. Okay, that's what it means. We are all born with this skill set, this magic of being manifestors. We can create anything we want. I'll give you an example. You're like, oh my God, I don't want to be late. You're late. Oh my God, I'm not going to have parking. You don't have parking. Oh my God, I'm going to get a ticket. You get a ticket, right? You manifested all that. You thought the thought, you created the thought, and you attracted it. The law of attraction, you attracted it to you. Have you ever thought about somebody and then a day later they call you or they text you? You sent out the thought, the law of attraction brought you. So imagine that everything you think is pushed out into the universe, and then you are going to receive what you think. So if you think crap thoughts, you're going to push it out to the universe, you're only going to get crap back in your life. If you push beautiful thoughts into the universe, you're going to get beautiful thoughts back. So that is the law of attraction and manifestation. You can actually just switch it and stop and start thinking, okay, well, I want to attract these personality traits. I want to attract a great parking space. I have never not found a parking space because every time I leave, everyone's like, oh, we're not going to find a parking space. I'm like, I don't know about you, but I have parking fairies. I'm going to find a parking right by the door. Boom. Always find a parking by the door. Try it with something small and fun. We can do a quick exercise. What you can actually do is think of something like a purple Lamborghini with like zebra stripes, something very random like that, and be like, universe, I want to see a purple Lamborghini with zebra stripes, and leave it. And in a day or two, you'll see it. Experiment, play, what you gotta lose?
But I am also a believer of law of attraction, and it really works if you actually believe in it.
100%, it works.
So the next question is, you mentioned about self-love, and you also said that you personally have had to go through a whole process to become a person who loves themselves first. So what is that process, or how do you recommend that people should start, at least have that initial thing in themselves to start loving themselves?
I think the first thing is awareness that you don't actually love yourself. A lot of us think we love ourselves, and that's not the truth, right? And I think the first one is just honesty that, you know what, I don't love myself enough, or I don't love myself at all. If you're constantly beating yourself up in your mind and talking crap to yourself all the single time, that actually means you don't really love yourself. If you're working yourself to the bone until you burn out, that actually does not. If you're a people pleaser and you're saying yes to people when you should be saying no, you actually don't love yourself. So I think the first part is just to be honest with yourself and go like, you know what? I never learned how to love yourself. I was always taught, you're always taught from a very young age how you should love other people. This is how you should love mom. This is how you should love dad. This is how you should teach her respect. This is it. No one ever shows you how you should love yourself. And if you dare to do something for yourself, you're called selfish. So we're already conditioned from a very young age that that's a no-no. So we grow up as adults or young adults that absolutely have no clue how to love ourselves. The first that I would say is just acknowledge that you don't love yourself. Second is to start drawing. It's like your end goal. What does self-love look for you? Because self-love looks different for me than it looks for you. What does self-love mean for you? Does it mean that you have to go and say no to people, set boundaries with people? Does it mean that you have to rest more? What does it mean for you? For me, self-love means loving the parts of you that you can't even stand.
That's like a perfect answer. I mean, self-love is so important because you are always going to get criticism out there. It's always going to be there, and how you deal with it is always inside you. That's what at least I believe in. So the next question is in the chat box. Someone asks, what can be done when you find yourself not being able to achieve your goals every time you try? Should we give up and try something else?
Can you repeat that question, sorry?
Okay, sure. So someone is asking, what can be done when you find yourself not being able to achieve your goals every time you try? Should we give up and try something else?
So I would always like to understand what is causing me to quit. So how we do one thing is how we do everything. I'm a big believer in that. So you obviously have a pattern. There's a pattern there that needs to be identified. So what I would look first before saying quit on it would be, okay, so what is your pattern of behavior? What is the block that is happening that is causing you to feel frustrated? If you're able to understand the block and learn from it, try one more time. If you still hit that block again, change. It's not yours then.
Perfect. So as we just talked about loving ourselves, there is also something that we need to do is heal ourselves. Everyone comes from a story, everyone has their history that goes on with them. And also you mentioned that you've had your share of depression and anger issues in your childhood and your teenage. So how do you suggest one should start healing themselves from within first, and then if required, consider some help?
Yeah. I mean, healing is so integral. And I mean, it doesn't have to be therapy. By the way, all of you are self-healers, right? We're all born with the innate beingness that we can heal ourselves. So that's something you all have to know, that you can heal yourself. And the first part I would do is consume knowledge. The way I got out of my depression was actually reading a lot of different modalities about how do I fix my brain. Now, I wanted to fix it in the beginning, because it was broken in my perspective. So One of it is get the knowledge, get different opinions. I love getting different perspectives. I don't believe in following one school of thought. That's for me is imprinted. I like to get different food of thought, schools of thought, different people, different perspectives. And when I understand the different perspectives, I see which one resonates with me, which one works with me. Because we're all different human beings. We all need to have multiple tools in all that will work with us. So what I would suggest if somebody's trying to look into healing is go dabble in different modalities. Understand which one resonates with you. Do the work there, inner work, shadow work, understanding the parts of you that are traumatized, understanding the parts of you that, you don't even want. We all have a psychopath within us. We have to heal that psychopath within us. The one you keep in the corner and keep them quiet and they only come out when there's a big occasion, and they need to F things up. That psychopath needs healing, needs love. So once we understand that there's parts of us that need healing, it's usually our inner child as well. So try different modalities. I'll give you some. I love modalities like theta healing. I love people like Joe Dispenza. I like to do inner shadow work. That's one of my favorite things to do. Mind hacking is one of the modalities I follow. So that's one of the most beautiful things that you can just go and explore and go with it. You're not a DIY project. You don't need to fix yourself, but you can heal without fixing yourself. So go as it with I'm doing this to love myself. I'm healing to love myself instead of I must fix myself because I'm broken. More of, what? I deserve, my birthright is to heal. My birthright is to be the best version of myself. So I'm going to go and spoil myself with some healing.
So there is this question Anandita asks about when we are too hard on ourselves. Like sometimes we go through a lot of this process of growing and doing a lot of things at once and we become hard on ourselves. So what is that one thing that makes us do that first of all, and how should we avoid doing that?
The reason why you're hard on yourself is because people have been hard on you. The only way you got attention, the mind, the child from 0 to 7, everything it learns is from society, culture, the people close to you, your caregivers. So for them to give you something, you had to work hard for it, or, you kind of saw their interaction with one another. For you to get to be it had to be hard work, or you needed to push, or there was that, a little bit of pressure. And I think this is a very Middle Eastern and Eastern kind of mindset that you need to push your kids to do things. And that's the reason why when they stop pushing you, you turn into the self-punisher. It's actually a form of self-punishment. So you become your own punisher because that person maybe is no longer in the image, or maybe they're punishing you less because you grew up. So you become the person that pushes yourself hard, but that is all from that belief structure of you are not good enough. So if you start to believe that you are good enough and start to heal that part of you that feels good enough, you'll stop pushing yourself hard and start to go with flow, which is a lot easier and a lot more fun.
So there is a question in the question answers box. Do you think self-questioning would resolve most of our problems?
Self-questioning?
Yes, self-questioning.
I think it's not self-questioning, but self-awareness. Questioning just sounds like a very negative word for me. We have to trust ourselves. But if we come and we start being aware of how we behave and kind of like, it's being in the balcony of your life, looking at it from this perspective, and also being in the day-to-day action. When you're in both simultaneously, you have a sense of awareness what you're doing. So imagine you're in the middle of a fight, then you just step a little bit up there as an awareness point of view and be like, why am I behaving this way? Why is the chihuahua out here? And then you come back and the chihuahua's there and you're in attack mode, but you come back up as like, oh, interesting, this triggers me. By the way, this is something I teach. What triggers you is within you. If something outside of you is triggering you, it's a projection, it's a psychological projection, it's actually you. So find it in yourself. If somebody's annoying you, it's you. Something about them is they're a mirror of you. Life is just a mirror of what you're creating in your mind. So if somebody's being mean to you, look at yourself. Where are you being mean to yourself? If somebody is being judgmental towards you, look at you. Where are you being judgmental towards the world? Everything that triggers us is within us. And once we understand the psychological aspect of projection, that everything that is outside is within, then life can change quickly because you fix it in here and life becomes better out there. You fix it in here and life becomes better out there. Everything is a projection.
That's just amazing. I'm amazed, to be honest. So the next question is from Diksha Bhosle. Can you tell something about releasing blocked emotions?
Whew, so many ways to release locked emotions. I love releasing locked emotions. So one of my businesses is actually called the Smash Room, where you go and break things to release energy. So you release your stress, your trauma. I think it's taboo to say therapy is the only way to do something. Different people are different and they need to release energies in different way. But yeah, one of my businesses does that. But my favorite way to release blocked energy, other than shadow work, and I'm going to keep talking about shadow work, but other than shadow work and looking at the darkest parts of ourselves and understanding how it operates, is dance. Dance is one of the easiest way to physiologically move. Remember when I said one of the things I would tell my 18-year-old self is physiology? The release, the movement. You can never ever, have you ever had a very good gym session and came out depressed? Never. It cannot, because endorphin, serotonin, all these different hormones are being ejected out of your body. So dance is actually a beautiful way to release blocked emotions.
Yes, that's perfect. And if I may, also as dance, any other hobby that actually, enhances you and just deviates you from your work for some time is always good to do. So anything, like people love to paint, and dancing is something at least I relate to. It just makes us feel so good after. You just really feel.
I would say movement, actually, just not dance, movement, because I like to dance. So I'll say movement.
Yes, it's perfect. So as you had mentioned one in our first questions about fear, and you said it's false and it's created. Why does every person born ends up creating his or her fears, and how do we control it? Like we creating our fears.
When you're born, you're not creating your fears. When you're born, society tells you what your fears are. Your parents tell you what your fears are. You cross the road and your mom goes, "Ah, don't cross the road." Somebody else's fear was just projected onto you. You didn't come up with all these fears, and then you start to go, "Oh, I'm scared." I'll tell you something. Like for me, I always was scared of water, and I didn't understand why I was scared of water. And turned out both my parents are scared of water. Funny enough, I healed myself. I go into the water all the time right now. My mom and dad still struggle to go into the water. So most of our fears are not our fears. When you tell your mom, "Oh, I want to be a XYZ, I want to be a millionaire when I grow up," and you're like 5 years old, they're like, "No, you shouldn't be a millionaire. The rich people are blah, 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 blah." And they give you the belief structure. So then you have a fear about being rich. Most people fear success and not failure, because you've all failed, but not all of you have succeeded. Most of you fear success, not failure. It's actually called achievemophobia. It's one of the top 10 fears out there. Achievemophobia. Under fear of heights and fear of spiders is achievemophobia, not fear of failure.
That's like a reality check on all of us. So yeah, in that way, one more issue most of the teenagers face is anger, and as you also mentioned that you have also faced this issue. So a few ways that help you overcome it, or your suggestions to the teenagers, because you're mostly our crowd is teenagers and the peoples in their 20s and 30s.
Yeah, I'll tell you something about anger, and anger is when my first psychiatrist told me what anger was, I laughed. They said to me, anger is just a cover up for hurt. And I'm going to leave that there because it's so profound. And when she said it to me as a growing adult, I was just like, oh, because I was like, I'm angry at them, and I'm angry at my mom, and I'm angry. And she said to me, well, you're not angry, you're hurt. I'm like, no, I'm not me hurt. I'm not hurt. I'm angry. And she said, well, anger is like the mask for hurt. And what you have to understand, the reason why you're angry is because you feel like somebody hurt you. And that's okay. And I know it's so difficult, and especially, in the culture, right? I really use the Middle East and Asia as a culture, because they have very same parenting styles. You feel like your parents could have done a better job. And it's so hard to go back to them and say, oh, I wish you did a better job, because they're not going to take it right. No parent's going to take that right. But that's where your energy is actually wrong, is to understand actually they went through the exact same thing. So they don't know any better. And once you understand that your parents did the best that they could with what they knew, the best that they could with what they knew. So they have their own programming, their own culture beliefs, their own, and they probably think they're super open-minded with you. And the way they raised you is like, woohoo, day and night. But healing, what happened to you is happened to you. It happened. Your healing is your responsibility now. You can't blame it on them anymore. This generation is going to break this cycle. This generation is going to change a lot of these old beliefs. I see it today with my clients who have kids. The way they parent is profoundly different. I work with a lot of parents to just break the cycle. So it's your responsibility to break the cycle. Stop the blame. Hate, the anger comes from the feeling of hurt. Acknowledge your hurt, heal your hurt, and then you break the cycle.
Like our parents have always been following a pattern, but once we have understood it, it is up to us.
Yeah. Now it's your fault. If it don't change, it's your fault.
Exactly. Yes. So the last question that I'll have for you is regression therapy a part of spiritual psychology, and what does it exactly entail?
You guys are getting in the good. Regression therapy is past lives. And this is up to your own belief structures. Well, as Hiba believes that as a soul, we've lived multiple lives. And I think a lot of the Hindu culture, the Buddha culture, this is not a new idea. But for the West, this is a new idea. So yes, it is part of spiritual psychology. And what we learn to do is regress into past life to understand what virtues did we not master in past life, and we bring them to this past. If there's any karmatic energy, we go look into the karmatic energies, close them, bring forward the lessons. So yes, it is part of spiritual psychology. And for me, it's one of my favorite things to play with is to go and do some regression therapy. It's so much fun. And it's always spot on as well.
I would personally like to try it. And I'll just request you to just leave this platform by addressing to all these attendees who are present here, as they are also, first aspiring psychologists and psychiatrists. We as in the future, once we become psychologists, are going to deal with people who have a lot of negativity in them. So when we have so many people to interact with and they telling us our issues, how should we take care of ourselves as psychologists?
So first of all, I would divide it into three parts. The first part I would say is people are not against you. They're just for themselves. Okay? People are not against you. They're for themselves. So whenever they're trying to do something with you or give you advice or tell you not to do something, they're really just looking out for their own insecurity and safety. So just allow them to be. All right? Second of things, you are in control of your life. So if somebody's in your paradigm, you are responsible for that. We're not victims in the story. And I think that's a major role you need to play in your life. You are the lead, the hero of your story for you. You're not a hero to save anybody else. You're a hero for you in your story. So leave the victim role, park it aside. It doesn't serve you, and be the hero in your life. All right? 3, you attract who you are. So if you are attracting negative people, look inside you. There's a part of you that is very negative that needs to be healed. If you decide to show up every day, full energy, dedicated, confidence, and you walk in the room with that full belief that I am walking in, and I'll tell you something, a quick side note, my legacy, what I said my legacy was, I said that every time I walk out of the room, people say, damn, she changed our energy. That's my legacy in life. I don't want to leave anything behind except that when I walk out of a room, people goes, I feel a shift. I feel a change. So be that for yourself, and you will see how the world all changes to something positive. That's it.
I would not doubt that. As I told you at the start of our question answer session, like I cannot even imagine the vibe that you must bring to a room. So really nice talking to you, ma'am. So
my pleasure. Good luck, everybody. And yeah, good luck in what you're going to achieve and do, and enjoy the rest of the day.
Yes, I'd like to pass it on to Elena, who will thank you. And here you go, Elena.
Thank you, Miss, for the wonderful and inspiring session. And I'm pretty sure everyone agrees that you literally hacked our minds with your words and experience. And I feel like I've been shifted into a positivity shrine. So, as a token of gratitude, we'd like to present to you an e-certificate.
Woohoo!
Thank you, tech team, and thank you, Miss. Now
Yep.
I'd like to call upon the next MC to carry forward this event.
Okay, so a very good evening to everyone. Hope you all are enjoying the last few hours that we have left in our career summit. So it's my privilege to invite our next speaker for the evening, Miss Urmika Sahai. So Miss Urmika Sahai is a counseling psychologist and a family therapist who has been practicing for the last 5 years. Her interest lies in family therapy and relationships. She enjoys her work and feels that every day is equally exciting and challenging for her. So let us all welcome Ms. Urmika to take over the platform and to enlighten us with some new knowledge. Just a disclaimer before we start, ma'am. We will be hearing a short buzzer prior to 5 minutes of the session ending time and a long buzzer exactly at the end of the session time. So thank you. The platform is all yours.
Hi everybody, I hope you're all doing well and having a great time with all your sessions happening. So, I'm a counseling psychologist. I have been practicing for a very long time. Also, I have been practicing online way before I even graduated because I always felt that, going to a counselor at a very young age, it's not easy because, how our families are, how our parents are, will they be acceptable, will they not let us go? So, if we have a platform online, it is much easier. So I myself have been gone through anxiety issues from a very long time. I think I was 11 when I had my first anxiety attack. So by the time I reached college, I was very much, that okay, I need a counselor, I need to go, I need to see somebody, but it was not very easy at that time. So I decided myself that, I'm going to start doing online counseling and at least help people who are looking out for help. So yeah, so that's about it. And I was going to talk about anxiety today, how anxiety has become a very high, fancy, fashionable word, and it's a very trending thing on social media and otherwise. It's like, there was a phase when we get sad and all, and our friends used to be like, oh, too depressed, kyun ho rahi hai? Why are you so depressed? The same way anxiety has taken over, and nowadays for everything everybody is just anxious. Oh, this isn't happening, I'm so anxious. Oh, that's not happening, I'm so anxious. You're watching something and the climax comes up and you're like, oh, I'm so anxious, I'm so anxious, I'm so anxious. And we need to understand that there's a difference between anxiety and there's a difference between anxiety disorder. What happens is that the person who has anxiety disorder will always feel people looking at us, people who just have anxiety issues, that what is happening? Why am I so different? Why am I not able to get over? Why am I facing very difficulty in coping up? Because they are dealing with a disorder, whereas we or other people, we just have a physic anxiety, which is very situation oriented. It's yeah, okay, I will do it. Maybe at the end of it, I will let you know. So when we have a phasic anxiety, that is situation oriented, right? So like, for example, you have a viva, you have an online viva, you might feel anxious, but that doesn't mean you have an anxiety disorder. And what is happening on social media is, whether it's your influencers that you see or you see your friends talking about anxiety very casually, which is wrong, which is absolutely wrong, because your anxiety is for a very brief amount of time. You're not dealing with it as a person with disorder is dealing with it, and it can put the person with disorder really down. It can really pull their self-esteem. It can really pull their self-worth. It can pull their confidence down, because as an anxiety person, as an anxiety issue, or as an anxiety disorder, or as an any other disorder, when we see, we tend to compare that why my life like this, why am I not able to do anything, why is it so difficult for me? Because I am seeing that, okay, this person also has anxiety and I also have anxiety, but why is she, how is she able to do everything, how is she able to cope up, why am I not able to cope up? And that's when you realize that, maybe I'm not trying, maybe I have an issue, maybe I'm not good enough as how the other person is. And that's when things start falling down. So when we see all our, your content creators, your social media influencers talking about their anxiety, what happens is that since they have such a big reach, they are able to reach out to a lot of people. And what happens is that when you are facing anxiety, you're able to resemble to them, that yeah, oh, they also have anxiety, I also have anxiety, okay, if maybe it's not a bad thing, I can talk about it, I can do. But what happens is when they start giving out tips, that is when things go haywire, because everybody has different anxiety. It could be relationship, it could be social, it could be emotional, it could be career, it could be financial. Everybody has different anxiety and everybody is dealing differently. Not necessarily what I'm going to ask you to do for your anxiety, I'm going to ask another person as well. It's it doesn't work out that way, because anxiety stems from something else, which cannot be common between individuals. It's not possible. So every person who's dealing with anxiety will have a different way of coping up. But when we see on social media the hype there is, that do this, don't let it bother you, just ignore, be yourself, it doesn't work like that. That is a very generic tip. That is a very generic and temporary solution. Like, if I'm feeling anxious at the moment, what I should be doing, but that's not the way how it's dealt with. So when it comes to anxiety disorder, we need to understand that there are a lot of other disorders connected to it, because everything is connected. With anxiety disorder, you can lead to depression, you can lead to schizophrenia, you can lead to so many other mental disorders that, that's very hard to imagine. So when we talk about anxiety so casually, we need to be very we need to be cautious. We cannot use the term anxiety or feeling anxious that casually, because you are not only making it difficult for the other person, but you're making it difficult for yourself. Why? Because the more you say that I'm feeling anxious, I'm feeling anxious, I'm feeling anxious, your mind will get conditioned. And even if you are not feeling anxious, you are going to feel anxious, which is also known as when, like you are working and suddenly you feel a trigger, or suddenly you just start feeling anxious out of nowhere. Out of nowhere. And that happens because we have trained our mind like that. We have trained our mind that I'm anxious, I'm anxious, I'm anxious. So even if you're not anxious, your mind is going to say that you're anxious, your mind is going to make you feel that you're anxious. And that's not great. Why? Because eventually it will lead to a disorder, it will lead to an anxiety disorder. Your mind will not be strong enough to control your thoughts, your mind will not be strong enough to compartmentalize your thoughts, which is a negative thought, which is a positive thought, which is an illusional thought, which is a real, which is what is fact. Nothing. It will all get mixed up. So next time when you are feeling, you're feeling nervous, you're feeling scared, do not term it as anxiety even for yourself. Because the more and more you make it feel, it will become. It's a very, it seems like it's not possible, but it is, because right now how the situation is, how things are unfolding, it is a very overwhelming situation right now. So to feel anxious is very easy, it's very delicate, it's a very delicate situation. So the more and more you condition yourself towards it there are chances that you will end up having it. Why? Because everywhere you go, you are reading about anxiety. Everywhere you talk to your friends, they are feeling anxious. And if you train yourself, you will also feel anxious. That is a fact. So that is all that I wanted to talk about, why anxiety is becoming an hype on social media. So is there any, let's open to an interactive session.
Yes, ma'am. We'll read out a few questions from the audience.
Yeah.
So, as we see, there are a lot of influencers on social media claiming to preach about anxiety and depression and all of those things. But people from non-psychology background might not be aware of it, the malpractices that they are actually doing. So, how can one be aware of the people they follow on Instagram? What should they look for when, you know, if there's a person claiming that they are a therapist or a counselor? How do you verify that?
So your influencers are content creators. They are not counselors, they are not psychologists, they are not psychiatrists, they are just content creators. So for beginning, I think this verifies in itself that a content creator cannot be a psycho. I mean, they could have a degree, that's a different thing. But you know, when they are, if they are in content creation, naturally they are not practicing, they are doing their own bit. So even if you had psychology in your graduation, that doesn't make you a verified or a certified counselor or a therapist. So it's very important to understand that basic difference between a content creator or a celebrity or your influencers and a professional. I mean, that is it.
Right. So when someone says that, you know, they are feeling anxious, and as a friend or as a colleague, you might not know how to help the person
Yeah.
and know how exactly it feels to be in that position. So if you could give us some tips as to how we can guide them when they might have, you know, a slight anxiety, and at times there are people who do get panic attacks because of it as well. But those situations, obviously, we are not, we do not know how to, you know, help them out there.
Yeah.
But yeah, what can we possibly do in such situations?
So what happens is when you have anxiety, what is anxiety for starters? So you have so many symptoms coming up. Okay, you know, you have sweaty palms, you're feeling nervous, you're feeling there's palpitation, there's breathlessness, right? And all of that leads to anxiety. Acha, this is anxiety. So when a person is feeling anxious, more than your mental thoughts, it's the physiological symptoms that is bothering the person. Panic attack is actually a physiological symptom that has come up, right? So in that case, first and foremost, you are supposed to calm the physiological symptoms first. And for that, important is breathing. What happens is when you start palpitation, when you start palpitating, you become breathless, right? So it's important to calm your breath. It's very important. And for that, maybe what you can do is just hold the person's hand, reassure them that it's okay, you are in a safe place, calm them down, ask them to count from 1 to 10 slowly, and have that control in your breath. The moment your breathlessness is under control, a lot of other things that were happening will also calm down simultaneously. So that is the most important thing. If you see, you don't start talking about that issue, you know, if you're aware of it, don't do that. Important is to calm your body, calm your physiological symptoms, calm your breath, calm your heartbeat that is racing. That is the most important thing. And then try to talk. And if the person is not ready to talk, let it be. Let it be. It's not, you don't need to, as a caregiver or as a friend or as a colleague, you are not in that position to talk. Why? Because you're not trained. So you don't know what you will end up triggering or what you will end up saying that might, trigger the other person. So it's okay, but yes, calming your symptoms, which are physical symptoms, is most important.
Right. So, there's one question from the audience. How do you exactly understand if you have an anxiety disorder or just normal anxiety? How can the victim differentiate between the two? Like, are there any symptoms of anxiety disorder which are different from your regular anxiety?
Yeah. So what happens is anxiety, like I said, is your phasing. It's situation based. If I have a viva, if I have an exam, I'll be anxious like normal people. But people who have anxiety disorder, it is not phasing for them. It's with them. They are dealing with it every day. So if you're not dealing with your anxious thoughts, your nervousness every day, first of all, that is a very big difference, that you have normal anxiety and you do not have a anxiety disorder, right? So now another symptom is that if you have an anxiety disorder, it will go on for weeks, it can go on for months, it can go on for years. You might have, maybe just counseling is not helping, or you might have to go to a psychiatrist, take some medicines along with your counseling sessions. So, and when you are just feeling anxious, it is maybe for a few hours or maybe a day, but you are able to control your thoughts. Third symptom is actually the thoughts, that in anxiety and panic, what is the major issue is that you are unable to control your thoughts and unable to control your physical body. Why? Because your thoughts are so, you are overthinking so much that you're unable to put an end to a thought, you're unable to put an end to that topic or to whatever you're thinking. So you're overthinking. And what happens is, when you're overthinking, you're assuming the worst that can happen. And then when you start imagining the worst, you start feeling the worst. When you start feeling the worst, you start getting scared. That's when the palpitation begins. That's when you become breathless, because you are so ahead in your future, and you've planned it all. Ki yehi hoga, I will die, this will happen, I'll have a breakup, and he'll leave me, and she will leave me, and oh my god, my life is... Nothing has happened, but you've reached to the conclusion. And that's when your body starts panicking, because you have created a panic situation in your body. So that is one thing. Then another symptom is that for when you have a disorder, you will always have a very intense emotional reaction to a situation. You will not be able to react like a balanced person. Like, if I don't have a disorder, you say something to me, I will react in a normal way. But because I have a disorder and I cannot process that well, I will become very emotional. I will give you a very overwhelming response, an uncalled response, only because I am anxious, and I am imagining the worst. In my head, I'm imagining the worst. So my reaction cannot be to the situation. My reaction is based on my future that I have decided. That is what is going to happen. So these are the few differences that one can make. And important is that anxiety, very very simple one, is that anxiety is situation based, disorder stems from somewhere, and it's with you, it's going to be with you until and unless you go to a psychologist or a psychiatrist, or you go to a professional and treat yourself with it.
Right. So, Evita David asks, today many of us are well aware about mental health issues, but how can we notice and make our parents understand if they are suffering from something like anxiety?
Okay, so how we counselors, what we do is that, when we have our client and we have parents like that, so before starting the session, we try to psychoeducate. It's a very common thing. I'm sure a lot of people who are studying are aware of this term psychoeducation. So what is psychoeducation? I am educating the parent about whatever issue the child has or whatever issue they have. It's important, right? So in the same way, if your parents, first of all, there are a lot of different kind of parents. There are orthodox parents, there are progressive parents. So if your parents are open for learning, if they are open for this change, it's very easy to talk to them. You can very well tell them that, I think that you may have this. I think, I'm not sure, maybe let's go to a professional, let's go and do. But if you have orthodox parents, then of course there is a long way, but it's important to educate them about this topic. It's important. It's not, tell them that it's not just in the mind. It doesn't work like that. You have to start with that. And if you feel that they have something, then you do a research. For example, you may feel that my mother has anxiety issues and she needs, it needs to be addressed because it is hampering her daily life and it is hampering our family life. Okay. So for that, you do the research, find out, and then you go and tell her that, this is what anxiety is, this is what happens, and I feel that, a lot of your anger issues or symptoms do match. So I really feel that, we need to go see a professional so that you can get help. Obviously, why would you want your parents to have something and not be treated? If you're physically sick, our parents take us to the doctor, so why not? So that is how it's important to psychoeducate yourself and then your parent with whatever issue they have. If you feel that they need help, then of course you should help them.
All right. So there's another question. On social media, people try to be cathartic and explain or portray their emotions openly. Do you think it is an appropriate way to display our emotions out there, even though it depends on choice?
Okay, so what happens is, especially in India, we are not taught to express. Okay, so we are not taught. We don't know how to express. If somebody compliments us, we all get awkward, like, okay, yeah, okay. We don't know. So what happens is that, if you're going through an emotional turmoil, which can, to a stranger, it can come out in any way. So when people on social media go around expressing, that could also be because they do not have any channel to do it at home. That could be through hate, through trolls, through their opinions, through their viewpoints. It's just that they've got a platform of talking, of putting their points, of putting, whatever they feel. There's no filter, there's nobody watching, like your mother is not there to tell you, listen, why did you, why are you talking like this, why are you doing that? So it's very easy. And anyway, talking to a stranger is much easier because there's no judgment, there's no bias. So, even if you're trolling, you even if I troll you, I don't know you, you don't know me, so I don't care what you're going to think about me. And even if you do, we are not friends, we are not related. It doesn't matter. I wanted to say something. I went, I typed, I pressed enter, and I'm back. So that is what is happening, and that is, so it's not about the choice. They're just doing it because there is a platform to do so, and it doesn't matter to them. It really doesn't matter to them.
So Madhuri asked that how are you supposed to control your thoughts? Because we often hear that overthinking leads to anxiety. And is that the case? And if yes, is there a way to manage our thoughts and not ponder on something continuously?
There is. It is very hard, but there is, and it is to stop thinking about it. So when we say that, you need to stop thinking about it. Okay, so let's take an example of that. I have a boyfriend and he hasn't texted me back. What am I going to do for next half an hour, 1 hour? He's not texting, he's not texting. I'm watching my phone, he's not texting, he's not texting. All my focus, energy, attention, everything that I have inside me is focused on my phone and on one thought, he hasn't texted. after 15 minutes, it will be like, yesterday he was talking to someone, uska call waiting पे था, he's cheating on me. Now I've gone to this another level, because all my energy is there. I don't have anything else to think about. From cheating to, okay, maybe that he is, maybe he's going to dump me, maybe he doesn't care, he doesn't love me anymore. What am I doing? I am stressing over one thing, just one thing. In that half an hour, I could have exercised. In that half an hour, I could have done my work. In that half an hour, I would have just watched one web series, one episode. But no, so when we say that you need to stop thinking, is that you need to choose that. You need to divert your mind. You need to do something where you are not pondering over that topic. You are not pondering over that thought that what is happening, why isn't he texting, why isn't he calling, what will happen. So all of these things are important. It is difficult, of course, because at the end of the day, they are your thoughts, they are coming from your head and they are going to your head. But if you are distracted well enough, you can achieve this. You can. So you need to train yourself. The moment you feel that you're zoning out, like I tell my clients to wear a rubber band, the one that comes with the newspaper that hurts.
Yeah.
So I always tell them that, whenever you find yourself zoning out, I'm sitting here, I'm talking to you, I'm doing this session, but in my head, I'm like, yeah, my boyfriend hasn't texted me. I don't know what is happening. Because although I am busy, but I am in that thought. So I ask them to pull that rubber band. It will hurt, yes, but you will be out of that zone. So you're conditioning your mind. Okay, I'm going back again. I'm overthinking. I'm not supposed to do that. Let me just come back and focus my energy on this session rather than thinking, oh, where's my boyfriend? Why isn't he texting? Must be flirting with someone else. That technique really helps. So you can also try that technique.
All right. I hope that answers your question, Madhuri. Next is, do you think social media analysis of this generation can reveal underlying anxiety and other related mental health themes?
Can social media help in finding out?
Yeah, social media analysis of this generation.
Okay. I don't think so, because at the end of the day, we need to understand that mental health, mental disorders, everything is equally important like physical health is. So, if you're going through something, if you're feeling that, I'm zoning out, like I said, or I am feeling too many emotions, or I'm feeling anxious, or whatever you're feeling. It is social media can only help you or support you in a way, or give you a push that go talk to a professional, because you're not alone. That's all social media is doing. So like when influencers talk about anxiety, they have so many followers. So I'm sure few of them might be having something or the other issue. So when they talk about anxiety, it makes them feel better that, yeah, okay, I'm not alone. When they say that, I went to a therapist, it's like, oh, if she can go, then I can also go. But at the end of the day, you have to go see a professional, and you can't you can't rely on social media analysis for anything. Yes, it is a good push. It is like a group therapy kind of a thing, that okay, we are not alone into this, there are a lot of people like us. But not, I don't think so it can really help.
All right. So, because of this pandemic, there's a lot of uncertainty and fear among the people, and as well as the students as well. So, an attendee is asking how to make our everyday life and mental health better, because I personally feel that every day is the same as a student.
It's very simple. Make a routine. Just make a routine, and not like a timetable routine, but a routine that, I'm going to get up, I'm going to do this, I'm going to attend my classes, after this I'm going to do any whatever your extracurricular, if you have, you join something. I'm going to give time to TV, I'm going to give time to music, whatever. But if you have a pattern, if you have a routine, the uncertainty will go. Because right now we don't know what to do when we are up. We're like, oh, it's the same day, ghar par hi hai, now we have to do this, attend meetings, do household work. But if you organize that, if you make a routine out of it, you already know that, okay, there's no uncertainty because I know next tomorrow when I get up, I have to do this. This is my plan. I have already organized it, right? So even for a student, even though it of course it is boring, but if you have something planned, if you have a routine, you can just plan something with your friends, meet up online. But if you have a plan, if you have a routine, your uncertainty will go, your anxiety will go.
Mm-hmm. Okay. So another question is, body dysmorphia is a big issue these days. A portrayal of a certain image or body type being the only one acceptable according to social media has gotten into the minds of today's generation. Do you think the fear of not being able to uh, m- fit in that picture makes them anxious, makes people anxious?
Of course, yes, totally. Especially, Instagram has become a lot like the styling, fashion, and for all of that, when these influencers come, they have this perfect body because they have to. Obviously, they're presenting themselves, they're brand in themselves, they are all blue ticked, already celebrities in their head, so they can't. They have to be fit.
Mm-hmm.
And when people, when we all consume that content, now I'm watching this influencer wearing a bikini top and a very nice shorts and good hair. I'm like, dude, I don't have a body like that. I don't know how will I look in a bikini, how will I do this, so it does somewhere hits me that I'm not good looking enough, or maybe to achieve this particular look I need to look like that. So that is going to give me anxiety because I'll be like, dude, I'm not attractive. What will happen? I'll never have a boyfriend, or I'll never have a girlfriend. And or maybe whatever clothes I'm going to wear, I'm not going to look good. I'm not going to look nice. I'm not going to look pretty like her, because they are putting tons of makeup. They are getting their hair done before coming onto the camera. They have good lighting. They have so many filters on them, and when they come, that is what we see. They have such good Photoshop, so we don't know what is happening behind the scene. But what we see, we are consuming, and when we are consuming, we are getting anxious that I don't look like that. I will not, my body will not be acceptable. Girls stop eating, they go on weird random diets, following someone on YouTube. They'll be like, okay, I have to, they have a blue tick, so I'm sure they have good knowledge. But that's not how it works, because everybody is different, every body is different. There are few people who have such great metabolism, they can eat and eat and eat and nothing will happen. So it's very important to understand that what we are seeing, you don't have to replicate that, but it is making
Mm-hmm.
anxious, and that is the fact that it is happening. It is making a lot of young girls and boys anxious about their body. They are hating their body, that we don't look like that, we don't look like this. It is happening.
Right. So another question would be, since we are saying we usually end up using the word anxiety very casually, even when we are nervous or something similar to that. Do you think that since we are saying that anxiety is on a rise, is it actually on a rise, or are we just trivializing things and putting anything and everything and terming it as anxiety?
Well, anxiety is in rise. That is true, because anxiety is something, like I said, it's situation to situation based, right? So it's not the disorder, it's anxiety. Now anxiety, there are a lot of symptoms which happen at one time, and that is known as anxiety, right? So anxiety is on rise, but also the fact that it has become a very fancy word. It's like, oh, you don't have anxiety, you are no one now, because that is happening through social media. for everything, for everything that happens, oh, anxiety. For everything that is not happening according to you, I'm anxious. That's not the case. That should not be the case, because when you say this, after 5 minutes you're fine, you're having your chugging your beer and all, you are fine. But you don't need to make that hype that, oh, I was giving my vibe, I was so anxious, oh my god, I need a. Don't condition yourself like that, because at the end of the day you are conditioning your mind to become weak, and then one day when you'll be, you won't be able to control your thoughts, because you've put in all of this, that, if I'm giving a vibe, I'm anxious. If I'm joining a new company, I'm getting anxious, because that is how I've trained that, oh, I have to be anxious on every little thing. So that is there, and social media is helping out. Like I said, everybody is anxious. Everybody, there are anxiety memes, there are influencers talking about anxiety, then there are videos about anxiety, and then there are people commenting, oh, I was watching this and my anxiety was on peak. Why? I don't get it.
Right. So another question here is that what are the risk factors for anxiety disorder? And is also OCD classified as an anxiety disorder?
No, OCD is a completely different disorder. Anxiety disorder is a completely different disorder. But like I said, that anxiety is like, can be like a root cause, and then it could stem, it could branch into a lot of other stuff. And it's just not about anxiety. Actually, everything starts from stress. The root cause is stress. The root cause is overthinking. That leads to anxiety, then that will lead to OCD, then that will lead to depression. So I'll give you an example. If you notice, when a mother gives birth to a child, suddenly she's a cleanliness freak. Suddenly, she may not be from before, but now she's become okay, clean, no, my baby, and especially a COVID may, so you are on top. So what is happening? You gave birth, then you thought about COVID and dhool, mitti and saaf safai. You started doing it. Ki, okay, I'm going to make the baby lie down. Let me just clean the bed quickly. Then it became a repetitive habit. Every time you are putting down the baby, you are cleaning the bed. You're doing. Now, once you did not do it, now it's in your head. It's stuck in your head. Now you're overthinking. Oh my God! Now my baby is sneezing because that happened. This happened. You've associated your overthinking on it. After that, it will become an obsession, because मैंने बेड साफ नहीं किया, baby had sneezed.
Right.
I have to do it. Then that becomes into obsession, and then you will see it's not only about the bed, the whole house is being cleaned. Now, what happens is that I am using my hands to clean. My hands are dirty. I'm not going to hold the baby. I am pure time I'm cleaning the house. My hands are dirty. I will stop holding the baby. And that is how one little thought, one little stress, one little overthought led to OCD. Today you have OCD, you are not touching the baby, you are so scared, you are cleaning, you become a cleanliness freak, and there's no end towards it. And you cannot, how much ever you try to calm them down, they will not listen, because that thought is stuck. You overthought so much that now that thought is no longer a thought. It's become a belief. I don't clean, my baby sneezes, my baby will get COVID, I don't know what will happen. The worst has been imagined. The worst, bed नहीं मिलेगा, oxygen नहीं मिलेगा, मैं क्या करूंगी, ये हो गया. The worst has happened in their head. And for that thing that is happening inside, you're cleaning, not holding the baby, not doing this, not doing that, you're not letting people come inside your house. For all you know, the husband is sleeping outside, slippers are outside, nonsense is happening. So there are different disorders, but through anxiety, a lot of disorders can branch out. That is true.
That makes sense. So we have a last question for you, ma'am. Instagram had planned to disable the like option for mental health concerns. What are your thoughts on that?
I think it's brilliant because even the content creators, it is all about likes, it is all about followers. I have posted a picture that I did not get enough likes. What is happening? Self doubt. Am I not looking nice? Am I looking fat? Is the filter not right? Is what I'm not looking attractive? Why are people not liking? So it is not about liking, it is about validation. I'm constantly seeking validation from you all. So for example, I also have an Instagram account. Okay. I am not a content creator. So I don't post every 5 minutes. I'm not posting on stories. I'm not posting. I forget. But it's not hampering me. Right. It's not hampering me. But for these content creators, they need validation. They need to be top of the game because followers are something, okay, you are not interesting, let me follow them. You're not interesting. It's everything is on our tips. Our attention span has become so low. It's literally on milliseconds. It's not even on seconds. It's not even on minutes. It's on milliseconds. The way we watch Netflix, web series, and all, 2 to 3 days the entire series is over, and now it's like what to do. What I mean, what we are texting, what are you watching? Oh, ye to dekh liya, wo to dekh liya. So attention span is very low. So when you post photos or you post a post or you post something on stories and you don't get enough like, it's heartbreaking for them, because for them it's validation. For them it's like, oh, this is not validated by them, I'm never going to do this again. They'll post a photo in their night suit and it did not do so for them it's like, oh, I have to be presentable at all times. So they have already in their heads, they have already judged themselves through their followers eyes, and that is all is happening. So it's become very it's become like a norm. Oh, I have to look in a certain way. I cannot wear my specs and go and post a photo. I have to be blowed right. I have to be like presentable clothes, makeup. Even when you are doing like those videos, how what my morning routine and all. Okay, nobody gets up like this. Like literally nobody gets up with camera on their head. Hi, good morning. And nobody gets up. Nobody gets up at 7. Nobody goes and starts working out and eat very healthy black coffee, boiled eggs. Nobody, but you have to do it because you need validation. You need to show that healthy life, healthy this. You be eating cheeseburgers the next minute. You showed your avocado, but what is there, it is there. I have to show this is what my followers want to see. So it it's a way of validation. So if they remove it, it's going to be very difficult for these people to survive. It's not for them, for me also. But for me it's not a need. For me likes are not need, but for them it is also. It's their business, they're working, so they also need. But moreover it's more for validation than just ki, okay, it likes Sagar.
All right, ma'am. So that was really insightful. Since anxiety is such a relevant topic, I'm sure many people must have related and understood anxiety much better thanks to you.
I hope so.
So thank you for that. Over to you, Daphne.
Okay, so thank you so much, Miss Urmika Sahai, for taking out this precious time from your Sunday and for inculcating such new perspectives and such relatable examples with Instagram, with validation. I'm sure us being the Gen Z, being a social media enthusiast, we related a lot to it. And I could personally relate to the overthinking part a lot. Your tips were very helpful. So thank you so much for coming here and being a part of our summit. I would like the tech team to now display the e-certificate that we have for you, and it shall be mailed to you shortly.
Thank you so much, and thank you for having me. It was great. It was not like a boring, monotonous Sunday, so I had like really good fun today.
Thank you so much, ma'am.
Thank you. All the best.
Thank you, ma'am. Over to the next MC.
Good evening, everyone. This is MC Vasundhara. It's my privilege to invite our next speaker, Dr. Ira Datta. Ira Datta is a consultant neuropsychiatrist with a difference. She believes in the holistic care of each individual's mental health needs. She has practiced in Mumbai, Delhi, Pune, and now calls the City of Joy, Kolkata, her home. Dr. Ira has been awarded the Young Psychiatrist Award. Her expert advice has been featured in leading dailies, newspapers, and radio interviews. Dr. Datta constantly strives to share her views on mental health and wellness. She considers herself a mental health ninja and wants to help stamp out the stigma that surrounds mental health. To her credit are many publications in leading national journals and the first ever study on selfie addiction from our country. Her expertise in depression, anxiety, and OCD and stress has helped her touch the lives of many. She has conducted wellness sessions for many esteemed MNCs, schools, medical associations, and even the police force, Navi Mumbai and Kolkata. Dr. Ira Datta firmly believes in the mantra of balanced wellness as a USP to her holistic mental wellness programs. Welcome, Dr. Ira Datta. We'll be hearing a short buzzer prior to 5 minutes of the session ending time and a long buzzer exactly at the end of the session time. Thank you.
Thank you so much for having me. Just to get it straight, you would like me to speak for about 30 minutes? Is that right? And take up Q&As later?
Yes, ma'am. You can go ahead with 30 minutes and then we'll have the questions.
May I also have the rights to share my presentation if I can be made a host or a co-host? So hi everybody, happy Sunday to everybody. I usually don't work on Sundays. It's my personal wellness mantra, but I like being part of places where I can learn from people, especially youngsters, because it really adds to my cognitive bandwidth, I believe. So the exchange is going to be mutual. If possible, I'm going to see if it's possible for you all to participate via the chat. So I'm going to share some questions like, can you just write 1 or 2? And, that would possibly make it a little bit interactive. So you could raise your hand, or I may not be unmuting you right away, but then, we'll definitely consider some of those. Just sharing my PPT to begin with. 1 second. So what did the topic essentially mean to some of the people? Digital cocaine. Thoda sa khukhar hai na? It's a little out there, as I say. The topic in itself is a little, the word cocaine gets a lot of people interested to know more, and it gets them intrigued that what's going on here. Right. So I think the chat option is something I want to open, and perfect. Now I can talk to you all. Can everybody see my screen? Can somebody give me a thumbs up for that? Yeah?
Yes, we can see it.
Perfect. And are you able to see my chat window as well? Otherwise, if it's distracting, then we'll stop it. Right. So first and foremost, welcome to this lovely Sunday where we're going to interact and we're going to try to learn from each other. Just 1 second. Yeah. So let me reintroduce myself very briefly. My name is Dr. Ira Datta. I'm a doctor by day. I'm also a mommy 24/7. That's my full-time job. And I go by the pronouns she, her. I'm a psychiatrist. I'm an MD psychiatry, a DNB psychiatry after my MBBS. I do practice a hell a lot of CBT in my practice. So unlike a lot of what a common myth is there about psychiatrists that we don't know how to do therapy, we actually get a fair amount of training. It's just that most of us don't end up pursuing it very actively or brushing it up or spending that much time. So I am very happy to say that I came from practice. My professor introduced us to the principles, and I somehow in some or the other way end up executing it in my practice even today. So that way I feel like psychology, psychiatry go hand in hand very much. I'm also a mental health ninja, meaning that I like to fight not crime, but myths about mental health, especially on my Instagram, on my social media. But I'm not only going to show you all the good things that I do in life. I'm actually going to share a confession out here on YouTube, which is probably not going to be very nice, but I have a problem, and a real problem for that matter. It's a very big problem. I actually have an addiction, which I'm not very proud of, but I do have an addiction to technology. And that's something that I know comes probably as, oh, that's not a big deal. It's okay. So what? Why? She didn't give such a big revelation. But that's why it's called the digital cocaine. A, because it's addictive, and B, because it's so common nowadays that most of us are going like, acha, theek hai, it's not a very big deal. In this 21st century, almost every age group is starting to get addicted in some or the other form when it comes to technology. And that's why I took this topic of behavioral addictions, because it's very intriguing. It was something that I started pursuing since my master's, since my MD program, and then went on to do a lot of research, a lot of in-depth research as well, inwards and outwards, in the form of published studies and everything. So I'll just, through the whole 20 minutes, try to share some of that. So why bother? First and foremost, ठीक है, we're all using a technology. You're using a technology to reach out to me right now, aren't you? So what's the biggie? But the truth about technology is that it's both a boon and a bane. It is the need of the hour to address how much is too much. Our OPDs are right now, outpatient departments, our clinics are filled with children and adults both doing this to their phones. Snubbing or fubbing has become the new norm. So many parents drag in their young ones saying that, oh, could you please talk to him or her, because I believe that, they're spending too much time on cell phone. And well, lo and behold, the parent itself is spending so much time on the cell phone. It's causing relationship issues, it hampers productivity, and it can cause issues in the future. And if you ask me, seriously, is it that bad? I think some of this will make sense to you all, that this is how at night you'd find a lot of us sneaking in, just trying to send that one last message or that one last speak, ignoring each other on tables at dinner or, during meals, and constantly handcuffed to our cell phones. It needs to be in arm's length, arm's reach, no matter what, just no matter what, it needs to be there. Who is at risk for these addictions? Individuals who are young, come across as lonely and isolated, may have a lot of, emotions going on like boredom or, anger or anxiety. So to just fulfill that void. People who live in the concrete jungle, like us, people who don't execute too much time in other coping strategies like exercising, painting, doing something for themselves. Poor routine, individuals who identify as being stressed or having comorbid anxiety, depression, substance abuse. I'm sorry, I think I practically just literally described almost all of us at some or the other point. So who is really at risk? All of us. You are at risk. I'm at risk. I self-professed at the start that I may be addicted. I felt addicted at times. I felt chained at times. So we're all at risk. And that's why this topic is so relevant to all of us. So what are behavioral addictions? They're non-substance, which means substance are essentially alcohol, nicotine, caffeine, opioids, drugs, any kind of medication that somebody gets addicted to, or for that matter, painkillers. These are called substance addiction. But other than that are called non-substance addiction. And in that also specifically, there is behavioral addiction, which is addiction to a rewarding non-drug related behavior. So it could be even exercise for that matter. But we're focused today not only on any behavior, but categorically digital or technological addiction, which is actually a subtype of behavioral addiction. So this was proposed by Griffiths, and he said that behavioral addiction, which involves human and machine interaction and is non-chemical in nature, is the one which qualifies as technological or digital addiction. All right. Now, I would like to say that neurobiologically, interestingly, both substance and non-substance addictions have similarities. They may not be exactly the same, but they have similarities. So there's serotonin involved, there's dopamine involved. When you do these studies on their CSF, you can see that individuals with more sensation-seeking or impulsive behavior are likely to be more prone to addiction to even non-chemical, which means behavioral addiction and specifically technological addiction. So dopamine reward theory, I say dopamine is a good chemical. It's our best friend and our worst enemy. Too much, too little, that's one problem. And when we get addicted, we get onto a dopamine loop. That's the reason why you find yourself hooked to one more reel, one more text, one more YouTube video, or one more Netflix series. So what are the common technological addictions? What is dopamine? That's a question that I'm being asked. Dopamine is a neurochemical in the brain there are many chemicals in the brain. Serotonin is a common one. Then dopamine is a common one. Oxytocin is there. Adrenaline is there. Like that, there are many chemicals in the brain. And dopamine is the one that you feel when you feel motivated, when you feel rewarded, when you feel that surge. So that's the dopamine chemical. Now, I have a question to ask from y'all, and I would like it in chat that most of y'all reply. How many gadgets of these do you all own? Are you the proud owner or the sad captive of more than 2 on the screen? So that's a cell phone, that's another cell phone, so more than one cell phone. Television, Alexas, your iPads or your digital screens, your desktop, and your Apple Watches or any Fitbit watches. So please type in the chat box, how many gadgets do you have of your own at the moment, at least around you for that matter? More than 2? So I'm getting 3, I'm getting 4, I'm getting 2, I'm getting 1, 4, but you only use some, 3. A lot of people saying 3, 2. Excellent. I'm glad that so many people are saying more than 2, because honestly, I'm guilty to have many of these. So I don't feel very bad anymore. So a lot of us have been the sad captives or the proud owners of these gadgets. And we think more the merrier, right? Now, internet addiction in itself is one of the most common addiction out there. In fact, there is so much evidence about it now, because it started about 10 years back when I was still in med school, where they started researching it. In fact, a little more than 10 years for that matter. This paper's from 1996. I was probably a kid and not in school that time. But Kimberly S. Young has done some tremendously good work when it comes to internet addiction. It is real, guys. It's not a bad habit. It's not in your head. Sachai hai. This is true for all good reasons. So there are validated scales that you can look up on the internet, like Internet Addictive Disorder Scale, Internet Addiction Test, then there's Chen Internet Addiction Scale, then there's a Problematic Internet Use Questionnaire. There's so many scales that can be used to evaluate either for your research. I know this is a career summit, so I'm trying to also bring in the angle of what you can potentially study or what you potentially can do when it comes to your career in the future. So you can study these things, you can use it with your clients. All of these evidences exist out there and they've been validated. Cell phone overuse is a kinder term used instead of saying mobile phone addiction. And that is obviously, like I said, I have 2 right here with me and I'm talking on my laptop. So clearly I have 3 already. So cell phone overuse is a very common thing as well. A study from Stanford showed that more than 200 iPhone using students, of them, 10% admitted to being fully addicted to their iPhones. In fact, they even used the stats back then from the iPhone to see how much time somebody was spending. And 41% said it would be a tragedy to lose their phone. 6% said, no, I'm not addicted at all. And 34% were cited as almost addicted. Sleeping next to the phone, a very common occurrence, isn't it? So under our pillow is our phone. It shouldn't be, but it is. And 69% more likely said that they're likely to forget their wallet, but not their phone. Now, I want everybody to type in the chat box why if they sleep next to their phone. So let's see how many of you all actually fit into this 75%. Type why in the chat box if you actually sleep with your cell phone. Some whys, good. Wow, a lot of people fessing up. I'm proud of you all. This is called good insight. For alarm, it doesn't matter the reason. So in fact, the alarm being away from you is going to make you forcefully get out of the bed versus the alarm being so close to you on the side table. Okay, fine. So it shouldn't be within the arm's length is what I mean to say. Does it count if it's on the table? Okay, great replies, guys. It's really nice when you all participate because it gets the whole flow going that how many of you relate to this. 1 in 8 people are addicted to their smartphones, and the more we use them, the worse it gets. That's the reality right now. I'm sorry, I'm just going to try to shift this somewhere and it's coming in the way. Yeah. So the moment the chat box keeps going, then this thing gets disturbed. Smartphone addiction is very evident when it comes to especially the adolescent. And this is an Indian subcontinent study. Now, I like to show studies as proofs because I'm a very evidence-based person. And I strongly believe that just because maine bol diya and you should believe it, That's not how life should be, right? We should question everything. We should look for proof in everything. Moving on, there have been so much advancement again, just like I said, for internet addiction, even for mobile phone addiction. So there are validated scales, there are studies, people are getting more aware about it. The ICD is formulating diagnostic criteria about it. The DSM has made some stipulations about research purposes. Companies are getting more aware. I'm sorry if some of these terms like DSM, ICD may not sound relatable, but if you step into the field of psychology, they will all become very, very much your bread and butter for every day. The new terms is something which have started getting coined, and that's the one I want to introduce you to. In fact, I did a post on my Instagram Reels today just about this, phubbing. Phubbing is when you're snubbing somebody because of your cell phone. So you're ignoring somebody because you're so deep into your cell phone that you're just busy. There's nomophobia, which, as the name says, no mobile phobia. And these are jargons which have gotten very popular amidst the millennials and post-millennials. So these are terms you may have heard loosely in and around. So, one second. Yeah, right. So this is typically all of us at this moment, aren't we? We're all standing next to each other and we're all looking into our cell phones. So really, are the smartphones making us smarter or not so smart? I'm not very sure, because there's so many cases of accidents of even the driver doing that, even the pedestrian crossing the road doing that. And if you've been guilty for walking up the stairs, down the stairs, around your house with your cell phone in your hand, you know that you may be borderline addicted right now. With great phones come great apps. And that's the truth. We all want the nice phone. We all have the WhatsApp right now. So again, some truth bomb questions, and let's see. Do you check your WhatsApp every time you get an alert? People just type yes, why in the chat box to see whether you all do that or not. No, good, why, yes, no, no, no. Wow, so many no's. I'm really liking this. Yes, no, every alternate is yes, every alternate is no. Lovely. Great, great, great. Okay, time out. Next question. Do you check your WhatsApp the first thing in the morning? I think this may be no, because nowadays people check Instagram first thing in the morning. But do you check your WhatsApp first thing in the morning? Yes, Insta first. Thank you for writing that. Yes. So many yeses. Right. And the dreaded last scene, guys. When you know that your partner, your friend, or someone that you are really close to left you on and typing, or you know what time they were awake till, but they didn't reply back to you, that's a recipe for disaster in itself, isn't it? So lines of how much WhatsApp people use are getting blurry these days, to be very honest. And about this whole technology, things are getting out there and blurry. My next favorite technological addiction to talk about is this. Clearly, it's selfie. And the reason why I'm so interested in talking about selfie addiction is, A, it comes from personal interest. I like taking selfies. I am a selfie taker, self-proclaimed one. I don't feel shy in that. One time I realized, oh my God, I may be taking too many. And thereafter, I decided to do something good about it and get into research about it. So during my senior residency, when I was in Sion Hospital in Mumbai, I decided to pitch it to my boss then that, so do you think that we should study this selfie taking whole thing is happening? People are dying on the rail tracks while taking dangerous selfies, and so much is happening. Do you think we should study it? And he was very intrigued. He said, yeah, definitely. So first question being, now if many of you thinking that are selfies even popular? Is anybody even still doing that? Yes, they're definitely popular amidst the masses. This is actually a chimp who took his own selfie in a zoo, grabbed a tourist's camera and took it the way the tourists were taking it. Somebody's written, people are mad. That's not a kind thing to say. We refrain from using these extreme terms, please. So selfies are popular amidst the masses. Selfies are popular amidst animals. Selfies are popular amidst presidents and prime ministers. You can see that. Definitely, Oscars have it all for selfies. And there are out-of-the-world selfies as well. So that led me to study selfies in depth. And this was the first ever study from the Indian subcontinent, which was about attitude towards selfies. And we categorically studied urban school going youth in Mumbai school. These are my co-authors. These are some of them are my friends, some of them are my senior professors, and we did it at Sion Hospital. I'm not going to bore you with the entire dynamics of the study, but if you're interested, you can go online, type my name, Dr. Era Datta, type the word attitude towards selfie, and it's published in PubMed, which is the centralized database where all good publications are essentially put up. But just to share a gist of what was there, we studied about 248 children, and of them we found, when we asked them, do you agree and approve that it's good to take regular selfies? And more than 22.2 said yes, hell yes. Whereas 11.3 said hell no, absolutely disagree. Similarly, we asked them what portals or how many portals do you post your selfies on? And more than 4 portals were used by 46.1. So it's not just Instagram. They would post it on Facebook. They would post it on Pinterest. It's Me was back then, actually. Snapchat and so many more. Similarly, we said, how many average selfies do you take in a day? And more than 4 selfies a day were taken by 16.5% in our study group. After this study has been used by many people from India, from Pakistan, from Nigeria. A lot of people reached out to us to share the scales and to share our questionnaires. And it's gotten really important that, this topic was studied very well across the countries, across the world. And when we said that, do you feel that people who take selfies are wasting their time? Well, a big chunk of us said, yes, we do, but still we take selfies. So next comes my favorite addiction, which, like I said at the start, that I may be getting addicted, is to social media. Now, COVID may be making social media addiction worse. And this is a very latest article that I found, for that matter. There's a basic impact which is happening on social media. It requires some intervention right away. This is Kendall Jenner. For those of y'all know who Kendall Jenner is, she's a supermodel. She's one of the sisters of Kim Kardashian. So she's in the Kardashian show. And she herself self-professedly spoke about her anxiety about the problematic social media use, because May was the Mental Health Awareness Month. So she spoke about it quite openly. And that's good that more and more people are coming out and speaking about it. Next is video games addiction. Any video game fans in the crowd? Out of the 120 people, give me a yes if you like video games, if you like spending time, if you like, playing your PUBG or multiplayer games, Discord, whatever it may be. No, why, no, okay. So it's a mixed crowd out here. Once upon a time, I used to love it. Honestly, now I think I've slowed down a little. However, yes, they're very addictive. They work on the reward theory. You try one level, you fail one level, then they kind of give you a bait, and then you come back. If you achieve in a level, then you go up a level. So do you see what the reward is? Sometimes they give you coins. Sometimes they give you, if you clear this level, then definitely the next level, you're going to be able to buy this. So it's damn addictive. This was an article where I was interviewed to ask about PUBG when it was banned. And I know it's been some time now, but they asked me about PUBG. And honestly, at that time, I was seeing about 2 to 3 youngsters in a week brought by their parents. And the parents were all complaining about PUBG. And I'll be honest, one child even told me, why don't you join in, doctor? You look kind of cool. You can play it. And I was tempted, but I chose not to, better sense. However, yeah, playing once in a while is not a problem. You must find ways to. Video games are very good for your eye and hand coordination, for memory, for so many things. But excess is the bad thing. So the good, the bad, and the ugly. This is my favorite thing about technology. It has the good, it has the bad, and it has the ugly. So the negative outcome of digital addiction is quite evident, guys. We all know that it can affect our physical aspect of the body. So our postures are like this all day. Our eyes get affected with all of this. Our health gets affected. Mentally, we know that we get isolated, anxiety, depression. At night, we're scrolling, so we're not really doing anything except for avoiding sleep. It's called revenge bedtime procrastination. Emotionally, we know that sometimes we get jealous and comparative of seeing something on social media that, wow, she's got so many more likes, she's got so many people following, wow, living the life, enjoying. There's a lot of discontentment that may happen. There's a lot of guilt, Why did I waste so much time? Why did I sleep so late? There's so much stress and so much more. But here's something that I'm going to share with you, which is going to possibly change the way you look at it so far. So this is a very recent study conducted at Oxford, where they studied teens, tech, and mental health. And this is the outcome, that there remains little association between technology use and mental health problems. And they studied a very large group of population. So eventually they said that, yes, it has some impact, but not as negative as we have been making it. And they said that we couldn't tell the difference between social media impact and mental health in 2010 and 2019. We're not saying that fewer happy people use more social media, but we are saying that the connection is not getting any stronger. So even though in the last 9 years, the technological use has certainly gone up, but they're not saying that definitely this is leading to some kind of mental health hazards. So then what is the truth? Doctor, you wasted my half an hour telling me that technology is bad, and now you're telling me technology is good and there are no side effects on mental health. There are little side effects on mental health. So what is the real truth? Here's my opinion on the real truth. Again, this might not be completely just evidence-based, but my opinion. I think anything done in limit is okay. You need to set points and limits which are realistic, and make sure that the technology is not causing you physical issues. You have to be aware, you have to be mindful, and know that too much of anything is bad. Now you'll say, how do I do that? So here's a self-check of knowing, are you addicted or not? So I'm going to give everybody a minute on the dot and let you all go through it and put it in the chat box. How many do you have? Do you have craving and urge for your technology, whatever technology, whether it's WhatsApp, internet in some form, whether it's social media, whether it's cell phones? So if you have craving and urge, give yourself score 1. Go to score number 2, which is tolerance, which means that earlier you would spend 30 minutes on social media, but now you need an hour and you kind of need more and more and more. How much time is wasted? That's third point. So if you have 1, 2, and 3, so you have 3 points so far. Next is withdrawal, in which your mood may be irritable. If your mom takes your phone away, or if your partner takes your phone away, you're going to get irritable. You're going to get cranky. If your priorities have changed, you should be studying or working and you're just headed towards your phone. If it started affecting your social life, your work life, your home life, others around you started saying, you're doing too much of this. If you're continuing despite knowing that this is a problem. If you've tried to stay away from your gadgets, but you've not been able to. If it's been harmful use, meaning using the cell phone while crossing the road, perhaps. And finally, if it's caused you restlessness, sleep, and appetite changes, give yourself 1 score for everything. And if you score more than 3 or 4, you may need to consider switching back a little bit. Now, going back, setting your own rules for your own self is a thing that you can do. Let's move from mindless scrolling and mindless technology to mindful technological use, because technology is not going to go anywhere and we have to live with it, but we can't let it drive us. We have to be in charge. So be aware, take charge, take control of how much technology are you using, and are you using the technology or is the technology using you? Also, every now and then go on a dopamine digital detox, which is a fast. So like it's a device fast. So sometimes I just go off social media for a couple of days. Sometimes I just decide to not use my laptop except for the working days for nothing but just work and no YouTube. And I just read a book instead. So it could be your own way, but going on a digital detox is a very good idea. Next time when you reach out for your cell phone, next time when you open Instagram, here are some questions that I would like you to ask yourself, please. Number 1, why am I resorting to this? Number 2, what does it do for me? Number 3, where does it take me? Number 4, what else could I have done with this time? And finally, is it really taking me away from something else which was my target. It should have been studying, should have been working out, should have been talking to my mom. In such answers, you may want to reflect and step away from the device for a bit, at least. Finally, if you are looking for a career in this particular field called behavioral addiction, go for it. There's a lot of scope for research. You'll find a lot of clients. We all have technological issues. You can work on focused intervention programs, a lot of rehab facilities. I've worked at some in Delhi, I've worked at some in Bombay, and there are focused programs when it comes to gadget addiction as a part of their entire thing, especially when somebody comes to drug addiction. We also focus on non-substance addictions as well. And finally, you can also help chalk out detox programs for others and for yourself first. So that's me, that's my time. I hope I managed to squeeze in a lot of information in a little bit of time. I'm open to questions now.
Thank you so much, ma'am. It was like an awakening again, just like the movie Social Dilemma did for us.
Yes, I was going to mention it, then I didn't want everybody to go on to another social media platform and look for more evidence.
No, but even after we watched the Social Dilemma, how much has really changed for us? Like after knowing the truths, we are still there. That is the power of addiction, is what I think.
I agree with you 100%.
Yes. So on the lines of you talking about selfies, there is a question. What do you think? Why do you think people are addicted to selfies? Is it because of the pressure that social media influencers unintentionally put on us?
Okay. So the study that we had done categorically was about two main aspects that are the most correlated with selfies. One is body image. So taking matters in your own hand literally, because a selfie is a picture that you take of your own self and you want to look a certain way. So one is the body image. You want to present your best foot forward, is why selfies are so popular. Number two is we also studied narcissism as a part of selfies, which may not be there, may be there. Some people also use it when they are underconfident to overcome that. So in that case, I consider it's a good thing. So selfie has a lot to do with your own first, and then of course the peer pressure, the societal standards of beauty or how people look at it do matter as well.
Okay. So what do you think is the more plausible idea, to completely deprive ourselves from games or play them once in a while?
Balance. That's the key word. I do not ever preach to anybody, whether it's addiction, whether it's sleeping, whether it's OTTs, whether it's social media, to go on a 0 or 100. In balance lies wellness. So you don't drive at 0 because your car is not moving. You don't drive at 100. You drive at about a 40, 50, 60. And titration is the toughest thing, isn't it? But I would recommend you that you figure out what works for you the best. If you do believe that taking the no video game route is a good idea for a while, then why not experiment with it and figure it out?
That's correct. So could the ban of games like PUBG create any kind of digital withdrawal or other health issues in children and adolescents?
When the ban had happened, like even on TikTok, on PUBG, all of that had caused a lot of mass disappointment and a lot of like, oh, what will we do next? But this is the beauty of technology. There's always a next one around the corner. So PUBG was then replaced with something else, and we'll always find something to look forward to. So human beings are clever. They find hacks.
Totally. So what are the major categories of internet addiction? How have they been recognized by the medical establishments?
Right. So there's a lot of research being done on this. DSM has proposed some guidelines. ICD-11 is making changes in 2022 is when it will come in place, and we'll know a lot more then. But as a broad aspect, the term addiction is being dropped a lot because it's happening to everybody. So they've started using the term problematic use disorder instead of saying addiction, because we're all going to use it, but how much use is a problem and how much use is acceptable, which is unique to everyone, right? So that is the work that they're doing, and maybe as young budding psychologists, you guys can do more work.
Absolutely. So what is the relationship between regulation, procrastination, and the digital technology? Like how does one break the procrastination habit due to technology?
Very good question. Something I do every day, which I get asked like 10 times a day. When people come and tell me that I'm procrastinating, my first question is always, what are you doing instead? And the answer is usually technology, right? So clearly the distraction is external. If the distraction is primarily external, you may have to get rid of the culprit for a while. If the distraction is more internal, of course, there are other things as well. There could be ADD, there could be depression, there could be anxiety, and those need to be worked on as well. But the external distraction are the ones that you need to primarily work on. This loop which is there, you're right, the reward theory that I was talking about earlier, and somebody asked what dopamine is. This needs to be paused for a bit, and only after the initial restlessness you'll start to see something happen within yourself. You'll be like, oh, there's a sense of calm also despite this. So keep trying, keep failing, keep trying again. That's my mantra in life. That's what I do. At least every time I find myself a little hooked, I try to walk away, and then I go back in limitation, I again walk away. So that's how you need to figure out your own style.
So talking about dopamine, have you come across the term dopamine detox? Because it's very
I wrote it. I wrote dopamine fast, dopamine detox. I wrote it in one of the treatment strategies. Yeah.
Yeah. So if you can explain more on how people should adhere to practice it.
Honestly speaking, you cannot literally do a dopamine detox because it's a chemical in your brain. It's going to be there, right? Even when you're fasting, you can't literally like deprive your body to the point like कि एकदम सब कुछ ही नहीं होगा. So dopamine externally, if you want to go on to a detox or a dopamine fast, we call it a digital fast or dopamine fast, you need to get rid of your technological devices for a set period of time. Some people go for 5 days, some people go for 7 days, some people go for longer. Now, what that means is a lot of them just resort to basic phone calls. Hi, hello, what's going on? Because in today's world, we need to be constantly aware of, and maybe your profession requires you to. I recommend people that when they're on vacation, like when they're actually on vacation, why not take the dopamine fast then? Because instead of being mindfully aware of everything around, you're just busy putting your Instagram updates about, hey, I'm here and I'm doing this. So that's a wonderful time to do a dopamine detox because your workplace is not going to call you enough. Your friends know where you are. Everybody knows, and they don't need to know every second. And you can just mindfully enjoy yourself. So that's how you do a dopamine fast.
So we tend to think that only the younger generation or the teenagers are the ones who are more prone to being addicted. And we know for a fact that our parents or even the older people are very much engaged with technology. And
absolutely,
how do you think this phenomenon comes in picture with them? Like, misinformation and the whole thing that was going on with WhatsApp University and believing that all the things that come on WhatsApp is true. So how do you think that can be tackled?
So there's a beautiful thing that we do called media literacy, and we do a lot of programs about it. And media literacy is all about teaching young, but I believe it should be for older people also, to know the value where the sources, the information is coming from. Question everything. And that's why in my talk also, I told you, don't believe me. I did not come up with these terms. I'm showing you actually evidence. So look for evidence, find the right links. Like PubMed is a very genuine source. Don't just Google words and look it up. The first link jo aa gaya, this is the right answer. As the part you said earlier that parents are the ones, or the older generation is getting more hooked, I completely agree with you. So once upon a time, I kid you not, in my practice when I started off 10 years back, the children were brought by the parents that she's too much on the cell phone, she's always doing this. I'm sorry, the tables have reversed. Now the young ones say, but tell mama she's constantly just on the phone. So I think we've come a full circle, haven't we?
We totally have. Like, we can't pick just one good person out. Everyone is just hung to social media and technology. So in that case, if you could recommend anything to us and all kinds of generation, we won't just talk about young generation. How can we maintain that balance? At least how can we start with it?
Start by being aware, mindfulness, because till you're in denial that no, I don't use cell phone enough. And that's why using your phone to tell you, for example, there's so many apps that you can use to monitor your screen time. So right now, today is Sunday, my phone sent me my weekly report and it said it was down by 20%. And I was very proud of myself. I was just tapping myself and saying, good job. The 2 days I tried to go off social media earlier helped. So being aware is number one. Using apps to hack yourself is a great idea. Finding other things to do, which don't involve cell phones or technology as much. So going out for a walk without a device, or exercising with a buddy. Even in the house, you can find a buddy, right? Or even just exercising and just looking at the sky and not necessarily looking at a screen. That's another great way. That's time away from cell phone or technology, is basically time, mindfully spent. So these are simple hacks. Everybody can do them. It only starts with, yes, I have a problem. Yes, I need to fix it. And I need to just work on small things.
Absolutely, ma'am. All those tiny bits of information that you gave us are so much insightful to us. And thank you so much. It was a pleasure talking to you. And
Thank
I'd
you so
like to
much.
go on Vasundhara to thank you. And over to you, Vasundhara.
Thank you, ma'am, for your valuable and enriching words on selfie addiction, digital cocaine, and behavioral addictions, and other such thought provoking concepts on technological effects on mental health. As a token of love from 3G, we have an e certificate for you, and it will be mailed to you shortly.
Thank you. Have a great day, guys.
Have a great day, ma'am.
I'd like to pass on the session to the next MC to introduce the next speaker.
Thank you, Vasundhara. We have Gloria and Angela who are going to have a disclaimer about something very surprising. So, here to you, Angela and Gloria.
Hi guys. So 3G School of Psychology has an upcoming internship available, clinical psychology internship. And if you were there on the first day, Nishi had talked about the internship program and what it entails. So we have a giveaway for you guys. It's worth 4,000 rupees. And one of you lucky winners can, probably get this giveaway. So all you have to do is go on 3G School of Psychology's Instagram page, tag 3 friends, any psychology students or enthusiasts on the comment section, follow the 3G School of Psychology's Instagram page, and repost the poster as well on your stories. It all you have to do is just these 3 steps, and you could be one of the people who get this giveaway. So just go do it right now, and you might be the lucky one. You never know. So yeah. All right. Over to the next MC.
Thank you so much, Gloria, to address that. So, I'd like to welcome our next speaker. With immense pleasure, I would like to introduce you to the next speaker, Dr. Yaron Zif, all the way from Israel. A little background on him. Dr. Zif completed his undergraduate studies in the Faculty of Life Sciences at Tel Aviv University in 1988. He earned his MSc in Ecology from Ben Gurion University, BGU, of the Negev, Israel in 1991. He received his PhD in Ecology and Evolutionary Biology from the University of Arizona in 1998 from the US. During his PhD studies and postdoctoral training at the University of New Mexico, USA, he specialized in community ecology, macroecology, and conservation biology. Dr. Zeif is currently an associate professor at BGU in the Department of Life Sciences and the chairperson of BGU's Green Campus Initiative. He is also the head of Ben Gurion University of the Negev School of Sustainability and Climate Change. So I would like to inform you that we will be hearing a short buzzer prior to 5 minutes of the end of the session and a longer one exactly at the end of the session. So without any further ado, I would like to welcome Mr. Professor Yaron Zeif. Over to you, sir. Dr. Yaron, are you here? He has definitely joined the meeting. He will be here any moment, sir. Dr. Zeef, can you hear me? Okay, guys, so Sir is actually here. He's facing a bit of technological issues. So, if you have any doubts about the internship that Gloria just mentioned, you all can ask in the chat section, and everyone who is tuned in through YouTube can ask in the comments. And Mr. Yaron is something worth waiting for, so we must definitely wait.
So yeah, so the internship is also a really good one. Nishi, who is in charge of it, has she and her team has come up with a really good plan for the internship, and if you get to be a part of it, it's going to be really fruitful, I'm sure. So if you need any information regarding the internship, we have provided you the contact of Nishi. You could get in touch with her, and she will give you all the information that you want. We are really sorry about the inconvenience caused. He's going to join in 2 minutes. So let's be patient for it.
We hope the sessions that we had today were fruitful for you because we definitely learned a lot from it. And please let us know in the comments and your chats how you enjoyed it and what was your biggest takeaway from all these sessions.
Who have you enjoyed so far? Like, what is the one topic that you really enjoyed and learned something from it?
I am a fan of Hiba. Yes, spiritual psychology.
Yes, I do see a lot of, okay.
The certificates, I think today we end with the event, and in the following week, anytime you are tend to receive your certificates.
And regarding the giveaway winner will be announced on 25th of June. So stay tuned and follow our Instagram page for more updates. Till then, can I ask the tech people to play the videos?
In India, the rate of mental health practitioners is 0.3 for every 1 lakh people as per the World Health Organization.
There is a great gap that exists between the providers of health and people in need.
With this global pandemic, things have gotten worse, and it is predicted that after this, we will be having a mental health.
We are a growing population with complex issues but not enough resources for help.
Psychology is seen as an interesting blend of science and art. It is becoming a popular choice for many students.
However, there exists a taboo regarding mental health and the field of psychology. This prevents a large section of society in urban India from seeking help, while rural India suffers from lack of resources.
Mr. Yaron, are you here? Dr. Yaron, we hope you can hear us. And if you can, please unmute and start your video so we can begin with the session. Dr. Yaron, can you hear us now?
So, can you open?
Yes. Yes.
Yes, sir.
See me now.
Can you open? Yes, sir, we can see you. If you could lower your screen slightly, we'll be able to
hear us? This video is frozen. Yeah.
Okay. Okay. All right. This?
We can't hear you. Yes, you can go on now. We are so sorry for the inconvenience, guys. Sir is going to join us soon. He is facing some internet issues as he's from Israel, and I think you all will understand. And until then, I request the tech team play some videos for the attendees.
In India, the rate of mental health practitioners is 0.3 for every 1 lakh people as per the World Health Organization.
There is a great gap that exists between the providers of health and people in need.
With this global pandemic, things have gotten worse, and it is predicted that after this, we will be having a mental health.
We are a growing population with complex issues but not enough resources for help.
Psychology is seen as an interesting blend of science and art. It is becoming a popular choice for many students.
However, there exists a taboo regarding mental health and the field of psychology. This prevents a large section of society in urban India from seeking help, while rural India suffers from lack of resources.
The mental health scenario in our nation is highly disorganized to pockets which are inaccessible to the most. The regulatory bodies are not structured either.
All these reasons have added a lot of instability and lack of guidance for students who want to come in the field as well as have a rewarding career.
There's a huge scope and demand in psychology despite what people might be telling you. So come join with us and explore the field of psychology as well as latest trends which you might have never heard before.
I'm super excited to talk about Encyclopedia event. It's one of its kind in the world. It is designed by the student for the student. There are eminent speakers coming from the various field of psychology to discuss, to answer all your kind of a question, whether you are a PhD student, you are a UG student or PG student or school students.
Hello? Can you see me? Hello?
We can see you, but we can hear you clearly.
Can you see me? Hello? Yeah. Well, let me just turn off the phone. Yeah, turn off the phone. Just turn off the phone. What's going on? Okay, can you see me now?
Yes, sir. Yes, fine.
We can see you. And we can hear you very clearly.
It's complicated between you, between technology. Yeah, but I hear myself. Wait. One more minute. One more minute. Sure. No, because the voice is in a different place. Okay. Okay, can you hear me all now?
Yes, sir.
All right. Thank you so much.
I will shortly
Well,
introduce you, sir, and then you can start with the presentation. Can you hear us, sir?
okay.
Okay, so I'll just shortly introduce you. With immense pleasure.
Yes, I can. Now I can.
Yeah. With immense pleasure, I would like to introduce our next speaker, Dr. Yaron Ziv, all the way from Israel. A little background on him. Dr. Ziv completed his undergraduate studies in the Faculty of Life Science at Tel Aviv University in 1988 and earned his MSc in Ecology from Ben Gurion University, BGU of the Negev, Israel in 1991. He received his PhD in Ecology and Evolutionary Biology from the University of Arizona in 1998 from the US. During his PhD studies and postdoctoral training at the University of New Mexico, USA, he specialized in community ecology, macroecology, and conservation biology. Dr. Ziv is currently an associate professor at the BGU in the Department of Life Science and the chairperson of BGU's Green Campus Initiative. He is also the head of Ben Gurion University of the Negev School of Sustainability and Climate Change. Over to you, sir. You can start your presentation. So if you can hear us, if you're facing any network issues, it's okay if you keep your video off, so there won't be any fluctuations, and you can continue with the presentation.
Seems to be that there are some interruptions. I don't know why. Let me try. And whatever we can achieve, we can achieve. All right?
Yes.
Okay. Can you all hear me now? Okay. So, to all students of psychology that are here in this school, it's okay?
We can hear you, sir. You can continue.
All right. Can I be heard? Good. Thank you so much. Okay, to the all graduate psychologists and students of psychology in the school, welcome. I was really thinking about a topic that will touch all of us. And the topic that I chose to talk about is about awareness. The speaker that was ahead of me, and she was before me, she was speaking about working on addictions with smartphones through awareness and mindfulness. But the real question for the psychologist is, what is awareness? What is awareness? How can we all benefit from awareness? And what is the role of the psychologist and the therapist in increasing awareness among the patients that we have so they can create change? We distinguish between three types of changes: initiate change, forced change, and a natural change. Clients who come to us, to the clinic, they seek for change because something is wrong in their relationship. Something doesn't work. It could be their job, it could be their spouse relationship, it could be their relationship with their children, it could be any issue that disturbs them from living in a very healthy and happy way of life. This is so important. So the question is how this change can be occurred. And the answer is change can occur only if awareness is there. When I'm not aware of what I'm doing and why I'm working the way I am, how can I do my change and how can I change my behavior? How can I better my life? So awareness is the most important issue that psychologists do play in order to create an enhanced change with their clients. But what is awareness? How do we achieve awareness? This is very important to realize and understand. This is the real role of the therapist. Freud, for a long, long time, the beginning of the 20th century, just issue of the tip of the iceberg, when he coined the terminology that 50% of our personality and our issues in behavior are above the water and only 85% are below the water. So we cannot see that and we cannot really become aware of it. He coined it as the conscious, subconscious, and no conscious levels of awarenesses. So let us realize and understand, for example, that if we go in a party and there is a person that we feel inside that we do not like, something is wrong. We don't know this person, but we say to ourselves, oh, I don't like this person. I don't like this person. So my wife or my girlfriend, what's wrong? You don't even know this person. And you say, I don't know. There is something in this energy that I feel I cannot close. And the opposite can happen. It's called sympathy. So I can meet someone at all. Say, oh, no, there's something with this person that I like. Most of the time, when I will be asked, what is there inside that I like or don't like, I will not have I'm sorry. Something wrong. I do apologize for that. Can you all hear me now?
Yes, yes,
Yeah.
we can.
Okay, sorry about that. I don't know. It's beyond my control. And it's not in the subconscious level, but it's beyond my control. So actually, what happens that if it is in the subconscious, now the meaning I said, the information that I have, I cannot really do anything without it. I cannot change it. I can't do anything with it. It's what Freud used to say, it drives me to what we call repetition compulsion behavior. Means that I have to repeat the same behavior again and again and again and again without being able to choose and to change it. What is the aim of therapy? The aim of therapy is to give us choices so we can choose the behavior and we can change it when we do realize that this behavior has a malfunction, does not serve me anymore. Let's say I get very quickly furious at my spouse, or I don't know how to tolerate my patients with my team as a team leader, or I don't know how to handle my organization. And when I'm going to be asked, what is going wrong? Why are you doing the way you're doing? Most of the time, I will not have the answer because it becomes automatic, it becomes a pattern, and I cannot control the situation. This is why we all need therapy, because our childhood events do influence our present life. Freud used to call it a traumatic event. Freud was very determined. He said that till the age of 9, we are so determined. What happened in our early age time is so critical, so that it will define the way we are going to behave as adults. John Bowlby, who created attachment theory, mentioned us a long time before, telling us that the way we were raised by other parents will dictate the way we behave as adults. So it is crucial to understand our past events, how do they influence our present situation. However, if we don't gain awareness about this, we can't do anything about it. So what is awareness and how can it be created? And this is what I see the role of the psychologist of today. The role of the psychologist is to connect to our clients certain kind of events that happened in the past with certain kind of behavior that happened in the present, and to show similarity and to show the connecting, to show, for example, when I say to my clients, are you aware that the way you relate to your boss really is the same way you related to your father? And my client used to say, what? How could that be connected? And then when I'm able to explain to that client that the way I relate to authority figure, for example, that I resent authority figure, I reject authority figure, I compete with authority figure, does not really connect my boss. It is a repetition compulsion. It is a projection from past event that I had in my life. And of course, it is projected to the present situation. In Gestalt therapy, which is the therapy that I do specify, we call that unfinished business. We have an unfinished business. And how do I know I have an unfinished business? And how do I know as a client that I have an unfinished business? And this is the role of the psychologist, to work with the client. Whenever, just imagine that you have a scale from 0 to 10 of the event, okay? And just imagine that you have a scale from 0 to 10 of the response. For example, if I ask you now, how are you? And you will say, fine, thank you, doctor. That is very similar, right? The degree of the question and the degree of the answer is relative the same. But if you ask me, how are you, doctor? And I will answer, what does that relate to you? Are you my physician? Who are you to ask me who I am? You will say to yourself, how does that connect? Where this answer come from? It's disproportionate, is not relevant, is not attached to the situation. So here is the key element for you, as I say. Whenever the response of the client, of the person, is totally disproportionate to the stimuli that happen, it means that it lies on an subconscious level. It means that the person is not aware of why does he or she behave the same way that she does. It gives us a map, and the map gives us a situation. When I see that the person just answered or reacted totally disproportionately, I know there is something there. There is an unfinished business there. There is something there that needs to be revealed, surfaced from the subconscious to the conscious level. And this is what the psychologist does, very gently, empathetically, with a lot of care and compassion. He goes to his client and reflects. Are you aware that there is a connection between the way there was the stimuli and the way you reacted? So the client can say, well, I still don't understand what's the connection. And then the psychologist can say, are you aware that the way you responded to this stimuli was totally out of proportion, was totally out of relatively attaching to the situation? That means you are walking on an unfinished business era. You're walking in an unfinished business period. You are walking on the field mine that can explode every moment. And this is our role, to help our client, A, to identify that we are walking on mine, B, to take responsibility that our disproportionate behavior is ours, and we need to take care of it. And that's where awareness comes into place. The definition of awareness, my own definition, is the ability to connect between two variables that we did not connect a minute ago and find there is a connection between them. For example, okay, let me give you the difference between awareness and knowledge. For example, everybody knows that there is an impact on alcohol on driving. That's not awareness, that's knowledge. I mean, all you need to do is to do the chemistry and realize that when you drive, you do not drive if you consume alcohol. Your alcohol is the driver. However, when you can say to yourself, my goodness, I consume alcohol exactly like my dad, exactly like my father, that's an awareness. Because a minute ago, I was not able to connect between these two variables.
We're so sorry, guys. We're hoping for him to be back soon. Just stay tuned. Can the tech team play videos until then?
In India, the rate of mental health practitioners is 0.3 for every 1 lakh people as per the World Health Organization.
There is a great gap that exists between the providers of health and people in need.
With this global pandemic, things have gotten worse, and it is predicted that after this, we will be having a mental health pandemic.
We are a growing population with complex issues but not enough resources for help.
Psychology is seen as an interesting blend of science and art. It is becoming a popular choice for many students.
However, there exists a taboo regarding mental health and the field of psychology. This prevents a large section of society in urban India from seeking help, while rural India suffers from lack of resources.
Video. Thank you. So
What shall I do? I awfully apologize. I'm calling from the university, and I don't know why it stops.
It's totally fine. So we understand the issues. Network issues are always there. It's okay. You can continue the session.
It usually comes from India. When I have network work, when I talk to my clients and my students in India, usually they're in networking issues, but not from here. It should not come from here. And so I do really appreciate your respect. I do really appreciate your patience. It's not taken for granted.
It's worth it, sir.
I really, I really do appreciate that. Anyway, where I stopped was that I said that two variables that are not connected a minute ago were connected suddenly, and we came to what we call aha moment. You know, when people say aha moment, this is the insight. Suddenly, I do connect between one event to another event. This is awareness, because when I can help my client to connect between an event and another event and another event and another event that for him or for her were totally separated with no connection, and suddenly my client said, oh, now I can understand. Now I can say, why do I relate to my mom the way I do? Why do I relate to my father the way I do? Why do I relate to my children the way I do? That means that I gained awareness, And now I have the potential of choosing a different behavior. So if I don't gain this awareness, I can do nothing about it. So what is important for us as psychologists? What is important for us, because we gain the knowledge and we learned, is to help our clients to decrease and decline the blind area. You know, I'm going to teach you something about group dynamics. You probably have heard about that if you learned some group dynamics. There are two very famous psychologists. One is Joseph Ingham and Harry Ingham and Joseph Luft. They created together, Harry Ingham and Joseph Luft. You took the first two names and we created a module we call Johari window. Johari window is Joseph Luft and Harry Ingham. When they created this Johari window, they described that there are four situations that we can relate to the other. One is the known area. The known area is the known area that nobody needs to reveal anything because it is seen. For example, everybody can see that I'm a man and not a woman. Everybody can be witness that there are network distortions. That is the known area. Nobody has to reveal it. But, for example, you don't know, how do I feel inside? Whether I feel calm, whether I feel frustrated right now because there were interruptions in the networking. You don't know. Why you don't know? Because I have not revealed this information to you. This is known to me, but not known to you. Yeah, the way to increase the known area is when I share this data, when I will share this information with you. So the unknown area and the hidden area, as Johari said, the hidden area will decline and the awareness, the open area will increase. The third window, which is so important for our topic, is what we call the blind area. The blind area is an information that I am blind to myself, but everybody else sees it. Everybody else notices it. I am not aware of this. In Gestalt, we say I'm out of awareness. I'm totally blind to the situation. For example, when I work with teachers and I say, are you aware that you just shout all this hour? Me? What? Shouting at the kids? And then I take a tape recorder and I play. Say, who was that? Oh, that was the professor of biology. Did I shout? I was totally out of awareness. This was my blind area. So when I can help my client to decrease the blind area and to increase the known area, I can enhance the awareness that can create change. Because the moment my client is more aware and the blind area is lower, there is more potential to changing behavior. So this is really our job. What are we supposed to do? We are, and this, I find it fascinating. I've been doing it for more than 40 years, and I'm still in love with this because, you know, especially I love to work with dreams. When my clients share with me dreams, and then I ask them, have you any idea what the significance of the dream is? And the client says, no, I have no idea. Why did I dream the way I did? I have no idea. Why did I have this? How did it appear in my dream? And the beauty about it, that when I talk with my client about the dreams, and then you see this moment, and the moment is amazing. When the client understands the dream, he said, oh my God. I said, OMG, oh my God. Now I get it. Now I understand that I dreamed about this because I'm having an exam tomorrow at the university, and I had a lot of anxiety. I had a lot of scare. I had a lot of fear. That's why I dreamt about a tsunami in the ocean. That's why I dreamt about a storm. a minute ago, my client could not connect between the storm in the dream and the tsunami with the anxiety before the exam. Two variables, totally separated, one in the dream, one in reality, that my client could not connect. And in the moment, I could help my client and say, well, your anxiety in the dream, your anxiety before the test is really a huge storm. See what I did? I took the image in the dream and connected it to the actual situation. Then my client said, oh my gosh, now I can understand why did I dream this last night and why I couldn't go to sleep and I was tensed. This is the beauty about awareness. I have a collection. You know, people have collections. Some collect beers, some collect, keychains, some collect puppets. I collect aha moments. I collect aha moments because the moment I collect aha moments, every time a client says, aha, I feel so happy about it because now I know there is a new connection that has been created. So let me, I don't know how much time I left for maybe all those interruptions, but let me just go into three levels of awareness, okay? Is that okay? Can I do that, Angela? 3 levels of awareness? And then you will have a tool that you can all take. We have 3 levels of awareness. First level is level 0. What is level 0? No awareness. No awareness means that the person does not have any awareness, does not invoke any energy and time to look inside, to have insight, and to check the behavior with him or herself and with the others. That means one thing, that the consequences will be a repetition compulsion. There is no other way because there's no choice. If I'm not aware, I'm doomed to repeat the same pattern again and again and again and again with all the consequences that it means. So I find myself changing situations with the same result. And I get more frustrated because I don't understand. I mean, I should have done better. I should have done differently. No, if you're not aware why you do what you do, why should you do differently? You just repeat the same behavior again and again. The only way for you to change your behavior is only if you are aware of what is happening inside of you and why you do what you do. So here we come to level 1 of awareness. Level 1 awareness is the maturity and the ability of a person to invest time and energy to look inside, to stop and to look inside, to have my insight, to check my behavior towards myself, my behavior towards the other, and their consequences. So that is to understand that if I see that my behavior, the consequences is destructive, self-destructive, that I lose more than I gain, then I can go back and see what it is. And usually what happens subconsciously, we do take behavior, copy paste from our parents. And how do we copy paste? 180 degrees. For example, in our spouse relationship, every one of us that has a dream of how we would like to have the relationship. So someone else said, I would like to have the relationship exactly like my parents. Subconsciously, we say, I would like to have the opposite, just not as my parents did have the relationship. And what happens usually more of the time, that although I wanted to have the opposite, I do repeat the same pattern again and again. Exactly like my father, or exactly like my mother. And why? How do I know it? Because my spouse says to me, you know, when you behave the way you do, you're exactly like your dad. What? Yes. Then if I am in level 1 of awareness, I can stop reflect, take responsibility, and to see how did I absorb this behavior of my dad and copy paste. Then I can do, when I'm aware, I can choose differently. It doesn't work easy. It's not an easy job, but I can do it. The third level of awareness, that's the most difficult one. Most of the people do not reach that level because the level 3 of awareness is to become aware why, despite of the fact that I'm aware, I don't change. That's interesting. I repeat that. Level 3 of awareness is the awareness why, despite of the fact that I'm aware, what am I doing and why I'm doing, I'm not capable of creating the change. This is something that is so important to dive in. This is not level 3. What are the obstacles? What are the hazards? What are the subconscious symptoms that do not give me the permission to choose freely? And I need to really work in therapy in order to set them free and to liberate them and to really release them so I'll be able to distinguish between the past and the present, and to leave the past as a memory, not as an operating stimuli, and to live present in the here and now. This is the role of the therapist. And I wish all the students, I don't know how much time do I have, but this is the role that I see for the future psychologist. If you can help your clients to separate between the past and the present, and to be able to leave the past as a memory and not as an operating stimuli, then you release and give your clients ability to live the present in a very happy and satisfying way. Thank you.
Thank you so much, sir. Despite of all these issues that we faced, we were definitely able to take away so much from your session. We had this insightful session. Thank you for again logging in and not giving up on us. Thank you so much. And with that, I would like the tech team to present the certificate to sir.
Thank you so much.
This is the certificate that will be mailed to you shortly, sir. And thank you again for being with us this evening.
Thank you so much and for bearing with me with all the interruptions.
It's all our
So,
pleasure.
any questions that the attendees might have, we will forward it to you via mail, and then you can answer them, and we'll send it across to them.
We will
Sure.
mail the questions.
With pleasure.
Yes. Thank you so much.
Thank you so much.
You're welcome.
Over to you, Angela.
With that, I'd like to introduce to you our final speaker for the day, Dr. Brian R. Little. Dr. Brian R. Little is a chartered psychologist and fellow of the British Psychological Society. He is a senior fellow at People Analytics, the Wharton School, University of Pennsylvania. He has been awarded Distinguished Research Professor Emeritus by the Carleton University, Ottawa, Ontario. He is the author of the Amazon bestseller book, Me, Myself and Us, The Science of Personality and the Art of Well-Being, and is very well known for his TED Talk on Who Are You Really, and has been viewed on YouTube and TED platforms over 20 million times. He has been a major innovator in the field of personality assessment and motivation, and is the 2020 winner of the Henry A. Murray Award for Distinguished Research on the Study of Lives. Thank you so much for joining us today, sir, and the e-platform is all yours.
Well, thank you. I'm delighted to be here. And I'd like to thank the organizers who seem to be doing a rather remarkable job in herding all us cats and making sure that we are able to give our presentations. I want to start by mentioning an experience I had when I was teaching a course a few years ago, and there were students who would come in before the class started, and they would, they'd be hanging around, and I'd say, morning, how's it going? And they would say, fine. And the next day I'd say, hi, how's it going? And they would say, fine. And then again, another day. And then one day, I'm really not sure why, I said, no, really, how's it going? And there was a quantum shift in the information that came out from them once they realized that this professor actually was interested in their lives and how they were doing really. And I'd like this talk today, in a way, to be addressed to the students who are going to invest themselves in the lives of a psychologist, which may take the form of clinical work, it may take the form of research. And the field that I represent, which may be underrepresented in the sessions so far, is the field of personality psychology. And as personality psychologists, we are interested in the ways in which you who's listening to this right now, not the person next to you, but you, are like all other people, like some other people, and like no other person. And those different ways of being will be important to us as we try to understand ourselves and as we try to understand others about whom we care, be it personally or professionally. The field of personality has been dominated at various times and currently by what is known as trait psychology. Traits are those stable ways in which we differ from one another. And so it is, in a sense, the way you are like some other people. It has been attacked over the years as being supplanted by situations that we're in as explainers of our behavior. But essentially, trait psychology is pretty robust right now. And I want to give you a very simple introduction to it. And then I want to introduce what to me are some limitations. The title of my presentation is Fates Beyond Traits. And I want to argue that we are not just the victims of the traits with which we were endowed and which developed in coordination with our social situation and so on. There's something more fundamental. But it is helpful to get an idea of where we stack up on these traits to start off our discourse. So the traits that are currently dominant in our studies of personality spell out an acronym. It spells out OCEAN, O-C-E-A-N, and O stands for openness to experience. Those of you who are open to experience, oh, and incidentally, you can assess yourself on a number of devices that are readily available. One that I recommend, I don't know whether this is backwards or frontwards, is called Principles U, and it's just recently put out. You can scan for it, and I'm sure you will find it, and it allows you to plot some of your scores on major personality tests, including one that matters to me, which is humor, which is not in the big five. So the O of openness to experience contrasts those of you who will find out that you are very low in a threshold for excitement about new ideas, new things to explore. You find it difficult not to get excited by things and explore them. Curiosity is absolutely critical to you. And you, there's nothing that seems to escape you. In contrast to those who score low on openness to experience. who are more likely to do the tried and true, not to be particularly interested in exploring beyond their comfort zone, but in a way providing a kind of conservative, we've always done it this way, this is tradition, which in some cultures is valued, and in some ways of living can be very adaptive. So one thing we need to understand at the outset is that these traits of personality are not evaluative in the sense that there are good traits and bad traits. There are traits that function very well in certain kinds of environments. That's important to know. In terms of linking with how does your life go, which is what personality traits are very good at predicting, those who are open to experience are much more likely to be highly creative and will do well in fields that require creativity and innovation. Most of you are going on into psychology. Some of you will adopt fairly conservative patterns in that field. Others of you will be tempted to go out and explore new things, new ways of doing psychology. And there you will be those who score high on openness to experience, other things being equal. The second, the C of ocean, is conscientiousness. And conscientiousness is characterized by a willingness and a capability of getting things done, of being on time, of being reliable. And conscientiousness is a very good predictor of a number of things that really matter to us. For example, it's a very good predictor of success at school. So those of you who have done extremely well at school are more likely to have scored high on a measure of conscientiousness coming from trait psychology. You're more likely to be successful in organizations. So for those of you, and many of our students are now doing this, are going into organizations as organizational psychologists and human resources fields. Those of you who are high in conscientiousness are more likely to do well in those fields. Open to experience individuals are particularly likely to do so in an innovative way, but the conscientious one is likely to do well in those tasks for which there is a correct answer. And that difference in where you succeed and how you succeed is to me quite an intriguing one. It's entirely possible you can be high on openness and conscientiousness, because these are, for those of you who have taken statistics courses, these are orthogonal, independent dimensions. You can be high on one and high or low on the other, and so on, so that they are independent, orthogonal. I like to put this signal up where they're independent of each other. One thing that is not obvious about high conscientious people, their success is perhaps predictable, but is that they tend to be healthier and they tend to live longer. So in terms of what we call morbidity and mortality, those who are low in conscientiousness have a rougher time in the health aspects of their lives. Now, why is it? Why would conscientiousness be a good predictor of longevity? I think it has to do with what we might call therapeutic compliance, the willingness and the capacity to actually carry out health regimens prescribed by your physicians, by your psychologist. So this would apply to your patients. If you have highly conscientious patients, they are more likely to carry out the exercises that you will do when you are working with them in your futures. That conscientiousness is something that can be worked on. There is some capacity for change, but it is pretty deep-seated, and it has plays an important role in how your life is going, not just in the obvious areas of success in your school, in your schooling, and in your jobs, so on. The third dimension is one that I'm going to spend more time on, so I'll just give a brief overview right now, and that's extroversion, introversion, the higher you score on that, the more likely you are to seek out stimulation, particularly positive stimulation. And those who are more introverted are those who tend to avoid that stimulation, tend to back off engagement with others. Obviously, they carry out their daily routines fine, but their preference is for more quietude and so on. And I'll say more about extroversion in a few minutes. Agreeableness, the A of ocean, is a disposition to avoid conflict, to be supportive of others, to be warm. It's not the same as extroversion. It is a kind of lighter and a more congenial friendliness, at the heart of which is a strong desire to avoid conflict and to soothe things over. So if you have somebody in your life who is very agreeable, they're the ones that you like to have in a group, unless you like groups to be battling each other and screaming. The person who is high in agreeableness is the one who says, don't, come on, let's just settle down here and be nice to each other. Those who score very low on agreeableness, those which in the personality scale principles U, we would call tough individuals, can run into their own kind of health problems. The highly disagreeable person is more at risk for certain health issues, particularly relating to the cardiovascular system. And it used to be thought that this was due to the hurry sickness characterized by in type A personalities. Busy, busy, busy. What am I doing now? God, I gotta go soon. My gosh. Is that associated with cardiovascular problems? The answer is no. It is a sub-facet of that is important. It's not hurry behavior. It is the hostility that is underlying that behavior. So the behavioral pathogen, as we call it, in type A behavior or in low agreeableness in the big five is hostility. And that can take a toll on your capacity to cope with various diseases and the particular risk for cardiovascular problems. Obviously, it's not the sole cause. There have to be other structural and physiological reasons why that would accrue into a cardiac state, obviously. But it is an interesting predictor and one we should be heedful of and take steps to avoid therapeutically if it's extreme levels of hostility. Finally, among the big five, the N of ocean is neuroticism. And neuroticism, it's a bit of a misfortunate term because, or an unfortunate term, because it seems to be so value-laden. Who really wants to be called neurotic? I guess there are some who want to affect that as a kind of artistic persona. I'm very neurotic and I'm very precious and you have to treat me that way. But most people regard neuroticism as not that complimentary a term. I prefer the term, oh, I seem to have disappeared from my screen, but perhaps, oh, good. Okay, now I see it. I prefer the term sensitivity. How sensitive are you? What are you, what is it that gets you excited and able to cope? And it seems to me that those who are neurotic have a tendency to see negative things before anybody else. So a highly neurotic person has a predisposition to see in landscapes, such as a group of people, anything negative that might be occurring. is somebody upset in the audience? Is somebody frowning at you instead of beaming at you? The highly neurotic or highly sensitive person is more likely then to respond to that and to avoid interacting until that situation is rectified. Now, we may say, boy, that's not going to be very helpful for individuals in their everyday social encounters. But I wonder if there is a benefit to certain aspects of neuroticism. Isn't it possible that they see things in our organizations, they see things in their lives that actually are threatening, potentially punishing, dangerous? In our evolutionary history, maybe it was the neurotics who were able to spot predators, whereas the more extroverted person, as we'll find out, are more likely to see prey. Yum! The neurotic individual will say, before you yum, look out for that mammoth behind you. So I think each of these dimensions of the Big Five have instruction for us in how to live our lives, and the likelihood that our lives are going to progress well, or they're going to progress with problems along the way. I was going to deal in more detail with extroversion for a couple of reasons. It helps us amplify a few of the key issues that we need to consider relating to the biological, the social, and what I'm going to call in a few minutes the idiogenic aspects of human personality. So let's dip in a bit more into the construct of extroversion. As I mentioned in the brief overview, extroverts are primarily motivated to seek out reward, in contrast to the more neurotic individuals who seek to avoid punishment. And so the highly extroverted person is much more likely to see positive things happening and to enter situations because they see the situation as offering more reward than punishment, even though they may be underestimating the negative cues that are present in that situation. So the extroverts might be seen as being sort of Pollyannish. Everything's pretty good, and I'm willing to risk getting in there because it's not really a risk. Everything will work out just fine. Physiologically, neuropsychologically, actually, they have an interesting. I'm going to illustrate this. I decided not to use PowerPoint because that way you can't see whether I'm being impish or not, and I want you to see me rather than a bunch of letters. So I hope that's okay. But I need a visual aid for this, so I'm going to use this. Okay. When we look at arousal in the neocortex, the more evolutionarily advanced part of the brain, the prefrontal lobes, when we look at electrical activity in there, and I'm going to simplify this a fair bit, we can see that some individuals are aroused in the neocortex and others are less aroused. And there is an optimal level of arousal. If you're over it up here, that's dysfunctional because you're too aroused, you're sort of a bit frenetic and you can't concentrate because you've got too much going on. If you're under-aroused down here, you tend to be rather more sluggish, and you sort of need stimulation to get up to the optimal level. Whereas those who are over-aroused need to lower their level of arousal in order to get down to that optimal level. Now, can you guess who tends to be over and who tends to be under that optimal level in terms of extroversion? Up here, over-aroused, are the introverts. Down here, under-aroused, are the extroverts. So that means the extroverts, in order to get optimal in how they're carrying out their projects and tasks in everyday life, need to get stimulated. And the introverts, in order to get optimal in the way they're carrying out their daily tasks and projects, need to get down that optimal level. Now, you can do this, you can get up or down by the ingestion of certain substances. For example, central nervous system stimulants will be better assimilated by extroverts, a cup of coffee, say, because it arouses them up to a more optimal level. On the other hand, a central nervous system depressant doesn't make you depressed, it depresses your arousal level, such as an alcoholic beverage or something like that, actually has a more facilitating effect for introverts than it does for extroverts. You also notice it just in everyday seeking out of stimulation. If you're driving with somebody in Delhi or wherever you happen to be, perhaps not Delhi, you will need, you will see some people who have music turned up loud, they're speeding, they're waving at people, they're talking on their cell phone, they're talking on their other cell phone. And these tend to be typically the more extroverted people. The introverts are sitting there grimly hoping to get to their destination in one piece. And so you can often find individuals driving themselves to distraction when they have to confront a person who is on the opposite end of one of these normally distributed scales. I should mention that or underscore that these scales are not all or none. It's not that you're an extrovert or an introvert or neurotic or stable. They're on a normal curve. So most people, in fact, would be ambiverts in the middle. And some extreme extroverts, extreme introverts. The same with neuroticism, openness, conscientiousness. These are normally distributed traits. That's important to know because it saves us from putting people into pigeonholes and simply saying you're nothing but a neurotic person. You're nothing but a flaming extrovert. I think it's important that we bear that caution in mind, particularly when I turn the tables in a few minutes and give a critique of the big five. Another characteristic of extroverts is how they interact socially. When I say they, I have to let you know that I am pretty extreme on the introversion end of the extroversion-introversion spectrum. And my students often don't believe me when I say that, but it's true. And many of us are the same, that we may appear extroverted. We may perform in an extroverted way when we're on. Right now, I'm being a professor. I love this. This is my calling in life, is to be a professor, to profess. Notice I have books behind me, and that's my natural environment. And I love to excite you about things in psychology that I find exciting. And so I guess I would prefer to be in the back of my garden alone, reflecting on life and its vicissitudes. But like many of you, you rise to the occasion, you perform, but we'll see in a few minutes, that can take a toll if you're not careful. When we interact, so when I say when extroverts interact, they're sort of fun to watch. I'm not talking about me, I'm talking about the classic extrovert who likes to stand close for comfortable communication. There we are, hello, good to see you. A lot of body contact, we can't do that on this. A lot of mutual gaze, and act in such a way as to what? Increase the level of arousal. Now, I won't say that they interact like that in order not to fall asleep when they're talking to you, but it helps keep them alert and engaged with their encounter. So that's fine. Introverts, on the other hand, prefer to stand back for comfortable communication. They prefer to not have too much contact, particularly in COVID days, God knows. But in part, it's because they can't concentrate on the interaction if there's too much stimulation from, hey, how you doing? the introvert is already over the optimal level of arousal. Now they're going up even higher. So I think we need to be very careful that we understand these subtle differences in the interactional dynamics. One of the interesting things that's happening is that as we learn about cross-cultural differences, there are fascinating differences in the way in which some cultures will interact. Some are high engagement cultures, extroverted cultures, if you wish. And I remember studying these many years ago in England and finding that when you have somebody from an extroverted culture interacting with somebody from a more introverted one, this strange United Nations dance occurs so that the person from the more introverted culture, in order to be polite, keeps going backwards. And the person from the more extroverted culture, in order to be polite, keeps going forwards. And it gives rise to a vector resolution problem, which is typically resolved by the person from the more introverted culture just going backwards and backwards in a spiral motion, finally being breathed upon by an extrovert from another country. So we need to be very conscious that there are cross-cultural differences that impact upon our personalities, so on. We speak differently. Extroverts have a tendency to use more blunt language. Introverts use more parenthetical, contextually complex, contingent, weasel words, more or less, like that. I speak like an introvert. I put all these prepositions and propositions together in a syntactical form that I won't say what I really mean. So what happens when you get extroverts and introverts together? Well, they complement each other with an E rather than an I. Boy, if you're working in a team, again, for those of you who go into organizational work, it's helpful to have this perspective from both of these. And both bring strength. Who did better in our schools? Well, with one great exception, the introverts do better in our schools. Why is this? Because they can sit still. They love to have structure. Extroverts, to learn effectively, need to be engaged. And so if you're working with clients in the future, or now, for those of you who are advanced, and you have a very extroverted client, for them, you need to engage with them in typically a practical way, where you give them exercise and you ask how they did, rather than getting them to reflect and so on in a perhaps more passive fashion. They want to get engaged. The great schools are very, very interesting. The great exception where extroverts actually do better in school is in kindergarten. I'm not sure what you call that in India, but these would be 5-year-olds. And why would extroverts do better? Because they're marked on engagement. They're in the teeter-totter area, the sandbox, teeter-totter sandbox, and so on. Whereas the introverted one is more likely not to engage in engaged activities, and therefore they're seen as not being quite as quick and progressing as well. But then something cruel and unusual happens, and it's called first grade or grade 1, or when the 6 or 7-year-olds go, and that is where the introverts start coming into their own, because they're singing a kind of implicit little song that says, I can sit still, I'm gonna be an accountant, drive a BMW. You can see them already in grade 1 developing this sort of smug appreciation that they're probably going to do better when they get into college and university, and they do. The exception is in laboratory courses, where those who are more extroverted Why? Because they're engaged, tend to even out. They're not worse than the introverts. So they're able to do well because they're mixing chemicals, or they're playing around with various devices. They're proto-engineers about to make their parents proud. And so traits are pretty complex if you start looking at them. Is that it? Is that all we are? Bunch of traits. Remember, this is a no, really, how are you doing lecture. So you, not the person next to you, but you, how are you doing? Are you just your traits? I mean, you may already be saying, wow, actually, I seem to be pretty well summed up by these, and I'm going to take that principle as you and find out more about it and so on. But I think knowing your traits is the beginning, and an interesting beginning, of a conversation. I don't think it's the end of the conversation, not by a long shot. I think in order to understand what we actually are like as a person, you need to understand what I call the personal projects that animate your existence. Not who you are in terms of your traits, but what are you up to? Remember, I said to my students, how are you doing? Well, what are the doing aspects of a personality? And when I asked students, what are you doing? They would say things like, or how are you doing? They would say things like, well, my parents are divorcing and I'm trying to figure out a way in which I can be loving to both of them and as hard as can be. Or somebody else may be saying, well, I've been trying to lose weight for so many years now, and it's hopeless. It's hopeless. And my parents are upset with me. My boyfriend's upset with me. But I'm beginning to think I don't care anymore. And that project of losing weight has become an albatross on my neck. And I just these are the kind of conversations that ensue when you ask a student, no, really, how are you doing? They don't say, oh, I'm an extrovert. They don't say, oh, I think I'm neurotic. They might if they've taken a course in that, but more often they phrase it as an ongoing action sequence. I formally define a project as an extended set of personally salient action in context. So we ask individuals what their personal projects are. We get them to rate those on various dimensions, such as how much control do you have, how much do you enjoy each of those projects. Do you feel really you when you're pursuing that particular project? And we can look at to what extent do your projects conflict with one another. So to what extent is your losing weight project impacting upon your be better for my parents project or my boyfriend project? And you can also see how it interacts with their projects or your organization's core projects. And so this takes us into a different domain of discourse. And I want to use it as an example of how we can often act out of character. So when I say, is that all we are, or these traits, is that all we are? I think a trait psychologist would say, well, hang on a sec. It's pretty important. If you want to know the best predictor of happiness among the various traits, an extrovert who is low on neuroticism has been robustly shown across many, many studies of being happy. But maybe there is more to these outcomes, to these fates, as I call them, the consequences, the consequential outcomes that traits predict. Maybe there's more than just happiness or success. Maybe there's a sense of meaning in your life. Maybe there's a sense of connection with other people, irrespective of your own success. Maybe there is an appreciation of the dynamics and the virtues of tradition, something far more often found in cultures such as in the Indian culture than in others. And so if we understand a person's personal projects, their commitments, their aspirations, from cleaning out the serving tray on Thursday morning, a seemingly trivial pursuit, to the magnificent obsessions of a lifetime, like freeing my people or coping with cancer. I think we get into the depths of human personality in a way that mere traits won't allow us. And in the middle, in between these extremes, there are the everyday acts of acting out of character. I've used the term free traits to describe acting out of character. And I use myself as an example. As I've mentioned, I'm what I call a biogenic introvert. That is, I overload very easily. If there's a distraction, it interrupts my performance, much more so than a more extroverted person would be. Can't take a stimulating beverage late in the afternoon and expect to sleep. But my students certainly see me as very extroverted. You may even see me as extroverted. And it would be cheapening to simply say, well, it's a performance. This is second nature now. But it's second nature, which means that you can be a pseudo-extrovert in the performance of your tasks, but you're still biogenically introverted. You're using a free trait of extroversion instead of a fixed trait of extroversion. And why do we do this? Why do we act out of character? I think there are two overarching reasons. And we can talk about love, and we can talk about work. Lieben und arbeiten, as Freud said. Well, why would we act out of character for work? Well, we act out of character sometimes in order to advance our projects in the workspace. You can't afford to be introverted if you're in a sales company, or if you were an organizational psychologist who's trying to give a presentation to a group of executives who have the attention span of a sparrow. You need to catch their attention. You need to act in an extroverted way. So you are, as Robin Williams called himself, an on-site extrovert. On this particular occasion, you're an extrovert. He was very introverted biogenically, as some of you may know. Can you do this? Sure, you can do it. I've done it for many years, but is it possible that you might pay a price for acting out of character? Contrastingly, is it possible that you are characteristically, biogenically extroverted, but you act out of character as an introvert? You stay in front of that screen all day long. You do nothing but compute, compute, compute. Can you pay a price for that? Or is that something that we can just slip into and slip out of as the occasion demands? Others disagree with me on this, but I think that we can pay a price for this. It's difficult to study it because I think this takes place over a long period of time. I mentioned love. You may be realizing right now that you've been acting out of character for 2 years in a relationship you have where your loved one expects you to act in a way that runs counter to your first nature. Any of the big 5 traits, or big 6, and now humility is an additional one. And I call them big X now because there's always a new one coming. But if you act out of character, I posit that they can take a toll on the sympathetic nervous system, that you can run the risk of burning out. Protractedly acting out of character can lead to us burning out. This would be sort of depressing if I weren't to add that we can also act out of character and run the risk of being burnt out. But if we have a restorative niche to which we can repair to regain our first nature, things can work out very well. So my restorative niche is one I'll be taking advantage of very soon, where I just retire to a nice quiet place. Often it's a men's room, and I've been discovered with my feet up, hiding from my students in the middle of a lecture when there's a break halfway, because I don't want the garrulous extroverts talking to me, or I won't be able to give a lucid second half of my lecture. At the end of the lecture, great. I love talking to them, but not halfway through because I have become relatively incoherent. So in the final analysis, there are fates beyond traits. There are projects that matter to us. And sometimes they engage us in such a way as to have us act out of character. And we should do that because it's characterful to do that. It's out of your comfort zone, but it helps achieve the things that matter to you. Together with one other attribute, I think it's a prescription for a well-lived life. That other attribute is something that to me is precious, and that is the ability to look at centers of levity in your life, as well as the centers of gravity. Levity, laughter, joy, joking, not taking yourself too terribly seriously. I think that dimension, captured in the principles of humor dimension, can keep us all healthy and happy and estimable beings.
Thank you so much, sir. That session was very insightful. And personality is something that we can all relate to, and we see it every day when we interact with people. So this little insight on how to, this will also help us in interacting with other people as to know how their personality is and how they would like to be interacted with, like how you mentioned the extroverted culture and the introverted culture and how they interact. So yeah, that was very insightful. We would take up a few questions now. Ria?
So, hello, sir. So, the first
Hi.
question we have is.
Oh, there you are. Okay.
We are all great, sir, and it's a pleasure to have you here.
I'm delighted. Thank you.
I'll have the first question for you. So we have type A and type B personalities, right? And there's a perception that goes like type A personalities are more outgoing, and people tend to believe that because of their extroverted and outgoing personalities, they tend to be more successful than the type B people. So how can we contradict this myth?
Now, I want to make sure I understand that you're saying you have type A and type B. In our use of the term type A and type B personality, the type A personality is the person who is charged up, gets things done, is working hard and earnestly. And if that's the kind of person you're talking about, in contrast to the laid back, let's just cool it and not worry too much, type B personality. Now, I mentioned that the type A personality can sometimes get into difficulties relating to cardiovascular disease. And one of the reasons is that type A's, and you can see them as being a bit like disagreeable extroverts, they have seem to have a deficit in their ability to read their own arousal cues, particularly in the sympathetic nervous system, not the neocortex now, but in terms of, is your blood coursing? Or have you got sweat on your skin? Are you stressed? And the type A person, unlike the type B, is not likely to notice that their veins are bulging, that they're getting red in the face, that their muscles are tensed, and they're speaking like this instead of like this. And so that has two things. First of all, it can lead to health problems, but it can also lead to success, as you say. It can lead to success in that you get lots of stuff done. However, there are a couple of problems with that. It may compromise your health. That's one. The other thing is that while you may not find that it has a negative influence on you until you have a coronary, other people really find you hard to work with. And so you have a type A person who is, okay, it's 5 o'clock, let's stay for another 3 hours and get this solved, okay? They don't notice that the other people around the table are dying like this, but the type A personality literally doesn't notice when other people are stressed or getting upset or tense. And consequently, while they may get things done, they may lead their teams to be less successful than they would be if the type A person was able to enter into a discussion with an organizational psychologist or with a dear friend or a partner who says, dear, you've got to just ease back a bit. First of all, it's not good for your health, okay? And secondly, you're driving everybody else crazy. That conversation is a hard one to have, but if you're a good friend, you'll be able to do it.
So the next question goes like, does knowing our personality help? Because some people are not quite aware of what kind of personality they are, what approach they have to life. So in that,
Right.
we know what kind of a person we are. Will that help us to go on a path, and whatever we do, can that be done better if we are actually aware of the personality we are?
Yeah. This is a hard one for me, because my obvious answer is, of course, I'm a psychologist. It helps you to know everything about yourself, and traits are really important. But remember, I said that it's the beginning of a conversation, not the end of a conversation. What worries me is when people take some personality tests and so on, our own included, they may put themselves in boxes and sort of pigeon cages. And I don't even think pigeons belong in pigeonholes. And when I hear somebody saying, hello, I'm Stephanie and I'm an extrovert, I want to say, hello, Stephanie, you are so much more than that. You're a devoted daughter. You're an awesome lacrosse player or a lawn bowler, or you make naan bread that makes my grandmother jealous. Whatever it is you do, these are the things I want to understand about you. You don't even fall in love with an extrovert. You fall in love with whoever she is or whoever he is. I don't love the fact that you're a stable, dominant extrovert, Raj. I love you because of the Rajian aspects of your personality, which you share with me and which we'll chart together as our lives progress. So knowing your traits, yeah, they provide a frame within which you can begin to say, wow, I realize now how that project was really hard for me because my attention span is really not very good. And that is probably due to this aspect of my personality. Or because I know I tend to come on strong to people and they sort of withdraw like that because I'm like a hurricane. But that's just the beginning of the conversation. So the complex answer to a simple question is yes, it's helpful to know your personality. And no, it's not helpful if you just stick yourself in the pigeonhole and refuse to fly out of the coop.
So, so there's another question.
Mm-hmm.
Since you said that, neurotism, the people who are neurotic by nature, often, tend to think of the negative things first and
Yes.
look at things from a negative perspective.
Yeah.
Since that is not a very desirable trait, can you move from one personality trait to another by some kind of a training? Or
yeah, that's a really, really timely question, because if you asked a personality psychologist that question 15 years ago, they would have probably said, well, it's traits are pretty well set by the age of 30. Some psychodynamic, psychoanalytic people would say by the age of 6 or 7. But most personality psychologists would have said, no, they would have agreed with William James, who said that by the age of 30, your traits are set like plaster. Well, maybe we're half plastered rather than plastered. And I think that there is now evidence in the last 7 or 8 years in particular that there is what we call volitional personality change is not only possible, but it can be highly successful. There's also deliberate personality change, not necessarily that you initiate it, but that you can get through therapy or counseling, the kind of work that our audience today is going to be engaged in, bless your hearts, for the next 90 years or whatever it might be. And the success in shifting, for example, neuroticism through brief psychotherapy, typically cognitive behavior therapy, but other forms of therapy as well. They don't need to be protracted over years. They can be fairly short. And you can get significant changes in neuroticism as measured by Big 5 inventories through that. You can also change from being an introvert to a more extroverted person. The first thing I would say to somebody who wants to do that is why. Why would you want to be more extroverted? And if they can deduce a good enough number of reasons, that's fine. But I would get them to read Susan Cain's book called Quiet, that talked beautifully about the benefits of being an introvert and the strength of introverts in a world that won't stop talking, which is a subtitle of her book, Quiet. But if they do want to change, you can do it. There's increasing evidence, very reliable, robust empirical evidence that personality change is possible. I guess I hang out with a bit of a warning. I hang out from embracing this totally, because I do think that protractedly acting in ways that go against your first nature may incur a cost. And the empirical evidence on this is really mixed right now. I can't wait to get more research that will examine this. And so everything we do in personality psychology is subject to the constraints of what do the data tell us. And that's one thing I would just love to see the students listening to this get involved in. Even if you go into clinical or organizational work, have a research agenda that you carry along with you so that you can deduce evidence for the validity of your insights by looking at data.
Thank you, sir. So I have a narcissistic personality related question. So is narcissistic personality something that is inborn or innate, or is acquired through we go ahead in life?
Yeah, narcissistic personality. There are different types of narcissistic personality. Some are more dysfunctional than others. I don't presume to weigh in on the clinical aspects. As I say, I'm a personality psychologist, and the clinician is the one who's going to be able to answer questions on the actual psychopathology of narcissism. But in everyday personality terms, narcissists are highly extroverted, disagreeable people. So remember the big five or orthogonal dimensions. You can be highly extroverted, but also very disagreeable. And that seems to be the characteristic associated with being narcissistic. We know that they are characterized by an obliviousness to being corrected. They love to show that they're right. There are a whole bunch of aspects of their behavior that are self-defeating. They regard themselves as far more attractive than they actually are seen to be. And they generally can have some detrimental effects upon social relations. Again, if you're narcissistic at the beginning of a relationship, you can be pretty effective. Narcissists who come into the boardroom to pitch their deals, it can be very, very persuasive, but it doesn't last very long. After a certain period of time, they just, they offend people by constantly being in their face and so self-serving. Okay, I'm ready for my restorative niche. How are we doing for time?
I guess there's room for one last question and then we can wind up.
Okay.
All right. I have a question. So since, at times people often, so people often use terms like introverts and extroverts and hide behind it and justify whatever behaviors that they do and just name it, oh, because I'm an introvert, that's the reason I'm just like it, I can't help it.
Yeah.
So what are your thoughts about that when people use such labels or terms to, not really improve in life, but just to justify their actions?
Yeah. Yeah. I'm not a jerk, I'm just an extrovert. It's my extroversion speaking. Yeah, it's dangerous. I think to hide behind your traits, we might call it the trick of the trait. That it can, I think, illegitimately expunge you from responsibility for your actions. There's a whole domain of behavior in which traits are really not as relevant as to the normal give and take of social interaction. And somebody who says, well, I offended everybody because I speak directly and I'm not afraid to stand up to you guys and so on. I'm an extrovert. I think you can legitimately call a person on that and say, you can't hide behind that. You can't slap me in the face and then say my brain did it. You have more personal responsibility. There are fates beyond traits, and you're not fated to be a jerk just because you have a particular trait. Similarly, an introvert has to be careful that they don't say, well, I'm an introvert, I'm not going to enjoy this party, so I'm not going to go. Some recent evidence, here I'm in Canada right now, my home, John Zelensky at Carleton has done some really interesting work with Deanna Whalen and some others of his then students that shows that when introverts are asked if they would enjoy being in a social gathering, they tend to say no. But if you arrange it in such a way that they go to that gathering, they like it. So they miswant. Use Dan Gilbert's phrase. They're miswanting. They think they want to stay away, but in fact, that's a misconstrual. They're not able to predict and project what their own emotional state will be. And so to blame your lack of socialization on your introversion is a double problem there, because it's sort of begging off for something that is supposedly fixed, which it isn't. But also, you may be cheating yourself from something really meaningful that leads you to grow and leads you to actually have a happy time. And so we need to be really careful when we talk about traits. That's why we need to understand what those projects are that drive our everyday behavior and bring us joy. Okay.
Yes, that answers my question. And with that, I would really like to thank you for taking time from your busy schedule, sir. It's not easy with the whole time difference, and I'm really glad that you said yes to us and came us and gave us this wonderful session. Though as a psychology students, we are aware of oceans and big five personality traits. This session has added so much value with your experiences and the examples that you gave us. So it was a delight to hear you speak. Thank you so much.
Thank you. You guys have been delightful too. I was honored to be asked. Best of luck as you carry on this series, and you're all wonderful. Take care.
Thank you. I would, as a token of our love and gratitude, we would like to present you with an e-certificate.
Oh, that's lovely. Oh, lovely.
Thank you so much, sir.
Thank you so much. Bye-bye.
Thank you to you, Angela.
And I may get some emails from you with questions, but feel free to send me anything. Okay.
Sure, sir. Have a great day, sir. Thank you.
Thank you.
With that, we have come to an end to the last day of sessions today. It is my privilege to propose the vote of thanks on this occasion. To begin with, I would like to thank 3G School of Applied Psychology for providing us with this opportunity to educate and to bring together a community of like-minded individuals to a single platform and discuss such a big plethora of topics to create a sense of self-awareness among our budding psychology community. I, on behalf of Gloria and Ria, are deeply grateful to Irfana and Shahid sir for believing in us and our capabilities and for encouraging us throughout this entire process. I also wish to extend my sincere thanks to all of our guest speakers for believing in our cause and for all of their support and cooperation. I can say with extreme surety that our audience has deeply benefited from all the information, guidance, and resources you have provided us with. An event like this of such high dimensions cannot happen overnight. It requires meticulous planning and execution and an eye for details. For this, I would like to thank my colleagues, Morel D'souza, Ria Khamkar, Jessica Borges, and VL Monfui for their wholehearted involvement to take on the completion of tasks beyond their comfort zone. Next, I think a very important thank you goes to all of our interns, volunteers, tech support, and the comparing team, especially to Litish, Kishore, Abhirami, and Mark for their dedication and commitment to our cause. Thank you so much for your selfless service. Last but not the least, a huge, huge thank you to all of you wonderful participants for joining us over the course of 3 days. Without you, an event of such large proportions would not have been possible. Thank you so much for your constructive feedback and your comments. All of it has helped us make this event into a grand success. For one last time, this is Angela Arikat.
Morel D'souza.
Ria Khamkar.
Jessica Borges.
VL Monfui.
Signing off. Good night and take care.
Thank you. Shahid sir, would you like to add something?
Yes, very good evening, all of us. It's a great moment for all of us. It's a, it's a proud moment, so much of transformation for you, all of the guys. I think these 3 days even gave us I think, amazing ideas to us. Each speakers are awesome, actually. I'm so proud of you, all you guys, especially all the Gloria or Ria or Angela or Pooja, and all the people, especially the tech team, all the participants also. See, this is a kind of one of, you all can be proud of that. You can put it in your CV. You can do, see, I don't think even the kind of event, or many people, many of my friends ask, how you guys are organizing this kind of an event. When we put across, we are getting only 40, 50 people. Your first day is, you got almost 7,000. The second day, the number, I said, this is the, this is not me. It is the new generation, the youth. We have invested on them. We have given them the power to them. You empower them, especially the girls' power. It's amazing. The girls are changing. The new news is that equal opportunity are going to get girls and boys. Future is all about work from home. In our olden days, we will say the early stage, it's all about muscle power. Now it's all about, even like Jack Ma said, that it's all about now girls' power. You guys are going to get an equal opportunity by sitting from the home. Now you can see how much you can impact. It is not to impact to the country, you can impact to the world. You all have the power. Even all the old, even we were discussing with our team members that what kind of a transformation. We all are even scared now, our jobs. If you guys come this way, what about us? All the people, those who are in 40s and 50s, what they can do, you have all the communication skill, you have all the skills. We are really, really proud of you. All the participants, thank you for coming and joining this and give us an opportunity. We all are doing this with, to transform the country, especially in a situation. It is our responsibility. We wake up and speak up, and we need to build our country. Our country is going in a bad situation. This is the time we all to help the government. We will create a social. We are making a 1 million social entrepreneurs. You all knows that the slogan, it is Build India to serve the world. The kind of a chaos is coming. 600 million people in India, 80% of the people are going to lose their jobs. This is where you all have the opportunity to take care of others, make them understand where the world is heading. You can understand all the speakers like cyber security people, criminal, everybody was talking about technology, how the technology is going to change and impact the. We are with you. This is the platform. We want to take the psychology to another level. We all will be proud of one day when education people talk about, it will come to India. When India talk about, they will talk about 3G. So we all are. Thank you guys very much. All the participants, all the people who support, especially the team who organized and bring everything. Thank you very much.
Thank you so much, Sahit sir, for your support. And even Irfana was the one who constantly supported us. And every hurdle we faced, she was there with us, right there to resolve them. So if it wasn't for you, sir, and Irfana ma'am, this event wouldn't have happened. So thank you so much for giving us this opportunity.
Exactly. Like if we would never have known how capable we are if we wouldn't have gotten this platform. So thank you for giving us this platform, first of all, that we could even attempt to try how capable we are and what all we can do actually. So thank you so much for this platform, and really thank you.
Thank you. Thank you very much.
So we are here signing off. Thank you everyone who joined with us for the 3 days program. Everyone who even joined for one session, we are really thankful to you all. And even if we have made a difference in one attendee's life, it matters to us. And we are evidently sure that it's not just one, and a lot of people have enjoyed and taken something out of this. So thank you so much. We are all signing off now. Have a great night.
I'd like all the MCs and the tech team to please switch on your videos so that we can take a group selfie. This is going to be our last day and we
Yes,
meant to
that's
make the
the
most
best
out
thing.
of this.
And let the people know who were behind the tech team. You guys
Very,
need the appreciation for
very
it.
much.
The background crew has to be acknowledged here. Come on, Litish, Kishore, Abhi, Mark. People are leaving. Come on.
Yes, yes, yes. Some people are starting to. Andrew, Sania, Mark, Amanda, Ananya, Fazila, Janvi, Nishika.
Abhi, Mission 3G was Janvi, Fasilat.
Where is Kishore?
Irfana.
Where are you?
Mark is here. Mark can switch on his video. Abhirami is not here.
Yeah, wait for a minute, Angela. Abhirami will join.
I just realized we saw Irfana just once throughout these 2 months. That was for her sessions. And before that, we've only been on calls, right? We have never really seen her.
So you must have seen us three constantly on the screen, but apart from us, these are the people who were working in the background and ensuring that everything goes smoothly. So all thanks to them that we were able to conduct this as smoothly as possible, and they helped us throughout the 3 days with any issues that we faced. So kudos to them as well.
If you can see that all of our sessions started right on time, ended right on time, despite all technological barriers that we may have faced, we ensured that we were not exceeding time. And if we say we start at 10, we started at 10 and we ended at 7:30. And these people are the reason that could happen in such a wonderful, wonderful way.
Panelist early.
Really sorry for
access That is quite normal for us. Don't be surprised.
Yeah, Angela, can you bring the Abhirami from attendees to panelist?
Just I do that.
Yeah.
I think she is joined in as 3G Tech. I'm putting that person here. There is no Abhirami.
Yeah, Abhirami is there. We'll switch on the video.
Where is Mark?
Dude, someone has stopped my video.
Oh, is that why you called me?
What happened?
That's all.
Markana, what happened?
Somebody has stopped his video.
Yeah, 1 minute, I'll check that.
It's done, it's on now. Yeah, perfect. So are you also not joining us for the photo? No problem, we will take one now. Yeah. Screenshot team. Please one without the background. Yes. Because I need to smile properly. Yes, this is better. That cheeks are
One sec. I will check it there. No, it didn't done it.
I did it. I took it.
I also took it.
Okay, done.
Great. Thank you so much, everyone. We being from all scattered parts of India and still we were being able to put this event. It wouldn't have been possible without even one of you all not being there. So thank you so much everyone who has put up the best of themselves for this 3-day event. And I would like to thank Gloria and Angela here because we have been working together since 2 months and we have really cooperated so well. I am proud of us. I'm proud of myself that we did this finally. And yeah, thank you everyone else who is here. Thank you so much. And let's sign off finally.
One last time, tech team. Let's play our videos and then we can end it.
Oh my god. In India, the rate of mental health practitioners is 0.3 for every 1 lakh people as per the World Health Organization.
There is a great gap that exists between the providers of health and people in need.
With this global pandemic, things have gotten worse, and it is predicted that after this, we will be having a mental health.
We are a growing population with complex issues but not enough resources for help.
Psychology is seen as an interesting blend of science and art. It is becoming a popular choice for many students.
However, there exists a taboo regarding mental health and the field of psychology. This prevents a large section of society in urban India from seeking help, while rural India suffers from lack of resources.
The mental health scenario in our nation is highly disorganized to pockets which are inaccessible to the most. The regulatory bodies are not structured either.
All these reasons have added a lot of instability and lack of guidance for students who want to come in the field as well as have a rewarding career.
There's a huge scope and demand in psychology despite what people might be telling you. So come join with us and explore the field of psychology as well as latest trends which you might have never heard before.
I'm super excited to talk about Encyclopedia event. It's one of its kind in the world. It is designed by the student for the student. There are eminent speakers coming from the various field of psychology to discuss, to answer all your kind of a question, whether you are a PhD student, you are a UG student or PG student or school students.
Okay, bye.
Bye all.
Okay, good night, everyone. Take care.